I'm Rebecca. I'm trying to learn medicine today, Achalasia of Cardia and acid regurgitation. And after we've done that, we're gonna do leg injury prevention training. And if you participate in the leg injury prevention training, then it's at your own risk. We're talking about internal anatomy, illnesses, and this is no medical advice, we're just learning about it. And this is part 2 of included of a joined together part of Achalasia of Cardia and acid regurgitation. Now we want to make a presentation and saying Achalasia of Cardia versus acid regurgitation, or maybe also that. Okay, what do we say to the symptoms? So first, by Achalasia of Cardia, after the swallowing, the peristalsis movement doesn't properly push the food down into the stomach. The sphincter at the end of the esophagus is too tight and the food doesn't come into the stomach. Acid regurgitation, where the muscles at the lower end of the esophagus are too lax and the food and also the stomach acids can come back into the esophagus. And that can cause acid regurgitation, can cause peptic and reflex esophagitis. Anything more? And stricture esophagitis and Achalasia of the Cardia with a feeling of a food stuck behind the breastbone can because the food can be then breathed in into the lungs, pneumonia and bronchiectasis, and also an increased risk of esophageal cancer exercise. Symptoms. Acid regurgitation has just a burning sensation behind the breastbone. Taste of food and acid, maybe. Burning sensation, more burning sensation behind the breastbone and more taste of food and acid. But I'm not sure. Burning sensation of food and acid and Achalasia of the Cardia, that is more feeling of food stuck behind the breastbone. Difficulty in swallowing, chest pain. Okay. Complication treatment in the home. By both is it advised to eat small meals seated. Achalasia of Cardia, there can be made a cut into the sphincter to let food better pass. Do the people after they had the Achalasia of Cardia surgery at the sphincter with a cut then acid regurgitation? What if the two diseases is more severe? Maybe it's individually, but in general. Okay, I think we have it. Let's try it, and when we're gonna see it is advised to take smaller meals and eat seated up. We don't want to end on that, because this is not about the symptoms, this is about more the cause of it, more of the disease itself, not a little bit the disease itself. Let's just try it. Facing camera, I'm going to start now. And let's start. Achalasia of Cardia and acid regurgitation. Achalasia of Cardia, where after the swallowing the peristalsis movement doesn't properly push the food down into the stomach. The muscle sphincter at the end of the esophagus is too tight and the food cannot pass into the stomach. By acid regurgitation, the muscles at the lower end of the esophagus are too lax and the food and the acid content of the stomach can come back into the esophagus. Acid regurgitation has more of burning sensation behind the breastbone because of the acids. It was in the stomach. And also taste of acid and food. Achalasia of Cardia, more of food stuck behind the breastbone. And acid regurgitation can then lead to peptic and reflux esophagitis, and that is also stricture of the esophagus, and that is esophagitis that is inflammation and ulceration of the lignin of the esophagus. And the other one, achalasia of the cardia, that can cause, because the food can be breathed into the lungs, bronchiectasis and pneumonia, and also an increased risk of esophageal cancer as well. All over here, there's advice to take smaller meals seated. And that is according to Keith Hodkins, Family Medical Advisor, page 60 and 61. This is no medical advice. There's a lot of information, so I don't think it is a problem that I'm a bit slow. I stop for a sec. And I have a second from running, and now we're going to do the other thing, which is the leg and different routine. So, that means if you're here for medicine and you want to do the thing after cataract and alphabetical order, then you can go directly to the next part of medicine, where we have the next thing about medicine. We will do now the leg injury prevention training. If you stay and participate in the leg injury prevention training, then it's within the honors. We're starting with bringing one leg up, the mushroom, the pointing of point. We're continuing with bringing the other leg up and with pointing of foot. And now take the leg at the ankle. Make a straight back. And point with the knee down to the floor. Crane. Now take the other leg at the ankle. Make a straight back and point with the knee down to the floor. To the next exercise, the direction boy. One leg up into the right finger, arms out, and you're bringing them over to one side. And we're going back into the middle and over to the other side. Back in the middle, and we're changing the same with the other leg. Bring the leg up, hands out, and bring them over to one side. Over to the other side. Back in a little and down. And now one leg up again. And out leg to the side. Pie and back row, breathe again in. Out into the middle and down. And another time, leg up, breathe in. Out leg to the side. Breathe again in. Out in the middle. Down. Other leg up, breathe in. Out. Again. Back in. And down. Lower. Again. Out. Breathe again in. Out in the middle. And down. Next exercise. Slash and backslash. Leg up and we're pressing the inside against the knee. Right angle of the leg, flex foot, even line tips taller of the back, little bend in the other one. And the other angle. And press on the inside. Right angle of the leg, flex foot, even line tips taller of the back, little bend in. And to the next exercise. One more like that, leg up and we're pressing with the knee up to the side. And now with the other knee. Knee up. And the knee presses up the side. And to the next exercise. To the stand. Knee up and knee down. Knee up and down. And the other knee up and down, up. And now you can continue with the step, or you do the horse, knee in, out, in. And up the other leg. And now You can do the horse overstand. We're doing the camel knee up, downward step. We're doing a movement with the whole body. And with the other leg. And the last exercise, the trunking contract legs by the parts. We breathe in, going down. And breathe out. Again, in. Out. Out. Breathe in across the legs. And out. That was the leg intervention training. Thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine today, cat scratch fever. And after we've done it, we're going to do standing yoga. And if you participate in the standing yoga, and I said at your own risk, we're talking about illness and also scars, skin things, dermatology. And this is no medical advice. We're just reading about it. Cat scratch fever. A rare disease affecting all the systems of a body. It may follow superficial damage to the skin from a cat bite or a scratch from a cat or a fawn. So just a fawn? Do we mean just like do we call it? The branches sometimes have like a rose. Symptoms. A few days after the scratch, a small blister containing pus develops on the site of the injury. Between 2 to 6 weeks after the injury, the site becomes painful and swollen. Now it gets interesting. Okay, but just medically. A few days after the scratch, there is a small blister with pus and develops. And after 2 to 6 weeks, at the site of the injury, it becomes painful and swollen. Lymph glands that drain the site of the injury may become inflamed and swollen with pus, sometimes with serious abscesses. I don't know where the lymph glands are, what we're talking about. There may be a slight increase in temperature, with headaches, chills, tiredness, and a general feeling of ill health. Sometimes a rash appears on the hands and feet. Duration. The disease can last from 2 weeks to several months. If serious abscesses develop in the lymph glands, a long period of convalescence may be necessary. Causes. The exact cause of cat scratch fever is unknown, but it may be a virus. And why is it now a fawn? Because the fawn had previously scratched a cat which had virus. What do you think of what ways the cat can transmission the virus? Are there maybe other animals who can transmit it? Maybe like the fawn after having eaten the cat. Whatever animals eaten our cat. The exact cause of cat scratch fever is unknown, but it may be a virus. Treatment in the home. Follow normal home treatment for fever. Rest in bed, a light diet and large quantities of fluid. When to call the doctor? If a pus-filled blister develops on the site of the injury and becomes painful and swollen. Okay, if there's a scratch or bite of a cat, it would be interesting if there's any type of other animal. There's certainly another type of animal which has it. Because then we could just examine all the animals and then we could find who has the virus which no one else had. If a pus-filled blister develops on the site of the injury and becomes painful and swollen, then visit the doctor. What the doctor might do, as cat scratch fever is not a condition that can normally be diagnosed by the family doctor, he or she will send the patient to hospital for tests. At the hospital, the doctor may take a sample of tissue from the blister for examination under a microscope in the laboratory. It may become necessary to drain any abscesses that form in the lymph glands. And again, this book is from the 80s. Maybe some things are outdated and all the people know what it is for. It may become necessary to drain any abscesses that form in the lymph glands. Outlook. Cat scratch fever usually clears up spontaneously within 4 weeks. I don't understand cat scratch fever. I mean the virus. I don't understand the nature of the virus. It would be interesting if only wild or house or domesticated cats or home cats have it, pets. But I think we're talking about domestic home cats. And then also how long can the cat transmit it? I think that's very interesting. Far beyond our just cat scratch fever, the viruses, I think, interesting. No, that was cat scratch fever. Cat scratch fever. If you were here for medicine or cat scratch fever, then you can go directly to the next part of medicine. Did I say it? To medicine, we will do now the standing yoga. If you participate in the standing yoga, then it's better the arm. Good is if it stands, the feet are standing together. That's not so good as the feet are standing together, we're breathing in, lifting the arms up. Ears raised. And breathe out the arms again down. Again in the arms up. And out the arms down. And now to pull these off the side. We can lift the arms and out of arms to the side. We begin to the arms up. Open them to the other side. We fill it up. Out and lean back for cripples in the morning, draw the shoulder blades together. Again in and up. Out and back, draw the shoulder blades together. In and up, make an inch space between the toes, the height and seek between the feet, the hide and seek playing palm tree. Up the arms to the side, breathe out, breathe again in the arms up. And out, sink down into half chair. Out, open the arms to one side. Breathe again in the arms up. And out, sinking again down. And up. Hands to touch and lean back, the feet in front. Again in. And out, lean again. Again into the middle. And out, the arms down. We're leaning onto our knees, standing cat and cow. Breathe in. And out, make it round back. Then a heel of the back of the cat. Breathing into the middle. And out now a cow. Make a belly back. Again into the middle. Breathe out, a heel of the back of the cat. And into the middle. And out. There. Again in. And out, we're coming with a jump back up. And bringing the arms again up. And out, we open them to the side. Again into the middle. Now out, the arms on the sides, down, we're going down into the chair. Breathe in, come halfway up. Come high up. And out, and we're coming up. Breathing in, reach high. And out, open to one side. Breathing in, up. And out, we're sinking again down into the chair. Breathe in, come halfway up. Higher. And out, and we're coming up. Now across the arms, intertwine the fingers. Breathe in and reach high with the glue. And breathe out, reach around. Hold the back, the drill. Again in the arms up. Now across the arms, intertwine the fingers. We are ready now. Breathe in, reach high. Breathe out, reach in front. Hold the back. Again in the arms up. And breathe out, come up with the zip toes. And sink down into the foot chair. And breathe again in, come up, on the toes. And breathe out again. Again, in and up. And out, the arms of the sides down. And the arm down. Now we're doing the marmot. Breathe in a bit, right leg. And breathe out and stretch with left leg. Breathe in, change. And then out and stretch with right leg. Breathe in, change. And out and stretch left leg. In. And out and stretch the right leg. Both legs against the river and breathe out. Now the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder, the right hand. Breathe in, take the arm again in. And breathe out and again down. Now breathe in and lift the left arm up to the sky. Breathe out, bend the right knee and look over the left shoulder to left hand. Breathe inhale again down. And out and down. Now we're doing the pelican. Make a hand with space between your feet, shift the weight to the heels, and breathe in and come down. And out and up. Again in and down. And out and up. Again in and down. Out and up. And the last time, in and down. And out and up. Now the trebuchet is counterweight. Take hold onto the elbows with the hands and gently swing from side to side. And hands down and feet again together. Breathe in, come halfway up with a straight back, monkey half lift. And breathe out again down. Breathe again in, straight leg, monkey half. And out and down. Now breathe in, the upward swan, arms off the sides up. And again down. Now we're going to do the sun god, legs wide apart. And we're breathing in, lifting the arms up. And breathe out, sinking down. You can come up into tiptoes. And you can breathe in and pretend to push something imaginary up. You can stay also flat foot. Again, in and up. And out and down. In and up. And down. In and up. And out and down. Now, modified garland pose. Toes open to the outside. One and space between the heels. Breathe in, lift the arms up. And breathe out and we're sinking down. Place the elbows against the inside of the leg. Now we're breathing in. You can do this version. And you can do now breathing out and go up of the back. Then again in. Back into the garland pose. Now you breathe in. Or you do the second version. And you breathe out and you come up in one straight line. And again in. And breathe out, back into the garland pose. And breathe again in. And out we're coming up in one straight line. You can go also back up with the back. And the arms up. And out and down. One more time, breathe in. And out, you can come up, tuck the pelvis in, come up in one straight line. Or you go up with the back, and the arms down, breathe in, the arms up. And out, back into the garland pose. Now all together, breathe in, straight back. And out we're coming straight up. And now we're doing that stretch of Venus. And 20 fingers behind the back and bring them over to one side. Breathe again in. And out, turn the head over to one side. And the chin down to the clavicle. Now breathe in. And out and pull the arm and the shoulder in. Breathe again in, lift the gaze. Turn the head over to the other side and bring arms over to one side. Breathe again in. And out, head down, chin down to the clavicle. Try to remember the exercise. Breathe again in. And out, pull the arm into the shoulder down. Breathe in, lift the gaze. And you can do it now another time, or you do the diver, which is a lot for the back. Legs wide apart, arms up to a T, breathe in. And if you want to try it with your back at your own risk, you go down, straight back, make a round back, this can go onto the back, and you come with the crown of the head first up. Or you continue with a stretch of Venus. Another time, breathe in. Lean forward with a straight back, this can go onto the back, make a round back, come with the crown of the head first up. And the last time the diver, breathe in, bend forward with a straight back. Make a round back. Come with the crown of the head first up and down, and we're ending also with a stretch of Venus at the belly. And we're ending with your cashew almost ending. Intertwine the fingers behind the back, feet is in paper tone up, straight back, breathe in. And out, head over to one side, chin down to the clavicle, and pull the hands down to the ground. Breathe in, lift the gaze. Turn the head over to the other side, breathe again in. And out, bring the chin down to the clavicle and pull the hands down to the ground. Breathe in, lift the gaze. Turn it back into the middle. In the sky hug. Breathe in, lift the arms up. And breathe out, lean back, long arms. Again in and up. And out and lean back. Again in. And out the arms down. Doing the eagle swings. Breathe in, lift the arms up. And out the arms down. And up. Now the cactus collecting its stings in the evening. Breathe in, lift the arms up. Bring the hands to touch. And lower the hands down to heart center. It was the standing yoga. I thank you very much and until the next time. Hi and welcome. I'm trying to learn medicine, today cervical cancer. And after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And we're talking about internal anatomy and diseases, cancer, and this is no medical advice, we're just learning about it. Cervical cancer. That is a malignant growth in the neck of the uterus, the womb. This is relatively rare, but where it used to affect mainly women over 35, it is now occurring in younger women. This book is from the 80s. The cause of this is uncertain. Increased use of contraceptive pill may play a part. But okay, this book is from the 80s, so maybe we're so vague about it. Okay, cervical cancer, that is a malignant cancerous growth in the neck of the uterus. Symptoms. Okay, we're also talking now about more medical aspects, blood and so on. Symptoms. Bleeding between the periods, bleeding after sexual intercourse, bleeding after the menopause. Unexpected vaginal discharge, which may be brown and offensive smell. Okay, bleeding when it should not be. So a part of the periods and also after the menopause cannot happen. And smelling of a vaginal discharge, which is offensive and may be brown. Duration. Until the condition is treated. Does it last? Causes. The risk of cervical cancer is increased by promiscuity, particularly if sexual activity is... Okay, we're talking so also about these things now. Particularly if sexual activity is unprotected by condom or shell. Okay, we're saying intercourse with multiple partners, unprotected, is a risk factor. Intercourse before the age of 18 is also associated with a greater risk, and again, this book is from the 80s. Intercourse before the age of 18 is also associated with a greater risk. Complications. Cancer may spread from the cervix to other organs. Treatment in the home, none is possible. When to consult a doctor? Immediately there's any unexpected bleeding or discharge from the vagina, either before or after the menopause. So if there's bleeding, which should not be at the time. What the doctor might do, carry out an internal vaginal examination and take a cervical smear. Okay, a probe and examination. Arrange an examination by a gynecologist who will examine the cervix. He or she may then be able to destroy abnormal cells by laser or freezing. Again, this book is from the 80s, but still, for laser and freezing. Okay. In advanced cases, hysterectomy or radiotherapy will be necessary. Prevention with radiotherapy, but it's radiotherapy. Prevention. Regular smear tests every 3 years. That is enough. It is interesting. And it can be treated oftentimes through laser and freezing. And every 3 years, just a test. So regular smear tests every 3 years, especially for those taking contraceptive pills. Outlook. Before cancer develops, cells in the cervix are in the precancerous state, which can last for up to 10 years. Let's read that again. Before cancer develops, Cells in the cervix are in a precancerous state, which can last for up to 10 years. No questions aside, are there other types of cancer where years earlier the cells are in a precancerous state? These cells can be detected with a cervical smear test, and if treated at this stage, the prospect is very good. Once cancer has developed sufficiently to cause symptoms, the chances of complete cure are reduced, hence the importance of regular cervical smear tests. Okay, cervical cancer. That is cancer of the neck of the uterus. If it is detected, so we are advising to make a test every 3 years, before it has really developed, and it has developed with the symptoms of bleeding which shouldn't be at the time, and also maybe brown discharge and offensive smelling of a discharge, then the treatment should be quite good. If not, it is worse. Okay, that was the medical part. If you are here for medicine, you can go directly to the next part of medicine. If you are here for a short medical training, you can stay and participate, but if you do so, then it's better to home risk. Goodness in sense, and we're doing shoulder circles. We come back, up, and short, and down. And now backwards. Last time. And now long arms with strong fists, and go as far back as you can with the shoulders. High up and in front, and down, again back, up, and front, and down, and now backwards. Up, and back, down, front, up, and back, and down. Now the accelerating motorcyclists. Go a bit into the knees, legs wide apart, hinge forward with a straight back, let the arms hang, and pinch the scapulars together with the pedal. Make fists, lift the arms up, and pinch the scapulars still together. Lift the arms down, and shoulders, and another turn. And now make fists and lift the arms up and pinch the shoulders together. The arms up. And next exercise, the sheet jumper. A bit into the knees, hinge forward, fist and leverage around there, lift the arms hang, make fists, turn your fists to the inside, lift the arms high up and bring them together. Straighten up, bring the shoulders down and together. Arms high up and together, shoulders down and together. And release. And the second time. Into the knees, hinge forward, with the round back, the arms hang, like this. Arms to the inside, arms are up and together. Straighten up, bring the shoulders down, together. Release. And now, just lift the arms up. If this exercise causes pain, then don't do it. Just to listen a bit. And also to observe if a shoulder impingement happens when the arms are lifted. And now the arms to the side and together. Observe what the scapulars are doing. We should go now together and a bit to the outsides of the ribcage. Together. Next exercise for the left arm. Go to 7 cents, shoulders a bit back, tall up, long arms, strong fists, bring the shoulders down and together. Now turn the arms to the inside with Addison. Arms to the inside, shoulders down, together. Arms to the outside, shoulders down. And arms to the inside, shoulders down, together. Arms to the outside, shoulders down, together. And to the next exercise. Arms to the outside, a bit in front, turn the arms in front, shoulders down, hands together. And arms back, shoulders up and in front. Arms in front, shoulders down, hands together. Arms back, shoulders up, front. And to the next exercise. The shrug. You lift the arms up. And shrug the shoulders up. And release all down. Again, in the arms up. Push. And down. Like that. Breathing is necessary. Just the arms up. Shoulders up. Down. Now the pretzel curl. Arms together. And it down into the outside. And back. And then also last time. And now with some diet. You can also use a tennis ball. Have it with a long arm at the outside. Let it fall down. And try to catch it again. And on the outside. And now the stretching. One arm in front, the shoulder is back, hands down. Pull the arm in, have flat fingers. Try to relax the arm. Go with the back of the shoulder. Turn the palm up to the sky. The other arm in front, shoulder is back, hands down. Pull the arm in, have flat fingers. Try to relax the arm. Go with back of the shoulder, turn the palm up to the sky. And that was the stretching. So this was the whole shoulder pain training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, cervical erosion. And after we've done it, we're going to do shoulder impingement. No, we're not going to do shoulder impingement. Neckstretching. And if you participate in the neckstretching, it is at your own risk. And this is no medical advice, we're just learning about it. And this is about a medical condition and bad medical condition, and also internal anatomy. And this subject is not a family-friendly subject. Cervical erosion. An alternation in the outer covering of the cervix, the neck of the uterus. Okay, the outer covering of the cervix is alternated. It changes from its normal pink, smooth condition to a red, grace-like one that often oozes a slight discharge. Grace? I don't know the word grace. Okay. The condition is very common, particularly in women who have had children. It is harmless and never leads to cancer. Symptoms. Many women have no symptoms. The erosion is only discovered after routine internal examinations. We call it alternation in the outer covering of the cervix, but it must be a little bit more than just a color change. In others, there is a yellow, green, or occasionally brown discharge from the vagina and occasionally low back pain. That is interesting. Now, the book is from the 80s, maybe something has changed, but it would be interesting if at the list of things which can cause lower back pain, at the one point cervical erosion would be standing. So it must be more than just a color change. When you consult the doctor, if you have the symptoms described, which were that there is yellow, green, or brown discharge from the vagina, what the doctor might do, carry out an internal pelvic examination and take a cervical smear to exclude the possibility of cervical cancer. cauterize the area of erosion. This is a painless and quick procedure. Cauterize. Prevention. There are no means of preventing the condition. But what I said, it's particular in women who have had children. There are no means to prevent the condition, and outlook, in most cases the affected area returns to normal naturally. In others, cauterization heals the area. It goes back to normal. But it can cause low back pain. Now let's go to a few things more interesting. Let's go to the part of the low back pain. Occasionally, low back pain the question is the low back pain from cervical erosion or for something else? Which goes along with cervical erosion, but which is cosmetic. And the other key points were that it does never lead to cancer, and the affected area returns to normal naturally, or through cauterization, whatever it is. That was a cervical erosion. If you were here for medicine, you can go directly to the next part of medicine. And again, this was a little bit like medical advice. This is no medical advice. I just read what is written in this book from the 80s. Normally talk about it. So if you were here for medicine, learning about medicine, not for medical advice, learning about medicine, then you can go directly to the next part of medicine. We are doing the Neckstretching. If you stay and participate in the Neckstretching, then it's with any arm risk. Golden still in sense, legs a bit over the shoulder for part, and we're doing the Hydro Tower. We're breathing in, lifting the arms up, and we're reaching with the fingertips as far as we can. Again, I don't want to say it. If you participate in this, then it's arm risk. And again, down and reach as far as you can with the fingertips. And again, up and reach as far as you can with the fingertips. Then again, down and reach as far as you can with the fingertips. And now a similar exercise. Now arm circles, the arms in front, and again, reach as far as you can with the fingertips. And not just to the side, but also back, reach as far as you can. Down and reach in front as far as you can. And now, Pusat, the feet are standing together, arms up to a T, and now with our wings, not a T, and we're pretending to fly like a Pusat. The Pusat flies slow. And the next exercise with police officer, we're breathing in and lifting the arms up. And out, we're opening the arms to the side, lifting the arms up. Out, open to the other side, lifting the arms up, and out and down. Now the legs shoulder wide apart, we're breathing in. We are tall up, having the shoulders back. And out, we bring the head over to one side. Breathing in. And out, bring the chin down to the clavicle. Lower back. And breathing in, lift the gaze. And turn the head over to the other side. Breathe out. Breathing in. And out, chin down to the clavicle. Breathing in, lift the gaze. Turn the head again over to the other side. Now breathe in. Breathe halfway out, and then go in a circulatory movement over to the other side. Breathe again in. And out again in this circle movement over to the other side, after having breathed out half and into it. Now our feet standing together, and we're doing the crab in the morning. We're breathing in, lifting the arms up. And breathe out, lean back, draw the shoulder blades together on the chest to the sky. Again, in the arms up. And out and down, draw the shoulder blades together. Again, in and up. Bring the hands to touch, and now lean back, breathe out. Read in the wind. Middle. And breathe out, lean back. Again, into the middle. And out now lean over to one side with fur in the wind. Breathe again in. And out over to the other side. Again in. And out and the arms down. And now we'll fly, the hands together, the elbows together, tall up, and lift the arms up, and keep the elbows together, as far as you can come with moderate effort. And release again. That's another time. Up. And again down. And now, lay one hand on top of the other one. Tall up, breathe in. And out, reach in front. And bring onto the head down, reach in front, bring your shoulders in front. And again up. And out, reach again in front. Bring the head a bit down. Again up. And on to the next exercise. A combination of the three exercises. We're breathing in, lifting the arms up. And then we're breathing out, leaning back, drawing the shoulder blades together. Grab in the morning. The second exercise was screw, intertwine the fingers across the arms, reach high. And now the drill, breathe out, reach in front, hold over back. Again, in up. Out, lean back again, we grab in the morning, draw the shoulder blades together. Again, in and up. Again, in and up, across the arms, intertwine the fingers, reach high. And out in front, hold over back. In and up. And out of the arms down. And now the cashew. Feet are standing together. Intertwine the fingers behind the back. Tall up, shoulders back. Breathe in. And out, bring the head over to one side. And the chin down to the clavicle. Breathe again in. And out. Pull the hands down to the ground. Again in, lift the gaze. And out, bring the head over to the other side. Tall up, shoulders back. Chin down to the clavicle. Breathe again in. And out. Pull the hands down to the ground. Again in, lift the gaze. Bring the head back into the middle. And now stretch of Venus. Legs shoulder wide apart. Intertwine hands back and back. Bring the hands over to one side. Tall up. Breathe in, shoulders back. And out, turn the head over to the side where the hands are. And the chin down to the clavicle. Breathe again in. And out, pull the arm and then the shoulder down. Again in, lift the gaze. Out, turn the head over to the other side. And also the hands over to the other side. Breathe again in. And out, lower the head down. Pull the arm in and the shoulder down. Again in, lift the gaze. Turn the head back and now the feet staying together. So breathing in, lifting the arms up. And we're breathing out, we're leaning back with long arms, this time the sky hugger. Feeling again up. And out, lean back. Again. Out the arms down, and we're doing eagle swings. Breathe in, lift the arms up. And out the arms down. And in the arms up. Now the arms down. And we're ending with a cactus connecting its stings, breathing in. Bringing the hands to touch and bringing the hands down to heart center. That was the neck stretching. I thank you very much and until next time. I'm Rebecca. I'm trying to learn medicine to treat cervical rib syndrome. And after we've done it, we're going to do standing yoga. And if you participate in the standing yoga, then it's at your own risk. And we're talking about internal anatomy and so on. And this is no medical advice, we're just learning about it. Cervical rib syndrome. Some people are born with an extra rib positioned above the normal rib cage at the base of the neck. So here. Okay, an extra rib at the top of the neck. It is known as a cervical rib and generally causes no problem of any kind. Okay. In a few cases, however, the rib may press on the nerves in the neck and produce an aching pain down the inside of the arm. Okay, there's an additional rib, and sometimes it makes problems because the rib itself presses onto something. So the rib itself is again no problem, but it presses onto something. I had with the acoustic neuroma. There was a tumor, a non-cancerous tumor on the acoustic nerve. And the tumor itself was no problem, but the tumor could grow and then press onto the brain. The size was a problem. Now, and the rib is not a problem because it presses against the nerves. It can happen by cervical rib syndrome. This is likely to happen when heavy weights are carried in the hand or when the sufferer is tired. That is interesting. The Now I don't know the anatomy behind it, but if someone carries a heavy weight, okay, maybe, and if someone is tired, I would know no reason. I would want to know the reason for that. For tiredness. A slight numbness or weakness may also develop in the hand itself. Numbness and weakness in the hand, just because the nerve is impinged. I think that it would be, here again, the question why, but if it is just because the nerve is impinged, it is interesting. A weakness in the hand muscles developing so permanent or over a long time because the nerve is impinged. If a nerve is impinged, things doesn't work. What if someone has somewhere a nerve impinged? And that then results in weakness somewhere in the muscle. And that, no matter how much the person now does whatever physiology, whatever training, whatever exercising, leads to an imbalance. And that causes then further problems. Just the idea, what if someone can have an imbalance in muscles and then resulting problems out of it because the nerve is impinged? An effect may also be felt in the eye. The lid may drop and the pupil becomes smaller. I think also because of the nerve. Okay, the lid may drop down and the pupil becomes smaller. If you notice such symptoms, report them to your doctor. He or she may recommend X-rays to find out whether a cervical rib is present. I'm just thinking about it. What would happen that the doctor would think about if someone has a lid falling down, the small pupil, what is it called? Pupil. Hey, let's check how many ribs you have. I'm in a way I hope that people have read this book, but just the idea someone has a falling down lid. I don't know how it actually looks at the levels, but and now let's check how many ribs you have. and imagine that's the reason. Imagine no one looks at it. I hope that people know that of cervical rib syndrome. It sounds so much that I think that people hear once of it and now for the rest of their life, and then maybe even think of it. But just for the patient, imagine when you told let's check your ribs, but also the other way around. Imagine it is that reason. You can search forever if you don't know it. If you notice such symptoms, report them to your doctor. He or she may recommend X-rays to find out whether you have a cervical rib is present. So it's not to find out just from the outside. Whatever. With an X-ray, people can look if you have a rib too much. Though in most cases the symptoms will have resulted from some other cause, such as cervical spondylitis or carpal tunnel syndrome. Okay, the symptoms of the weak hand or so on will be probably from something else. But the things I said, the weakness in the hand or nerve, I mentioned we have the weakness in the hand and also falling down lid. Because this is the most interesting part, because no one would think about it. A weakness in the arm, okay, let's look where the arm goes, but who would think of a lid? That the eye has a problem. A smaller pupil. It is probably from something else. But that can be also do with This is no medical advice, we're just learning about it. I think it becomes obvious. Pains in the arm may also result from a nerve getting trapped by a neck muscle. A neck muscle itself can trap a muscle can. I never really thought of it. What is trapping a nerve at all when a nerve is trapped? What is it even? It is not a bone, maybe it's a bone, but it's a muscle. I never heard someone say that I have a nerve, doesn't usually, the feet are usually have impinged my nerves. A muscle is impinged. It is such an idea that a muscle can trap a nerve. Pains in the arm may also result from a nerve getting trapped by a neck muscle. However, if a syndrome is confirmed and symptoms are severe, the doctor may recommend that the cervical rib be removed by surgery. The operation usually results in a complete cure. But I heard that operations are a bit complicated. Okay, cervical rib syndrome. That are people who have, it's the cervical spine. Cervical erosion, cervical cancer, cervical spondylitis. We have to get a bit closer about these names, about the naming of them, because now if it has something with the regions to do, with the cervical spine and so on, why is it not cervical cancer and cervical erosion? It seems to be more internal of the body. It has, not, and for me, not so much to do with cervical erosion. I don't know what I said or what they are about the body and so on. Cervical rib syndrome. Okay, cervical rib syndrome, that's when rib too much at the neck, and that can impinge a nerve, and that can lead to numbness in the arm, tightness in the arm, and also a lid falling down and the smaller people. And if an X-ray says it is the cervical rib syndrome, the reason, most of the time it is something else, then if it is severe, the rib can be removed. And that was the medical part. If you were here for medicine, you can go to the next part of medicine. We're going to do another stand. If you stay and participate in the stand yoga, then it's with the arms. Good and step. This is not a good and sit stand. Have feet standing together and breathe in and lift the arms a bit of the swings. And breathe out the arms again down. Again in the arms up. And out the arms down. Again in the arms up. And out the arms down. Again in the arms up. And out the arms down. Now the police officer, breathe in the arms up. And out open to the side. Breathe in the arms up. Out open to the other side. Breathe in the arms up. Make it a space between the feet and breathe out, open the arms to the side. Breathe in the arms up. And out we're sinking down, height and seek playing part. Breathe in the arms up. And out open to the other side. And in the arms up. And out the arms down. Again in and up. And out we're leaning onto our knees. We're doing the standing cat and cow breathing. And out make a half of a backward cat. Again in and up a little. And out we're making a valley with the back, cow. Again in. And out around back, cat. Again in. Out the cow. Again in. And then we'll come with around back up and make it with the backward shoulder. Again the arms up. Out open to the side. Again in. Out open to the other side. Again up. And out open to one side. Up. And out we come down into the chair. Breathe in, come halfway up. Come higher. And out, now we come right up. Breathe in and reach high. Breathe out open to one side. And breathe up. And out we come down. Breathe in halfway up. And out we come right up. Now cross the feet again and lean back and draw shoulder blades together. The crab in the morning. Breathe in the arms up. And out again down. Okay. Hands together. And lean back, the reed in the wind. Breathe again in. And out and lean again back. Again in. And out over to one side. Again in. And out over to the other side, but fur in the wind. Again in the middle. Now across the arms, intertwine the fingers, reach high with glue. Without reaching front out of a backward tray. Again in and up. And out, change the arms, intertwine the fingers. Breathe and reach high. Out, reach in front out of the back. Again in and up. And out and down we're doing the down diving dolls from the hanging down. and with open arm. Breathe in and bend the right leg. And breathe out and stretch only the left leg. Breathe in and change. And out and stretch the right leg. Breathe in and change. Out and stretch the left leg. In and change. And out and stretch. Again in both legs straight. And out. Another penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder, the right hand. Breathe in the hand again down. And out and down. Breathe in one hand up and out, bend the right knee and look over the left shoulder, the left hand. Again in and hand. And out and down. Now with pelican, make a hand lift straight between the feet, shift the back to the heels. Breathe in and go down. And out and up. Again in and down. And out and up. And the last time in and down. Take hold of the elbows and gently rock from side to side. The triple face counterweight. Both hands again down, feet together. Breathe in, come halfway up with a straight back, monkey half lift. Out and down. Again halfway up into monkey half lift. Out and down. Breathe in, bring the arms again up for the up diving swan. Out, bring the hands down. Love pressure braced nailer machine. Arms together, breathe in. And out, arms in front, bring the head down and stretch in front. Again in and up. And out again in front. And now, a stretch of fingers, intertwine the hands, the fingers behind the back. Bring them over to one side, breathe in, tall up, shoulders back. And breathe out, head over to one side. And chin down to the clavicle. Breathe again in. And out, pull the arm and then the shoulder down. In, lift the gaze and turn the head over to the other side. Hands over to the other side. Breathe again in. And out, chin down to the clavicle. Pull the hand in and the shoulder down. In, lift the gaze and the head back into the middle. The sky hugger, the feet are standing together. Breathe in, lift the arms. And breathe out, lean back. Long arms. Again in and up. And out, lean again back. Again in and up. Out the arms down. And the eagle swings. Breathe in, lift the arms up. Down and down. Again in the arms up. And out and down. The last time in the arms up. Down and down. Another cactus collecting its stings in the evening. Lift the arms up. Bring the hands to touch and lower the hands slowly down to heart center. It was for standing yoga. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today cervical spondylitis. And after we've done it, we're going to do standing yoga. And if you participate in the standing yoga, then it's been at your cervical spondylitis, we're talking about diseases here and internal anatomy. Cervical spondylitis, that is a disorder that causes pain in and restricted movement of the neck region of a spinal column. Okay, there's been pain in the cervical spine and also restricted movement. Cervical spondylitis mainly affects those over 40 years. It is something accompanied by a slip disc in the neck. Okay, by cervical spondylitis, there is also a slip disc in the neck. Okay, the spine has this disc and they can slip a bit out. Symptoms. Pain in the back of the neck or in the region of a shoulder blade. This is often worse in certain positions, for example, lying in bed with the head raised by several pillows. Pain in the back of the neck or in the region of a shoulder blade. This is often worse in certain positions, for example, lying in bed with the head raised by several pillows. And it is sometimes accompanied by a slip disc in the neck. Pain and restricted movement in the neck region. There may be, and this is no medical advice, I've got to say that. This is no medical advice, we're just speaking about it. There may also be pain, tingling and numbness in a finger or hand. Treatment usually gets rid of symptoms within 2 or 3 months. Step 2 or 3 months. 2 or 3 months. Causes: increasing age causes irreversible degeneration of the joints of the spine. When injury or certain other factors, such as having the head raised too high in bed, can bring on the condition. How's the head raised too high in bed? If several pillows or whatever. An injury can cause it, but some whatever strange position. Causes increase. Yes, we had it. Complications. No, let's recapitulate for a moment. Okay. Some strange movement or lying position can cause that over time degenerated joints of the spine had gotten worse over time get slipped out, or that it has been accompanied by a slip disc, or it is just, I don't know for what now. Whatever can bring on the condition. I don't really get know the cause. And there has been pain in the neck, maybe also tingling and numbness in one hand. It should get better with treatment in 2 or 3 months. Causes, complications. Turning the head or looking up may occasionally slow up the blood supply to the brain, causing dizziness or brief blackout. First of all, the obvious thing, I don't really know what I should say to that, but the other thing, can it be that some people have no dizziness and brief blackouts because they have cervical spondylitis? Okay, turning the head or looking up may occasionally slow the blood supply to the brain, causing dizziness or brief blackout. Treatment in the home. They advise, they write here, take painkillers in recommended doses to relieve the pain. When to consult a doctor. If the pain in the neck or shoulder is not relieved by taking painkillers, if there is any pain, numbness or weakness in the finger or hand, if any temporary dizziness or blackout results from turning the head or looking up, such as when decorating a ceiling. Just an architectural question, is the ceiling completely just the wall at the top? Without any corners? So that's completely the wall at the top? Okay, if there's tingling in the hand, or if dizziness or blackout, or if it does not get better, then consult a doctor. What the doctor might do, question the patient to discover whether injury or any factor such as a new car or new furniture has caused a change in posture. Okay, but how's now the disorder diagnosed? Just about pain? Imagine what happens with everything else. With dizziness or blackouts. Then just with 1 or 2 things and not looking after cervical spondylitis. Who would look after cervical spondylitis? Do people look when people report with dizziness and blackouts for cervical spondylitis? Okay, question the patient to discover whether injury or any factor such as a new car or new furniture has caused a change in posture. After examining the neck and testing reflexes and sensation in the upper arm, arrange x-rays. So the x-rays is looked for, and what is not seen on these x-rays? In many cases, he or she will prescribe pain-relieving drugs for the pain and possibly also arrange for the patient to have physiotherapy. Okay, examining of the neck, but how do we know whether they have to examine the neck? Okay, because there's neck pain. Okay, that makes sense. And then also testing for reflexes and sensations in the upper arm and also an x-ray to look at the bones in the arm. And also in mild cases, then maybe some medicamentation and also maybe physiotherapy. And in more severe cases, prescribe a special close-fitting collar to keep the neck in a fixed position. Okay, a collar to keep the neck stiff. Prevention. Avoid postures that strain the neck and upper back. Avoid postures that strain the neck and upper back. Outlook. About 4/5 of cases clear up permanently. In others, the disorder recurs within 2 years. Why does it not recur? Actually, it has to recur. There was nothing done. Why does it not recur? Even more often. Not permanently. Why does it go away in the first place? And the other thing, what is now seen on the X-ray? Because it can be accompanied by a slip disc, that's what we see. But how do we know that is this now slip? What is now wrong? Yes, what is wrong? Because we say it is sometimes accompanied by a slip disc in the neck. If it's not a slip disc, what is it then? What is then seen on the X-ray, and how do we know it is cervical spondylitis? Okay, we have got a lot of answers to a lot of things, and that's enough for medicine. So if you were here for medicine, you can go directly to the next part of medicine. And it was no medical advice, just because it was a bit like that. It sounded a bit maybe like that, but it was no medical advice, it was just reading what's in there. Now, if you were here for medicine, you can go directly to the next part of medicine. We will do now the standing yoga. If you participate in the standing yoga, when it's very harmless. We're breathing in and let the arms up, we don't leave its weights. And before the arms again down. Again in the arms up. And out the arms down. Again in the arms up. And out, open to the side. Up. And out, open to the other side. Again in the arms up. Out and down. Now we've ended the arms up. And lean back the crib in the morning. Draw the shoulder blades together. Get in the arms up. Now the arms down, draw the shoulder blades together. Again in the arms up. Bring the hands together and lean back, read in the moment. Again into the middle. And out and back. Again. And out and lean over to one side. Now across the arms and let my fingers reach out. And out, reach in front, out of the back. Get in. Intertwine the fingers the other way around. Breathe in and reach high. Breathe out, reach in front, out of the back. Get in the arms up. And out, bring the arms over the sides down. We're going down. Now we don't go down. Let's breathe in and bend the right leg. And breathe out and stretch only the left leg. Breathe in and change. And out and stretch the right leg. Breathe in and change. And out and stretch the left leg. In and change. And out and stretch the right leg. Again in. And out, both legs straight. Now we're doing the penguin. Breathe in and lift the right hand up to the sky. And breathe out, bend the left knee and look over the right shoulder to the right hand. Again the arm down. And out and down. Now breathe in and lift the left arm up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in, arm again down. Out and down. Now we're doing the pelican. Make a hand with space between the feet. Shift away to the heels and breathe in and come out. And out and up again. And again in and down. And out and up. And now take hold on the elbows and gently rock from side to side, which negotiates counterweight. Arms again down, close the feet again. And breathe in, come halfway up, straight back into monkey half flipped. And out and down. And in, halfway up. And out and down. Now breathe in, bring your arms again up, the updiving swan. Hands together and the arms down. And now, a fly, bring the palms together and the elbows together. Lift the arm up as high as you can do it with moderate effort. Down. And again up. Take it up. Okay, now the cashew. And the feet standing together. Intertwine the fingers behind the back. Tall up, shoulders back, breathe in. And breathe out, head over to one side. And chin down to the cloak. Breathe again in. And out, pull the hands down to the ground. Again in, arms up. Head up. Out on the other side. Breathe again in. And out, chin down to the cloak. And pull the hands down to the ground. Again in, head up. And back down. Now take one arm behind the back. Go to same stance. Tall up, shoulders back. Bring the arm up. And bring the head over to one side. But don't pull. Just bring it. Breathe again in. And out, look up to the hand which is on the head. And release. And we're changing the arm, the other hand behind the back. Lift the other hand up and take the head and bring it over, down, pull. Breathe again in. And out, look up to the hand at the head. And back. Now we stretch our Venus. Go to sit stance, intertwine the fingers behind the back. Bring them over to one side, tall up, shoulders back, breathe in. And out, bring the head over to the side where the hands are. And then the chin down to the cloak. Breathe in. And out, pull the arm and the shoulder down. Arm and shoulder down. And lift the gaze and turn it over to the other side. Also the hands over to the other side. Breathe in. And out, chin down to the cloak. Pull the arm in and shoulder down. Again in, lift the gaze and bring the head back into. And now, having the feet centered together, we're breathing in and lifting the arms up, sky hugger. And breathe out, lean back, long arms. In. And out and lean back. Out and the arms down. Breathe in and the arms up. The eagle's wings. And breathe out, down with the arms. Okay. And now we're cactus collecting its stings in the evening. Breathe in, lift the arms up. Bring the hands to touch and lower the hands down to hearts. And that was a standing yoga. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine today, acoustic neuroma. And after we've done it, we're gonna do extensor carpal ulnaris strength training. And if you participate in the extensor carpal ulnaris strength training, then it's at your own risk. The extensor carpal ulnaris is your muscle that's training with altogether. The acoustic neuroma. This is part 2 of the acoustic neuroma. We're gonna talk a bit about the internal anatomy also of the ear. And this is about an illness, and this is no medical advice, we're just learning about it. But this is part 2. Acoustic neuroma. It is a rare growth on the acoustic nerve of hearing and balance. Again, let's say it together. On the nerve for hearing and balance. The growth is not malignant, but it slowly grows inside the skull and causes pressure on the nerve and surrounding brain. It is this pressure that causes problems. It is not a malignant growth. It is benign. It's not a malignant growth, but the tumor grows bigger and then it presses against the brain and that's not good. The symptoms are slowly increased deafness, associated with singing in one ear. Slowly increasing deafness and singing, I don't know what it means, singing in one ear. Clumsiness and unsteadiness in walking. Dizziness. In more advanced cases, there may be pain on the side of the face, weakness and headache. Okay, slowly increasing hear loss and also some singing in well-affected ear. Clumsiness and elements, unsteadiness, clumsiness walking. Ear and the ear. And singing in the slowly increasing deafness and singing in the ear. Clumsiness when walking and unsteadiness, unsteady, I don't really understand the word. Clumsiness in walking and dizziness. And dizziness in the advanced cases when pain at the head, pain at the face, weakness and headache. In more advanced phases when pain at one side of the face, on the side of the face, weakness and headache. Okay? Durations, it gets gradually worse. And the whole thing happens over 2 to 10 years. Over years, let's just say that. Complications, removal of a growth always makes the affected ear deaf. Okay, we're going to mention it then. Causes. So far as in this book there's stated that let's just skip it if it's not known. The book is from the 80s, but it's maybe this is something known. I don't want to say it's not known, it's already known. In the book it is said that here in this book of the 80s it is said that it's not known what causes it. And if a diagnosis is confirmed, the specialist will arrange for an operation to remove a growth. Although hearing will not be restored in the affected ear, early removal of a tumor has good results and leaves few other symptoms. The danger of removal increases as the tumor slowly grows bigger. You don't really have to mention that, but the bigger it gets, the more dangerous is the removal. It's logically. And maybe if a tumor had grown already bigger, then it is a bit more complicated. I don't know if it doesn't really make sense to mention it. Okay. And that if the acoustic neuroma is diagnosed, then the tumor is surgically removed, which has a good outcome overall, but it leads to hearing loss. Do we have it all? It is not malignant, it is benign. Let's just say not malignant, malignant. It is not malignant, malignant. It's a growing of a tumor on the nerve for hearing and balance in one ear. And it's the symptoms are slowly increasing deafness and also some singing on the affected ear, or in the affected ear. And also dizziness and unsteadiness and clumsiness when walking, and when it's bigger, had grown larger, then also pain at one side of the brain, headache, and what was there? The weakness. And here in this book, it is not in this book from the 80s. In the 80s, when the time was when this book was written, it was not known what the causes, so no prevention was known. So no prevention possible. So no way to prevent it is mentioned here. But it is said that if it is diagnosed, the tumor, it can be removed. And a part of hearing loss on the affected ear, the outcome is good. That is according to Keith Hodgkins. Let's take one look at the name again. Keith Hodgkins. Keith Hodgkin. Thoroughly medical advisor, page 62. I have a second camera, which I'm going to start now, and try to say now what you know about the acoustic genre. It's Neuroma. Not Neuroma. Neuroma. I'm not really concentrated. Acoustic neuroma, that is a non-malignant tumor growing on the acoustic nerve for hearing and balance. And over the years it gets gradually bigger, the tumor. The tumor itself is a problem because it grows bigger and presses into the brain. It is not malignant, but it presses into the brain if it gets bigger. And over the years it goes bigger. And the symptoms are then hearing of singing in the ear and also increasing deafness. And then clumsiness in walking and unsteadiness in walking. And if it had gotten bigger, then also pain at one side of the face and headache and weakness. And in this book from the 80s, where in the 80s there was no known cause of it known, so here's no one mentioned, I don't know anyone, and also no prevention because of it. And if it is diagnosed that it is acoustic neuroma, it can be surgically removed. It has overall then a good outcome, but the hearing is then lost in that ear. That is according to Keith Hodgkins, Family Medical Advisor, page 62, but this is no medical advice. I'm going to stop a second now. And that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will continue with medicine. Here we will do now the extensor capillularis strength training. If you participate in this meditation, go to separate stance and we're starting with the floodgate. Fists next to us, and we're bringing the fists down, holding it, and up. Hold it. And down. And we have 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as fast as we can go with a little bit of effort. And the third rule is that we're not overdoing it. We just want to strengthen, not to exhaust. Next exercise, the counterpart body check. Fists and bring them up and down. And again down. And now I'm using a sock. And again, the second rule, we're going only as far as we can go with a little bit of effort. This is strength training for extensor capillularis, not if it's injured. So this is strength training. Going as far as possible with a little bit of effort, and if there's pain, stop immediately. This is all at your own risk. And we just want to strengthen, not to exhaust. Now, fist again like that, and pull with moderate pressure together with the fist, and bring it down. And up. Again down. And last time down. And now with your right. Press with moderate force and bring up. And again down. And up. And down. Again up. And the last down, up and down. And now, change with the hand again, press with moderate force, and turn the arm into supination. Only as fast as it goes with a little bit of effort. And back. I promise. And to the outside again. And inside. Again outside. And with the other hand. Press with moderate force and bring to the outside. And inside. outside. One last time. And now next exercise. Press not on the top and bring the hand down to flexion and up to extension. You know, this is not so much for extension, but and up. And the last time. Again, take a break, this could be already way too much. And with your hand. Press. And bring it down. Down. And up. And now just press the middle. And the other side. Please. And this was the main training, but I think, do we have another stretching exercise? Yes, we have one. The field this is to simply straight up fist and open close. And now just go more pressure on the middle part of the arm. And on the other side. This is very exaggerated to this and to fix and now this was the extended copy on Iris strength training. Thank you very much and have a nice time. Hi and welcome. I'm trying to learn medicine today, chlamydia infections. And after you've done it, we're going to do standing yoga, and if you participate in the standing yoga, then it's with the arm risk. And we're talking about illnesses, and this is no medical advice, we're just learning about it. Chlamydia infections. Chlamydia are small bacteria that are now known to be responsible for a variety of infections. Okay, there are bacteria, very small things, and there are some chlamydia bacteria, and they are responsible for many different types of infections. Until recently, the organisms went unnoticed, but now their importance is being increasingly recognized. The book is from the 80s. Okay, previously we didn't really know what it is, or that it existed, but now they know it is important for many different diseases. Diagnosis of chlamydia infections can be difficult, but they respond to antibiotics. Diseases caused by chlamydia includes, they are hard to diagnose. Chlamydia infections are hard to diagnose, but they can be treated with antibiotics. And these chlamydia bacteria can cause other types of diseases. For example, listed here now, trachoma, that is the commonest treatable cause of blindness. So people can get blind because of trachoma, and trachoma is caused through a chlamydia infection. Infant pneumonia can be also caused through a chlamydia infection. Non-specific uveitis, a vernal disease more common than gonorrhea. Why are we two R's? Why is there an O? Gonorrhea, I'm going to pronounce it gonorrhea if it's something else. Gonorrhea. And on the increase. Non-specific uveitis, a vernal disease more common than gonorrhea and on the increase. Okay, it's on the increase. The uveitis. Okay, people can have gonorrhea. It's just gonorrhea. People can have gonorrhea, and people can also have non-specific uveitis. And this non-specific uveitis is more common to come, and that can be caused through a chlamydia infection. Salpingitis, infection of the female fallopian tubes that may result in sterility. That means does it mean that the people can't get children anymore? Sterility. Is there a special term for it? Okay, so it can cause salpingitis. Epididymitis, infection of the epididymitis, the tube next to the testicles. Okay, whatever, it can cause infection of the epididymitis. The third one is a Y. There are 4 I's in that word. And what? Epididymitis. Lymphogranuloma venerum, a vernal disease that causes swelling of the lymph glands in the groin of both men and women. It causes swelling of the lymph glands in the groin. Lymphogranuloma. Reiter's disease or arthritis or conjunctivitis and refritis occurring together. Okay, Reiter's disease, and that is arthritis, conjunctivitis and uveitis occurring together. No, 3 or 2? Whatever. Reiter's disease. And psittacosis, a form of pneumonia caught from birds, especially parrots. And what has it not to do with chlamydia? Do people get chlamydia from the birds? Okay, it can cause psittacosis, that is some form of pneumonia which can be caught from parrots or other birds. Now, he has not so much into how people get now these chlamydia infections or what we now do. No, what we do, certainly, but where we are. Okay, whatever. People can get chlamydia infections, and if they get them, they are hard to diagnose, but it's treated with antibiotics, and they can cause a bunch of other diseases, but some of them might be treatable because the chlamydia bacteria are treatable. That was the chlamydia part, that was the medicine part. If you're here for medicine, you can go directly to the next part of medicine. We will do now the stand yoga. If you stay and participate in the stand yoga, then it's yeah, that's good. Good and stable stand, the feet are together, and breathing in and doing the eagle swings from the outside. And we're breathing out the outside. Again in the outside. And out and out. Again in the out. And out and out. And now we're on the outside. And out on the arms to the side, the police officer. Again in the outside. Out on to the other side. And in the outside. Out lean back, the crab in the morning, draw the shoulder blades together. Again in the outside. Out leaning back, draw the shoulder blades together. Again in the outside. Bring the heads to touch and lean back, the feet in the bed. Breathe in into the middle. Out again back. Again in. With the arm lean over to one side. In the middle. Out over to the other side. Again in. And now across the arms, intertwine the fingers, reach high as a claw. Without reaching the front out of the back. Again in the outside. Change the intertwine. Breathe and reach high. Without reach to the front. Again in the outside. And out, we're doing the down diving dolphin, arms coming down, and we're just hanging down. Now we're doing the marble. Breathe in and bend the right leg. And breathe out and stretch your left leg. Breathe in and change. And out and stretch your left leg. In and change. And out and stretch. In and change. Out and stretch. Now we're doing the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look up the right shoulder to the right. In, we head down. Out and down. Breathe in, lift your left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in and down. Put it down. Now we're doing the marmot. Make a hand with a pelican. Make a hand with space between the feet. Shift the weight to the heels and breathe in and go down. And breathe out and come up again. In and down. In and out and up. In and down. In and out and up. Now take hold on the elbows and gently rock from side to side. Hands again down, close the feet. Breathe in, come halfway up into monkey half, lift straight back. Out and down. In and halfway up. Out and down. Breathe in and come up, the diving swan. Bring the hands touching down and down. Now we're doing the cashew. Feet are sitting together, hands behind the back intertwined. Breathe again in. And out, head over to one side and chin down to the clavicle. And pull the hands down to the ground. In and lift the gaze. And turn the head over to the other side. And out. Breathe again in. And out, chin down to the clavicle. Pull the hands down to the ground. In, lift the gaze and turn the head back into the middle. Now we're doing another exercise. Feet are standing shoulder wide apart. One hand behind the back. The other hand up, tall up. And we're bringing the head over. We don't pull, we just bring it over. Now breathe in. And out. Look up to the head. To the fingers. And back and down. The other arm behind the back. Take the other arm up. And bring the head over to the other side. Down, pull. Breathe again in. And out, look up to where the fingers are. And back down. Now stretch your Venus, go to the stance, intertwine your fingers behind the back. And bring them out to one side. Breathe in, turn up, shoulders back. And breathe out, bring the head over to one side. And the chin down to the ground. Breathe again in. And out, pull the arm and the shoulder down. In and lift the gaze and bring the head over to the other side. Also the hands up to the other side. Fold up, shoulders back, breathe in. And out, chin down to the clavicle, pull the arm and the shoulder down. Lift the gaze and bring it back into. Now we're doing the sky hugger. The feet are standing together, breathing and lifting the arms up. And breathe out, lean back, long arms. And in and up. And out and back. In and up. Hold the arms down. And we're doing the eagle swings. We shall lift the arms up. We hold the arms down. In and the arms up. Hold it down. And now we're doing the last movement. The cat was collecting its things in the evening. Arms up. Bring the hands to touch. And lower the hands down to heart center. That was the standing yoga. I thank you very much and at the next time. Hi and welcome. I'm trying to learn medicine. Today, adrenaline. And after we've done it, we're gonna do stretching. And if you participate in the stretching, then it's at your own risk. And we are just here for medical learning. So this is no medical advice. We're just here and trying to learn what adrenaline is. Adrenaline is a hormone produced by the adrenal glands. Okay, there are some of the adrenal glands and they can produce adrenaline. Whenever a person faces an emergency or feels anger, shock, fear, or some other strong emotion, adrenaline is passed rapidly into the bloodstream to speed up the heart rate and breathing, to make the muscles work faster and longer than usual, and so to prepare the body for action. Injections of natural or synthetic adrenaline are used to treat bronchial, asthma or severe allergy and other conditions. Let's read this thing again. Also anything written about activity. A hormone produced by the adrenal glands. Whenever a person faces an emergency or feels anger, shock, fear, or some other strong emotion, adrenaline is passed rapidly into the bloodstream. Nothing written about activity. Our question is, does sport activity release adrenaline? It is not mentioned here. I don't say it's not, but it's not mentioned here. Imagine not a little thought again. Imagine adrenaline are not passed if someone has not emotions. What if someone does sport, but in a meditative sense, like yoga or exercise like that? These would be exercises where the muscles have to work, but the person could be meditative and not get emotions, not strong emotions. Is that the reason why it's then maybe possible to keep breathing down? But it actually is a more important question than just thought. So it's not just about that they don't mention it here. We actually have to look into it. Is adrenaline just released through psychological things? Or also through activities? Whenever a person faces an emergency or feels anger, shock, fear, or some other strong emotion, adrenaline is passed rapidly into the bloodstream to speed up the heart rate and breathing, to make the muscles work faster and longer than usual, and so to prepare the body for action. Injections of natural or synthetic adrenaline are used to treat bronchial asthma or severe allergy and other conditions. Okay, we're having the things together. Adrenaline is a hormone produced by the adrenal glands producing adrenaline. And they are released when a person feels strong emotions. Anger, shock, fear. Anger, shock, fear. We're going to mention these three when we're saying on one side. So pretty much we're basically making it clear we're talking just about this subject. If there exists another one with sport activities also releasing adrenaline, when it becomes clear this video was just about this one context. Anger, shock, fear. When these adrenaline are released through the adrenal glands into the bloodstream, and they are speeding then up the heart rate and the breathing. I think we're going to take it a bit short. Nothing to muscles work faster and longer than usual. Just heart rate and breathing. And this is when to make, but this is the consequence of it. Okay, the adrenal glands releasing adrenaline by strong emotions like anger, fear or shock, and they are released through the adrenal glands into the bloodstream to increase the breathing rate and the heart rate. There exists natural and synthetic adrenaline injections, and they are used to treat asthma or bronchial asthma and severe allergy. There exists also natural and synthetic adrenaline injections, and they are sometimes used for asthma or for bronchial asthma or allergy, for allergies. It is going to keep hot dish. Let's try it. I have a second camera, which I'm going to start now. And let's try it. Adrenaline are released by the adrenal glands into the blood system when the person feels strong emotions like anger, fear or shock, and when they are increasing the heart rate and the breathing rate. There exists also natural and synthetic adrenaline injections against asthma and what's the other thing? Allergy. Asthma and allergy. Adrenal. I want to say it now. Adrenal. Adrenaline are released by the adrenal glands if a person feels strong emotions like anger, shock or fear. And they are then in the bloodstream, and they are then increasing as hormones the breathing rate and the heart rate to make the person be fit. Oh, I don't want to say, but it doesn't fit. We want to take it very short, so it's clear that this is very short, just Enzyklopädie-like. Just hart und Blatt und hungry. Adrenaline are released by the adrenal glands if a person feels strong emotions like shock, fear, or anger. And they are increasing then the heart rate and the breathing rate. There exists also natural and synthetical adrenaline injections, and they can be used against asthma and allergies. And this is according to Keith Hodgkin's Family Medical Advisor, page 64, but this is no medical advice. I forgot again what it's called, medical advice. So I'm going to stop the camera now. And I'm starting it again. Because we have something else. It is more or less coincidental now with adrenaline together. Now, I heard something tell a story. I don't know if it's... I don't know the background, so it's just hearsay. But I think it's interesting. It was that there... Normally when people stand up, that... During that moment, the legs are shut off of a blood system. Again, take it with a grain of salt. I just heard it, but I think it's interesting. The legs are shutting off so that the person doesn't fall down, so that there's enough blood for the brain. So the legs are more or less shutting off for a little moment, that the blood stays there, and the blood can come into the head of the person, doesn't fall down. Now, and then I heard that there are some people having a problem with that, and that is not happening, that the shutting off happens. And that causes that there's not enough then blood by the brain and oxygen, and the person feels dizziness. That's the first thing. And the second, more important thing then is, that causes then that the body is releasing these adrenaline, more or less coincidental now with this video, these adrenaline. And they are increasing the heart rate, we just had the heart rate and the breathing rate, and then the blood supply to the brain is reestablished. But the problem is, I heard it all, I don't know if it's true, I heard it, that when the adrenaline are not immediately gone, that they're staying, not just for these 10, 20 seconds or whatever it needs to re-regulate the whole blood system, but they're staying long, I don't know how long, but 10 minutes, an hour, I don't know. But the problem is now, these people have no adrenaline in the blood, and they're feeling now, maybe possible, anxious, because they have adrenaline in the blood. And you basically don't really need, or have just because it wasn't properly shut off when they stood up. And they're feeling now anxious, and it was not because of a psychological thing. It was not because whatever makes someone anxious. It was because of, I don't know what it is, because of some type of disorder. And I think that's something very interesting. I don't know what it of all is but true, but I think that's a very interesting story, because it would mean that there are types of anxious state, if it is true, which have nothing to do with psychology. And that this person has not to feel anxiousness, basically, if there's no other way around it, without that the person can do anything against it. I think it was in the context of POTS, but I don't know it, and I don't really know what it is. And I think that's a very interesting story, that a person can feel anxious, but has nothing to do with psychology. And I want to say this story now also to the camera. It's just a more or less political note. A hearsay story. When a person stands up, then the legs are shut off so that the blood can stay at the head for a short moment. But there are people who have a problem with that, and their legs are not shut off, and there's not enough blood at the brain, and they feel a little dizziness for a moment. But now the more important problem comes that when in that moment the body is releasing adrenaline to increase the breathing rate and the heart rate, so the blood supply is then pre-established. But this adrenaline, they stay longer, not just for the few seconds that is necessary to get the blood system running properly again, but they are staying there longer and causing them anxiousness. And if it is all true, and I have no source of it, no proof of it, but if it is all true what I heard, then would it mean that a person can feel anxious without a psychological reason? Again, this is no medical advice, and I have no source and no proof, it's just hearsay, but I think it's interesting. Okay, now I have it also as a video. I'm going to step my basic camera. And now we can do the stretching. If you are here for medicine, then you can go directly to the next part of medicine. We will do now the stretching. If you stand, participate in the stretching, that is better at your own risk. We are go to stable stance, and we're lifting the arms up. Breathe in. And breathe out. Go over to one side. Hang it in. And out into the middle. Breathe it in. and out over to the other side. Breathe again in. Out into the middle and the arms down. Now one sees the upper optimize the next exercise. Breathe in. Out one hand slides down the leg and the other shoulder stays down. Breathe again in. And out to taking one arm over. Breathe in and out in the ribcage. And out back into the middle. Breathe again in. And out with one hand slides down. Breathe again in. And out one arm over. Breathe in down the ribcage. And out into the middle. Next exercise. Feet are standing together, the aeronautical body at the airplane. We're breathing in and lifting the arms up. And breathe out one arm down. Breathe in and reach. And out one arm up. Again in. And out one arm down. Breathe in and reach. And out one arm up. And arms down. Legs shoulder wide apart. And we're doing shoulder circles. We come front. Up. Back. And now breathe in and lift the shoulders up. Out, let them fall down. Again in. And now the arms down. Again in. And now the arms down. The other part, lift the arms up and reach always with one arm high up. Pretend to take an apple hanging high on an apple branch, turn it a bit around, and pretend to harvest it. And now we shift our legs wide apart, arms up to a T, breathe in. And out to one side. Breathe again in. And out to the other side. Again in. Out. And out, we're leaning onto the knees, the buffalo fighting its hangout. We're breathing in. And out, we bring one shoulder in front. And out one shoulder in front. Again in. And out the shoulder in front. Again in. And out the shoulder in front. Shoulder back. Out, we're hanging down the Niagara Falls. And breathe again in. And out. Again in. And out over the one leg. Breathe again in. And out over the other leg. Breathe again in. And out into the middle. Close your feet and get on the side of Angelo. Breathe again in. And out. Again in. Again in. And out, we're coming slowly with a little back up and making it the top of the big with the shoulder. And we're ending with a trunky glider. Next wide apart, we're breathing in, come down. Breathing out. Again in. Out. And we're going to cross the legs. And out. Let's pause for stretching. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine, today cholera, and after we've done it, we're gonna do standing yoga. And if you participate in the standing yoga, then it's been a down risk. And we're talking about a disease and internal anatomy and the happenings of this disease. And also this is no medical advice, we're just learning about it. I'm just reading what's here. Cholera. That is an acute infectious disease that can occur in epidemic form throughout the world, but not in Britain. That book is from Britain, from a British perspective. So it can happen in basically all over the world, but it is not usually in Britain, for example. It is an acute infectious disease, so it can be transmitted. It is caused by a germ called Vibrio cholerae, which is found in the feces of patients. Yes, we're going to talk about these things. Feces of patients and carriers. Cholera is transmitted by contaminated water and flies, and spreads rapidly when sanitation is poor. A natural disaster, such as an earthquake or flood, may result in an epidemic. Okay. Cholera is transmitted about a germ. It has a name, Vibrio cholerae. And this germ can be in the feces of patients and of all carriers. And it can be transmitted about water, which is contaminated, as also about flies. And it spreads very rapidly if the sanitation are poor. And that can be rapidly increased if there's a disaster, an earthquake. Symptoms. So we can talk a lot about, what do we even call it? Defecation. Symptoms. Watery diarrhea. This is painless but very severe. Vomiting, which is often effortless and without nausea. I have to find my name about nausea. Vomiting with all this. What the differences are. The loss of fluid produces rapid weight loss and muscle cramps. So the people are losing a lot of water. They're getting dehydrated because they have watery diarrhea, and they are vomiting a lot, which is effortless and without nausea, but they're losing a lot of water, and they're getting muscle cramps and losing a lot of weight. Incubation period 6 to 48 hours. So already 6 hours after they were infected by this Vibrio cholerae, they can get it. The outbreak of a disease, but also 2 days later, 48 hours. Duration 2 to 7 weeks. 2 to 7 days. 2 to 7 days. Causes bacteria in water and uncooked food, especially fruit and vegetables. Causes bacteria in water and uncooked food, especially fruit and vegetables that have been contaminated by carriers. Okay, there can be bacteria in water if people drink water in which this is, or also if people eat uncooked food which is contaminated, and especially is it for fruit and vegetables that have been contaminated by carriers. Now I want to know more about these flies. If it is a main way to transmit it, or what is the treatment in the home. If immediate medical help is not available, keep the patient at complete rest. So rest, do we say? Give plenty of glucose water and ice drinks such as lemon and barley water. Again, this is no medical advice, and this book is from the 80s. Give plenty of glucose water and iced drinks such as lemon and barley water. When to consult the doctor? Immediately. If cholera is even just suspected, if cholera is suspected. What the doctor might do? Arrange an intravenous saline drip to replace lost fluid. Once the fluid is replaced, recovery is rapid. Okay, we're getting an intravenous injection, and there comes water with saline. I think it's also some type of salt water. We're getting that in. But I'm not sure about it. If it's saline water, this is all medical advice. This is not medical advice. Prescribe antibiotic injections or tablets. All of this is less important than replacing fluid lost through diarrhea. So we have to get water again in because we're getting dehydrated because we're losing so much water. So we're also into antibiotics and antibiotic injections, but it is the saline water, this thing. Again, this is now medical advice. Prevention. Be immunized. There's immunization. Be immunized against cholera if you are going to a country where the disease occurs frequently. Immunization lasts about 6 months, but it is not always effective. Again, this book is from the 80s. Maybe someone has made a better immunization, but there is a type of immunization. I don't know to what success, but for 6 months, and people should take it if they go into regions where the cholera can be present. People being immunized for the first time should be immunized again after 10 or more days. In countries where cholera occurs, all water should be boiled, and food, especially fruit and vegetables, should always be well cooked. Careful Personal hygiene and good sanitation in the community are the only sure protection against cholera. In countries where cholera occurs, all water should be boiled and food. Especially fruit and vegetables, should always be well cooked. And overall good sanitation. Outlook: with adequate treatment to replace the large amounts of fluids lost from the bowel, recovery is complete and there is little chance of a patient dying from the disease. When epidemics occur suddenly, such as after a flood or earthquake, hospitals cannot always cope with the number of patients needing treatment, and the death rate in the early phase of an outbreak may be as high as 60%. Is there not vaccination yet? No, one longer than 6 months. Okay, cholera. The problem is that there is this Leber cholerae, and that is a germ, and that can be in different things. It can be in water, it can be in uncooked food, it can be also transmitted through flies. And if people be in regions where it is, before they get there, they should some type of injection, immunization against it. And the people who live there probably, I don't know what they can do about it, whatever. This is a British perspective. Now, the people should get immunization if they go to these countries where it is, whatever the people know what comes with them, they have it. All over is this good sanitation, which is then the final solution against it. And if one is in an area where it could be, the water should be always boiled, and also the food should be cooked, and fruit and vegetables should also be well cooked. If treatment happens immediately through saline injections, then the massive water loss through a watery diarrhea can be replaced, the person survives. If there's an outbreak after an earthquake and thousands of people have it at the same time, there are not enough intravenous and saline injections, and not all people can be treated, and 60% die. Now, that's the medical part. Now we're going to do steady yoga. If you are here for cholera, you can go directly to the next part. If you are here for steady yoga, we're going to do it now. If you participate, then it's better the honest. We have the feet standing together and we're breathing in and breathing out. And breathe out the arms down. And breathe in the arms up. Can people get it twice? And again the arms up. And out the arms down. No. Police officer, breathe in the arms up. And breathe out the arms to the side. In the arms up. Out, up, and on the other side. Again in the arms up. Out, up, the arms to the side. Out to the other side. Again. And out, lean back, draw the shoulder blades together. In it up. And out and lean down. Lean back. In it up. Hands together and lean back. And up. And down and lean back. And out over to one side. Lean into the middle. And out to the other side. In into the middle. Out across the arms, intertwine the fingers, reach high, screw. Without reaching front. In. Change it, intertwining, and breathe in, reach high. And out, reach in front. Out of the back. In and up. Out with the arms down onto the knees. And doing standing cat and cow. And out, make a hell of a back for cat. Make it in, straight back. And out, belly cow. In. And out, the cat. Again in. Out, cow. Again in. And out, we're coming on the round back up. And then making it a top and backwards, shoulder. And now an inch space between the toes, breathing in as with the arms up. Without opening arms to the side. And a little out and sink down into half chair. Breathing in, come up. Out on the other side. In. And out and down. In and up. Out and up again to one side. Again in. Now we absorb sides down, we're going down into chair. Breathe in, come halfway up. Higher. And out and coming up. Breathe in and reach high. And out, open the arms to the side. Okay. And out, we bring the arms on the sides down, going down. Breathe in, come up. Higher. And out and down. Breathe in, come up onto tiptoes. And breathe out, sink down into the full chair. Breathe in, come up again. And out and down. And up, time up. And now we're down diving dolphin, bring the arms over the sides down and we're hanging down. And we're doing the arm. Breathe in, bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Again, in and change. And out and stretch the left leg. In and change. And out and stretch the right leg. In and change. And out. In. And out. And out, stretch both legs at the same time. Now the penguin. Breathe in and lift the right hand up to the sky. Breathe out, bend the left knee, look off the right shoulder to the right hand. Again, in the shoulder down, down, up, out and down, both legs straight. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee, look over the left shoulder to the left hand. Again, inhale down, and out and down. And now the pelican. Make a hand of space between the feet, shift the weight to the heels, and breathe in and go down. And breathe out and come up again. Take it in and down. And out and up. In and down. And out and up. And now the Cerrhosis counter me. Take out on the elbows and gently rock from side to side. Arms down, feet together. Breathe in, come halfway up, with straight back into monkey half lift. Breathe out and down. In, halfway up. Out and down. And then breathe in and come up with the up diving swan, hands together, hands again down. And we stretch the fingers for tussle. No, just go to the same stance. Intertwine the fingers behind the back and bring them over to one side. Turn up, shoulders back, breathe in. And out, head over to one side, and the chin down to the clavicle. Breathe again in. And now pull the arm and the shoulder down. Again in, head up, over to the other side. Breathe again in. Out, pull the arm and the shoulder down, hold the chin down to the clavicle. In, head up, back into the middle. Now the feet again standing together. Breathe in, lift the arms up. Breathe out, lean back for sky hug. Head into the middle. Out to lean back. Okay. Out the arms down. Now the eagle swings. Breathe in, lift the arms up. Hold the arms down. In the arms up. Out and down. And now the cactus collecting its stings in the evening. Breathe in, lift the arms up. Bring the hands to touch, and now the hands down to heart center. That was the standing yoga. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, Acrocyanosis, and after we've done it, we're going to do median plane training. And if you participate in the median plane training, then this is at your own risk. and we're talking about the blood system, internal anatomy, and a condition, a medical condition. And this is part 2. And this is no medical advice, we're just learning about it. Acrocyanosis, that is a harmless but persistent deficiency in the circulation of the extremities, hands, fingers, feet and toes of young women. Symptoms: there is no pain, but the fingers and hands are always cold and blue. Duration: a persistent complaint, but as the patient gets older, the symptoms abate. Okay, acrocyanosis, that is when people have cold and when people have persistently, the way is persistently? Yes, when people have persistently cold and blue hands because the blood supply is deficient, because there is deficient blood supply. And it lasts over, let's see the last thing, outlook good, but the condition will persist for several years. The condition lasts for several years, but over time it abates. I'm going to use the same word, I'm not completely sure what abate means. It abates. I think it releases, it gets down. Duration is causes. The blood vessels of the hands and feet are usually sensitive to cold. The reason for this is unknown. The blood vessels themselves, or the blood vessels, we had it in the first part of Acrocyanosis, where we didn't so the blood vessels of the hands and feet are unusually sensitive to cold. Sensitive. Unusually sensitive. What does it mean? It means that the blood vessels are measuring that it is cold because they're too sensitive to cold, and then telling the body that the body should not bring so much blood to that so that they don't cool out. Which leads them to it that they actually cool out the hands and feet because they don't get enough blood supply. Is it even working that the people are warmer because they don't bring so much blood to the hands and feet? That can be explained. And it is that the blood vessels of the hands and feet are unusually sensitive to cold. I maybe just going to say the way they said here because I think in the last part I understood it. Maybe I will understand it when I hear it again. The blood vessels of hands and feet are unusually sensitive to cold. That means they are too sensitive, measuring the cold. And when they are stopping with the blood supply to not lose too much warmth through the dilated vessels. The reason for this is unknown, but it is a harmless condition. The reason is unknown, and is the only treatment that if the condition persists and worries you. And it is advised to wear gloves. The treatment advised in this book is just and simple. The only treatment advised, the only available treatment advised is to keep the hands and feet warm. Okay, acrocyanosis. Acrocyanosis, that is that persistently the hands and feet are cold and blue because there is a deficiency in blood supply. The condition lasts over several years, but when it abates over years. The reason is that the blood vessels are too sensitive to cold, or unusually sensitive. The reason why that is not yet known in this book is in this book from the 1980s. And the only idea to minimize the harm to them. The only idea to live with the condition is to keep the hands. The only it is my key project to make a advice on the medical advice. So I have a second camera, we're going to start now. And we want to see what happens. Acrocyanosis. That is when persistently the hands and feet. No, I can't say that. Acrocyanosis is a condition by which the feet and hand are persistently coated blue. That is because the blood supply is deficiently to them. And the reason is that the blood vessels are unusually sensitive to cold. No, not to cold, it's just too sensitive. No, it's too cold. Acrocyanosis. That is a condition by which the blood supply to the hand and feet is persistently deficiently. And the reason is that the blood vessels are unusually sensitive to coldness. And we only treat... No. What do I wanted to mention there? Nothing, just with a war. And everything consists of years. Okay. Acrocyanosis is a condition by which the blood supply to the hand and feet are persistently deficiently, and the hands and feet are cold and blue. And that condition lasts over years, but then over the years it abates slowly. And the only treatment in this book from the 80s advised is to keep the hands warm. And the reason for that whole condition is that the blood vessels are unusually sensitive to coldness. But why that is not known in this book. And that all is according to Keith Hodgins, Family Medical Advisor, page 62, but this is no medical advice. I'm going to stop the same camera. And we're going to go on with the next thing. The next thing will be medium plane training, and let's look at how it works. If you were here for medicine, go to the next part of medicine. If you stay here and participate in the medium plane training, then it's already honest. We are bringing one leg up and we're going the foot down. That is the mushroom. And we're going on with a greeting mushroom, foot up and down. And now we're waving mushroom more of a walrus and more lifted. And then the other direction. Makes sense. And now with the other foot. Leg up and point the foot down. Lowering foot up and down. And now, circles. And into the other direction. And now, the first actual exercise. One leg up into a right angle, flex foot, even and hips toward the back, and pressing the top against the knee. Have a little bend in here. And now let's try with the other leg. And pressing it forward. Right angle with the leg, flex foot, even and hips toward the back, a little bend in here. And to the next exercise. Leg again up and now we're pressing from the inside. And next exercise. Oh, with the other leg. Again the leg up. And we're pressing from the inside again. Continue with the exercise. And to the other leg again. Leg again up. And now we're pressing with the knee up and to the side. And with the other leg again. Press up into the side. Okay, that was enough. And now to the next exercise, last exercise, where we swing your leg up. And we're pressing on the outside. And we're opening slowly. close again. Open again. And close. Then with the other leg. Leg up, press on the outside and open. And the second one. And now the next exercise, just we're ending with a tracking lighter. Legs wide apart, we're going down, breathe in. And out. Again. Out. Last round, breathe in. And out. We're going to cross the legs. And breathe out. Right, both for medium plane training. I thank you very much and until next time. Hi and welcome. I am trying to learn medicine. Today circulation problems in the eye. And after we've done that, we're going to do standing yoga. And if you participate in the standing yoga, then it's with your own risk. And we're talking about diseases and internal anatomy and internal eye anatomy. And this is no medical advice, we're just learning. Circulation problems in the eye. The vision can be affected by hemorrhages or clots that block the blood vessels of the retina. High blood pressure or diabetic increases the risk of this happening. Okay, let's read on maybe the symptoms, but no, let's first understand it. When symptoms for clarification. Okay, there can be hemorrhages, I don't know really what it is, and clots and they're blocking the blood vessels of the retina. So the retina is somewhere in the eye, I don't know exactly, and the retina is supplied by blood vessels, and they can be blocked because of clots or hemorrhages can also disturb them. And people with high blood pressure or diabetes have an increased risk of having it. Symptoms. Blockage of the circulation to the eye can cause sudden, painless loss of vision in one eye. Sudden, painless loss of vision in one eye. If sudden blindness is total, it is probable that an artery has been blocked. If a vein is blocked, the loss of vision is likely to be on. Oh, but that is so interesting. Maybe we should read the sentence. Well, if a vein is blocked, the loss of vision is likely to be only partial. If an artery is blocked, so if there's sudden blindness, then it's probably an artery delivering the blood to the eye. And if it is the blood coming away, it is just partially. It makes absolute sense, but it's so fascinating. If a circulation supplying the central retina becomes inefficient, or if there is bleeding in this, so we're talking also about blood system, or if there's bleeding in this area, the patient will gradually find it increasingly difficult to read or knit or do find work. So we're talking about seconds, minutes, hours, because we had said here sudden blindness is total and can cause sudden painless loss of vision. And this sounds a bit differently. If a circulation supplying the central retina becomes inefficient, or if there is bleeding in this area, the patient will gradually find it increasingly difficult to read or knit or do fine work. Small, symptomless hemorrhages may also occur in people with high blood pressure or diabetes. Oh, okay, whatever that means. Duration. The speed and extent of recovery depend on the size and area of the damage to the retina gets damaged to the retina. A degree of recovery of sight may occur over a period of a few weeks or months. Okay, we're talking about something differently. We're talking about that the recovery may happen over weeks or months. Causes. The small hemorrhages which can occur with diabetes or high blood pressure are part of a general strain on the circulation with which these conditions can cause. We're listening if there's anything mechanical can do that. Okay, hemorrhages can occur through diabetes or high blood pressure because of a general strain onto the whole circulation through diabetes and high blood pressure. Blood vessel blockages are usually caused by small clots which may form in arteries affected by ephedroma or in veins crossed by small hardened arteries. Wait a second. Blood vessel blockage caused by veins crossed by small hardened arteries. We had it in one of the previous parts that a muscle, where it was written that a muscle can shut off, or there's no proper term, shut off a nerve, that a muscle can impinge a nerve. And now we're having here arteries. The arteries are hardened and now affecting the blood vessel. And I'm also after my one over I don't really know what it was. A degeneration of the walls of the arteries. A degeneration of the walls of the arteries. The condition is also known as atherosclerosis and arteriosclerosis. Fatty deposits develop on the arteries walls which, when hardened, produce the condition known as sclerosis. Did we do it? We must have done it. But we haven't done our presentation, so we're not done with it. We're going to come back to that later. 115. When to consult a doctor. If you have any loss of vision, especially sudden loss of vision, seek medical help immediately. What the doctor might do. The doctor is likely to test your eyesight by means of an eye chart, test your field of vision, and look in your eyes with an ophthalmoscope. He or she will also probably check the blood pressure and test the urine for sugar. Because of diabetes, because when the sugar content is high, then people have diabetes. If the vision has been lost suddenly, why is it? It is because the diabetes, who was it now? Who was it? There's one organ. There's one organ isn't sending out the insulin, and the liver isn't reacting to it. Who was it now? I'm going to come to the back it's a bit later. I have made a video about it separately. If a vision has been lost suddenly, the doctor will almost certainly arrange emergency admission to an eye hospital. Okay, up to an eye hospital is when said. When a retinal artery is blocked, high doses of steroids, cortisone, may be needed to save the sight of a second eye. If a vein has been affected, the eye dies. I don't know if it's if a vein has been affected, tests and sometimes treatment will be needed to prevent the development of chronic glaucoma. When a retinal artery is blocked, high doses of steroids, cortisone, may be needed to save the sight of a second eye. Are we connected? I want to now know more about the blood supply of the eyes. Would it be interesting if I had my own blood? Would it not be very helpful for the brain if the brain would be also paired and if both had an individual blood supply? If a vein has been affected, tests and sometimes treatment will be needed to prevent the development of chronic glaucoma. We are by C, we haven't done glaucoma yet. Prevention. Do not smoke. There is evidence that hardening of the arteries, the underlying cause of most circulatory problems in the eye, may be associated with heavy cigarette smoking. If you suffer from high blood pressure or diabetes, it is vital to continue under medical supervision. Whatever, if I don't get the sense. If you suffer from high blood pressure or diabetes, other underlying causes, it is vital to continue under medical observation, under medical supervision. Outlook. Even if the sight of the affected eye cannot be saved or can be only partially restored, it is quite possible to adapt well to sight with one eye only. If the central vision is affected, reading may become impossible, although the patient will not go blind and will be able to see his way to get his or her way to get about. If the central vision is not affected, oh yes, because it could also just have partial sight. That's one bit. And the patient can do most tasks not requiring fine vision. So an infarct of the eye. It is not some little thing, it's an infarct of the eye. The eye doesn't get blood supply. And the retina dies and the person gets actually blind. And now there could be then cortisol or steroids to save the other eye from going blind. And it can And yes, so basically blood infarct of the eye, with drastic consequences to the eye as it is an infarct of the heart and brain, with possible death of the eye. And that is caused, the only causes here meant are high blood pressure, and its causes then probably, and diabetes. Now that was the medical part. Now we're going to do yoga. If you will here for medicine, you can go to the next part of medicine. I still don't know who it was who made Vincent. If you were for medicine, go to the next part of medicine. We're going to do now the standing yoga. If you stay and participate in the standing yoga 5 minutes, then it's the hours. Go to step, it's not a good step, it's heavy feet standing together with breathing in again. And breathe out the arms again down. In the arms up. Out the arms down. Again in the arms up. And out. Again the arms up. And out the arms to the side. In the arms up. Out up and to the other side. In the arms up. Making a space between your feet and out of the side. In the arms up. And out of the sinking down into half chair. Breathe in, come up. Out, open to one side. In and up. Out and down. In and up again, cross the feet. And lean back, pull the shoulder blades together. In and up. Out and lean back, pull the shoulder blades together. In and up. Hands to touch and lean back, breathe out. In and up. And out and lean back. In and up. And out over to one side. In and up. And out over to the other side. In and up. Out across the arms and the 12 fingers to each side. Without reaching from half the back. In and up. Change the other crossing into 20 fingers with each high breath in. Out, reaching from the back. In and up. Out of the arms down and leaning onto the knees, make an inch space between the toes. Breathe in. And out, make a head of the back with cat. Breathe in. And out, and the lid of the back with cow. Breathe in the middle. And out the head. Again in. And out. Belly. Again in. Now we come with our own back slowly up. Then we lift the arms up. Out on the side. In the arm. And now out the arms over the sides down into the chair. Breathe in, come halfway up. Higher. And out and coming up. Breathe in each side. Out on the side. In and arms up. And out again down into the chair. Breathe in, come halfway up. Higher up. And out and we're coming up. Now we're in and come up on the tiptoes. And we're out and we're sinking down. Breathing in, come up. And out and down again. In and up. Now out and down, the arms over the sides down, feet again together. Breathe in, bend the right leg. Breathe out, stretch just the left leg. In and change. And out and stretch the right leg. In and change. And out, stretch the right leg. In and change. And out, stretch the right leg. In and change. And out, both legs together. Breathe in, lift the right hand up to the sky. Breathe out with the left knee, look over the right shoulder to the right hand. With an arm again in. And out and down. Breathe in, lift the left hand up to the sky. And breathe out with the right knee, look over the left shoulder to the left hand. Breathe in and down again. Out and down. Make a hand with space between your feet. Shift the weight to the heels. Breathe in and come down. And out and come up. And in and down. And out and up. And in and down. And out and up. Take hold on the elbows. And gently swing from side to side. And arms again down, feet together. And breathe in, come halfway up, straight back. Out and down. In, halfway up. Out and down. And breathe in, come up again. Hands together and again down. Now make your feet standing shoulders wide apart. Intertwine the fingers behind the back, turn up. Shoulders back, breathe in. Out, head over to one side. Chin down to the clavicle. Pull the arm and the shoulder down. Breathe again in. Lift the gaze, turn the head over to the other side. Hands also over to the side. And chin down to the clavicle. And pull the arm and the shoulder down. Again, in lift the gaze back into the middle. And the feet staying together. And breathe in with the arms up. Before leaning back. In and arms up. Lean back. In and arms up. Out and down. Breathe in with the arms up. Bring my hands together and lower them down. It was the same way. Thank you very much. Hi and welcome. I'm trying to learn medicine. Today, cirrhosis of the liver. And after we've done it, we're going to do a bit standing yoga. And if you participate in the standing yoga, it's an risk. And we're talking about a disease and internal anatomy and stuff like that. But this is no medical advice. We're just reading about it. Or learning about it. Cirrhosis of the liver. That is a chronic disease often associated with drinking alcohol. And it is nobly fissured tissue, like scar tissue, replaces the cells as they become damaged. Okay, cirrhosis of the liver, it is associated with drinking alcohol, and by that, basically the liver becomes scarred, as the skin does it if it's damaged. If a disease can be stopped in time, the undamaged liver can regenerate itself back to a normal state. Cirrhosis is more common in men with normal symptoms, with symptoms usually appearing in the 30s and becoming severe in the 40s. Okay, it's more common in men, and it starts in the 30s and becomes more common in the 40s. Symptoms. Sometimes there are no obvious symptoms, and patients can look and feel well after the disorder has begun. Okay, there can be no symptoms. There can be also, but there can be a pale, slightly dirty complexion is common. What do you mean by that? Do we mean how the person is dressing? Weakness and feeling ill. Okay, the person can feel weak and ill. What do you think? If the liver has any cause of it? Anemia? Is it what it is? Amputation, anemia, a reduction in the quantity of oxygen-carrying hemoglobin. Can we learn this? Anemia, it would be better if that word would make sense, and these words are not randomly. Say anemia, reduction in the quantity of oxygen-carrying hemoglobin. Anemia. It starts with an A, so it's clear if something is not. Anemia. Anemia, hemoglobin reduction. Okay, there can be anemia, so a reduction in hemoglobin carrying cells, whatever it was. Tingling and numbness in feet and fingers. They can be a sign of cirrhosis of the liver. Reducing why. Small blood vessels, spider nervosis, shown on the skin. Small blood vessels shown on the skin. But all because the liver is damaged. In men, the breasts may swell as the diseased liver cannot inactivate the female hormones that are present to a small degree in all men. Okay, the liver can send out things to repress the hormones that mostly associated with women having them, and now the men do not inactivating them, and they have them, and so the breast get larger. Atrophy, that is shrinking of the testicles. Now we're talking also about this stuff here. So we got one. and also loss of sex drive, and loss of appetite and loss of weight. Duration. Cirrhosis caused by alcohol lasts until the patient stops drinking alcohol altogether. If no complications arise within about a year and a half after abstaining, a normal life without drinking can be enjoyed. Okay, that means if a person stops to drink and does not start to drink again, a normal life can be lived on. If a patient does not stop drinking, liver destruction continues and death will eventually follow. Causes. Alcohol is the cause of the majority of cases. Alcohol also aggravates cirrhosis from other causes. Chemical damage from anesthetics, cleaning fluids and some drugs. I don't really know what anesthetics is. I heard of the word, I don't know what it is. Virus hepatitis B can also cause it, and cirrhosis less commonly follows heart failure. Obstruction of bile ducts and poisoning of the liver cells by other substances and infections. Okay, it can come after heart failure, after the bile ducts are obstructed, wherever they are, and the liver can be poisoned. It can happen through substances or infections, what do you think? Infections. Complications. Piles. Is what a disease? Piles, pills? Piles. Internal hemorrhage from the esophagus. I don't really know what a hemorrhage is, but it doesn't sound good. Internal hemorrhage from the esophagus. I have a suspicion what it is. Ascites. That is a buildup of fluid in the abdomen. Cancer of the liver. Treatment in the home. Cancer of the liver. What was it again? Normally fissure tissue like scar tissue replaces the cells as they become damaged. And why is it happening? But why is the alcohol doing it? Okay. And your treatment in the home. Non-advised, consult the doctor. When to consult the doctor? If drinking is heavy, or there is danger from exposure to ingested solvents. So we're saying every time if someone is drinking heavy, they should consult the doctor. But again, this is not medical advice, just what the doctor might say, if the above symptoms suggest disease, and if the symptoms suggesting the disease symptoms were maybe less than no symptoms, a pale, slightly dirty complexion, or do they mean a facial expression or whatever? Weakness, feeling ill, anemia, and weight loss, a reduction of blood carrying oxygen cells, tingling and numbness of feet, small blood vessels, spinal vasa, and also atrophy and decreased libido and less appetite. What the doctor might do, take blood tests to determine the amount of liver damage. Is it possible to see at blood tests? Because the liver is an organ. How is it not enough to test the blood? And to identify the cause, it is other than alcohol. Yes, to look at the cause other than alcohol, refer the patient to a special physician, psychiatrist, or alcoholics, or alcoholic support group, depending upon the cause. Are there alcoholists? So some many people who do it as medical as a profession. We advise the patient to give up alcohol to prevent further liver damage and suggest a nourishing vitamin-rich diet and rest. Prevention. Avoid too much alcohol or contact with other potential liver poisons. See alcoholism. Prevention also get medical help if you are a heavy drinker. Now it was a part to cirrhosis of the liver. Can other things also have cirrhosis? Because if yes, then the word cirrhosis would mean something. The word cirrhosis just sounds like erosion. It sounds like the liver gets erosion and the skin, the liver becomes scarred. So that would make sense if it comes from it. But we're going to read on, find out, and then I'm going to say. That was for part 2, cirrhosis of the liver. If you were here for cirrhosis of the liver to talk about it, then you can go directly to the next part of medicine. We will do now the standing yoga. If you participate in the standing yoga, let's let it down. We're having your feet standing together and you're breathing in and lifting your arms up. And breathe out, bring the arms down. In and the arms up. Or the arms down. Again, in the arms up. Out the arms down. And the next exercise. Breathe in with the arms up. And breathe out open to the side. Breathe in with the arms up. Out open to the other side. And lift the arms up. Make an inner space between the feet and open to one side. Breathe in into the middle. And out we go and halfway down. Feet come up. Out open to the other side. In. Out and down. In and up again. And out the arms down and leaning onto our knees. And now we're doing standing cat and cow. Breathe in. And out, make a belly with a bagel cat. Breathe in. And out. Now a belly with a bagel cow. Breathe in. And out the hill with a bagel cat. Breathe in into the middle. And out the cow. Breathe in into the middle. And the cow pick up. And backward shoulder up. Breathe again in, lift the arms up. Out open to the side. Again in the arms up. And out we bring the arms over the sides down, becoming down into the chair. Breathe again in, come up. Halfway. Higher up. And out. And coming up. Breathe in and reach high. And breathe out open to one side. Breathe in, lift the arms up. And out we go down into the chair. Breathe in, come halfway up. High up. And out. And now breathe in and come up onto tiptoes. And breathe out and we're sinking down. Breathe in and come up again. And breathe out again down. And then out and up. And out we do a down diving dolphin, the arms coming over the sides down, long legs, straight legs, and get up. And now for a moment, breathe in, bend the right leg, and breathe out and stretch left leg. Breathe in and change, and out and stretch the right leg. In and change, and out and stretch left leg. In and change. Out and stretch the right leg. In and change. Out and stretch left leg. Again. And out leg straight. And now, the penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look up the right shoulder to the right hand. Breathe again, inhale down. And out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left. Breathe in, hand down. Out and down. Now the pelican, make a hand with space between your feet, shift the weight to the heels, and breathe in and down. And breathe out and up again. And again in and down. And out and up. Now take hold of the elbows and gently rock from side to side. Again, the hands down, feet together, and breathe in, come halfway up. Straight back, and breathe out and go down again. Breathe in again, halfway up, and out and down. Now we're going to come up. And hands down. Now the next standing wide part. Breathing in. Not wide part, shoulder, elbow, and elbow wide apart. Breathing in the other. And out and we're sinking down. Place the elbows against the inside of the knees. And now in. And out and cover the back up. Breathe again in. And out into the garden pose. Now you can do this again. Now you do another exercise. Breathe again in. Now either you come back or out you come up in one straight line. And breathe again in. And out, come back into the garden pose. And we're doing that again. Breathe again in. I would go either back or up, tuck the pelvis in, come with the crown of the head first up, and down the arms. And one more round, breathe in the arms up, and out and down. And the last time, breathe in. And out we're coming in one straight line up. And we right. And we're up again. So come on. And we're ending. Have the feet standing together. Breathe in, lift the arms up. And breathe out, go back, draw the shoulder blades together. In and up. Out and back again. In and up. Hands together, breathe out, lean back. In and up. Out and back. In and up. Out into the side. In and up. Out into the other side. In and up, across the arms and the 20 fingers. Breathe and reach high. Breathe out, reach front of the back. Breathe in into the middle. Out across the other way around. Breathe in, reach high. Out, reach front of the back. Breathe in into the middle. Out, lean back. Arms long. Again, in into the middle. Out, the arms down. Breathe in the arms up. Bring my hands to touch and lower the hands down to heart center. It was a standing humor. I thank you very much, and until next time. Hi, welcome. I'm trying to learn medicine, today Acromegaly, and after this done with, we're going to do wrist training, and if you participate in wrist training, then it's at your own risk. This is part 2, and we're talking about internal anatomy a bit, about disorder or disease. And this is no medical advice, we're just really reading and learning about it. Acromegaly. That is a disease in which the skin thickens in the hands, feet and face, particularly the lower jaw enlarged. Okay, the skin thickens and the hands and feet and face are thickening, and in particular does if the lower jaw enlarging. But what is the result? It is the result of overproduction of growth hormone by the pituitary gland, which lies in the brain. And what happens because the pituitary gland, which is something in the brain, is producing too much growth hormone. A benign, non-cancerous tumor of the gland causes the excess production. It is a benign, so not a cancer. A tumor of the gland, it is not a tumor which is not a cancerous one. A non-cancerous tumor is causing that the pituitary gland produces too much growth hormone. Treatment consists of destroying the tumor by radiotherapy or by removal of the gland. It can be treated with radiotherapy or removing of the gland. Acromegaly occurs after the age at which normal growth stops. Excessive production of growth hormone in children produces a different condition, gigantism. Acromegaly occurs after the person has left normal growing. If the pituitary gland is doing excessive growth hormone, what is it called? Expression, releasing. Well, it's gigantism. Do we see what it is? Because if the person gets too big, I think, too high. Let's try, but let's take F, G. Hier is no gigantism. Couldn't find it. Gigantism. Okay, so acromegaly. Acromegaly is a disease. Acromegaly is a disease by which the skin thickens and also the hand and the feet and the face are getting too large, and especially thus that the lower jaw. That is caused because there is a non-cancerous tumor at the pituitary gland, which is into the brain and which is releasing growth hormone. Normally, this acromegaly happens after childhood. How is this expressed here? Acromegaly occurs after we age at which normal growth stops. Now this acromegaly, what do we just say that? Or the same words. Acromegaly occurs after the normal growing has stopped. If it happens during childhood with excessive production of a growth hormone through the pituitary gland, then it gives gigantism. But it's according to Keith Hodgkin's page 62. I have a second camera, which I'm going to start now. Acromegaly is a disease by which the hand, feet and skin are getting enlarged, and especially the lower jaw. And it is caused through the pituitary gland, which, because of a non-cancerous tumor, is releasing excessive growth hormone. That occurs after the normal growing has happened. If it happens already during childhood with excessive production of growth hormone, then it gives gigantism. That is according to Keith Hodgkin's Family Medical Advisor, page 62, but this is no medical advice. Okay, we have that. I'm going to stop the camera and start again. Because we came over two interesting things. I don't know if you're taking this book now, maybe with these things a bit literally or something, but let's take it. Here, circulation problems in the eye. There was written, the small hemorrhages which can occur with diabetes or high blood pressure are part of a general strain on the circulation which these conditions can cause. Blood vessel blockages are usually caused by small clots which may form in arteries affected by atheroma, or in veins crossed by small hardened arteries. If I understand this text correctly, that means that there's just a hardened artery lying on a normal vein, and that blocks it. Can there now hemorrhages happening in veins? We're going to take them by word and take it like that. Exhibitionate what is here said, so that it becomes clear that we are wrong or right. So how are we going to say it? I can say it. Blood vessel blockage can occur through hardened arteries lying on top of them, according to, we're going to say it like that. Blood vessel blockage can happen through hardened arteries lying on top of them, according to Keith Hodgkin's Family Medical Advisor, where it says, blood vessel blockages are usually caused by small clots which may form in arteries affected by atheroma, or in veins crossed by small hardened arteries. But this is no medical advice. I'm setting the camera back again. And not the other thing which is more clear expressed. But we put here an important thing, and I don't know if you find it anywhere else. We are pretty close to a source. It was just here. It was the ribs and the cervical ribs and the cervical ribs and one rib too much. Now there was it here. Pain in the arm may also result from a nerve getting trapped by neck muscle. Where are you going to read? Let's start with the thing. If you notice such a symptoms, it's clear that we're taking it out of context. And the question is, a muscle can a neck muscle can trap a nerve and cause pain. A muscle can trap a nerve and cause pain, according to Keith Hodgkins, family medical advisor, where it says under cervical rib syndrome, if you notice such symptoms, report them to your doctor. It's spoken of cervical rib syndrome symptoms. He may recommend x-rays to find out whether a cervical rib is present, though in most cases the symptoms will have resulted from some other cause such as cervical spondylitis or carpal tunnel syndrome. Pains in the arm may also result from a nerve getting trapped by a neck muscle. But this is no medical advice. Okay, do we have that? I'm going to stop the camera. And that was the Acromegaly. Alright, I'm back to trying. If you were here for medicine, you can go directly to the next part of medicine. We will do now the wrist training. If you stay and participate in the wrist training, then it's very down this good stable stance. Arms next to us, hands on the fists, we're going down the fists spotlight. And again up. And down. And now, again, fists into the inside, into the outside. And flat hands and to the inside. Then magician. Now we're having 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as far as we can go with a little bit of effort, make it exercise, flat hands and open with the pancake flipper. And the third rule is that we're not overdoing it. We just want to strengthen, not to exhaust. And next exercise, the T-Rex in the morning. Flat hands out and down. And the next exercise, we could run on a cast bucket. Fists into the inside. Up. Inside. And the other way. Down. Inside. And now the trap anxious with fever. Fists down and press a bit against it. Pull from the outside. Right from the top. And the bottom. Out of the other side. Fists down. Press a bit against it. Pull on the outside. Press one top. And forward. And we're going on with the T-Rex in the chin. Press with moderate force on the tennis ball, or do it without one, just make a strong fist. Release and press again. Release and press again. And switch. And press. Release and press. Now, cautious big bang. Place the fingertips of one hand on top of the fingernails of the other hand. Press a bit and open slowly and close slowly. And another time. And on the other side, as I'm switching. And now, the arms up. Bring the fists into flexion, strong fists, and bring them down. Go to stable stance. And again up. Now turn it around. Keep this flexion position. Again down and up. And turn again around. Stay in flexion. Down. And up you can make it slow. And last time, turn it around. Down. Up. And down. Next exercise. The field is into symphysis director. Open the fists and close. And open. And now you can take a break if you want to. You can take a break all the time. We have a lot of exercises. Down with the hands and flat fingers. Again, up, strong fists. Before testing the water temperature. Down, flat fingers. So skip this exercise. These are a lot of exercises. And again down. And up. One last time. And now the bicycle bridge. Flat hands and bend the middle knuckles. And up. Again bending. Open. Last time bending. And open. Another claw. Flat hands and the claws. And open. Claws. Open and last time claws. Open. Next exercise. Arms in, strong fists into flexion. And the outside extension flat fingers. You can skip this exercise again if you want to take a break. We just want to stand, not exhaust. And again out, extension flat fingers. In, strong fists flexion. out extension, and in, and out, and also nothing. And now the ice axe flat hand, bend it to knuckles and press on all 4 fingers. And with the other hand, bend it all 4 fingers, press it. And we've made it to the last exercise, both unfolding rocket boosters. Tall up and long arms, strong fists, and with fists into flexion. And out extension, flat fingers. Inside strong fist flexion. Outside extension, flat fingers. Inside against strong fist flexion. Outside extension, flat fingers. And flexion last round. And extension, flat fingers. Now, with the closing exercise, we go with moderate pressure over the middle part of the lower arm to relax the extensor digitorum muscle. But last time, we opened. And on the other side. And that was the wrist training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, cluster headache, and after we've done that, we're gonna do standing yoga. And if you participate in the standing yoga, then it's with the yoga muscle. And we're talking about internal anatomy, probably a bit, disease, and this is no medical advice. We're just learning about it. Cluster headache. A severe headache which tends to reoccur nightly for several weeks or months and then disappears for years. Okay, a severe headache, so strong headache, and it is usually in the night over weeks and months and then disappears. Its name derives from the habit of appearing in clusters. Cluster headaches are 4 times more common in men than in women. I don't really understand what I mean with cluster headaches, but maybe you do. Okay, they are 4 times more common by men than in women. The headache, which usually begins 2 or 3 hours after falling asleep, starts as an intense pain behind one eye, which wakens the patient. I think it's interesting that it happens after the person has fallen to sleep. Maybe you're going to tell something a bit, but I think that's something very interesting. The headache, which usually begins 2 or 3 hours after falling asleep, starts as an intense pain behind one eye, which wakes up the patient. Okay, the person feels after having fallen asleep in the night, 2 or 3 hours into the night, a pain behind the eye. The pain is continuous rather than throbbing, as migraine. Okay, migraine has a throbbing pain. Whatever that means. It's like, I don't know what it means. The pain is continuous rather than throbbing. So a continuous steady pain, to understand on that. The eye fills with tears, the nose gets blocked, and on the affected side, and then runs. It would be interesting if it is just on the affected side. That would be interesting, especially for the nose. Okay, pain behind the eye 2-3 hours after having fallen asleep, and then tearing of the one eye and also of the nose, blocking, and then running of nose. The cheek may swell too, and also swelling of the cheek. The symptoms last 1 or 2 hours. Continuous pain to 1 or 2 hours. Unlike migraine, it is rather for a cluster headache to produce nausea and vomiting. I don't know what's the difference between nausea. It is. I said it previously. I don't know what it is. It is. It is rare for a cluster headache to produce nausea and vomiting. So, the symptoms last for 1 or 2 hours. Unlike migraine, it is rare for a cluster headache to produce nausea and vomiting. Again, I want to stress at this point again, that book is from the 80s. Maybe there was, in the meantime, some science done. They are saying here that migraine has more likely nausea and vomiting. And this cluster headache, not so much. Bouts of cluster headache may be brought on by stress or alcohol. Why does it happen not 2 or 3 hours into the night? I think that's the most interesting part. They are thought to be caused by a minor temporary disturbance of circulation in the brain. Okay, we're saying that maybe stress or alcohol can make it more likely to happen, and that there is a minor temporary disturbance of circulation in the brain. Why does it cause pain? If this is temporary circulation problem. If the symptoms are reported to you, If the symptoms are reported to your doctor, he or she is likely to prescribe a painkiller with added ergot, which helps to restore the normal circulation. Taken nightly before going to bed, this may prevent an attack occurring. Why? But okay. Does the medicament have an influence on this temporary disturbance of circulation in the brain? Okay, now we're here for more for clinical thing. Okay, there can be prescribed a painkiller, and that can be taken, and that before going to bed can maybe prevent attacks. Okay, that was Cholera. If you were here for medicine, you can go directly. And again, this was no medical advice, we just did what was there. If you were here for medicine, you can go directly to the next part of medicine. We will do normal standing yoga. If you stay and participate in the standing yoga, then that's when you have a feet standing together. Breathe in and the feet arms up between. Hier geht's weg. Breathe out the arms down. Breathe out the arms down. In the arms up. Out the arms down. In the arms up. Out open to the side. In the arms up. Out open to the other side. In and up. Making a space between the feet and opening the one side. In and up. And out and sink halfway down. In and up. And out on the one side. In and up. And out, lean onto the knees. We're doing standing cat and cow. Breathe in. And out, make a head of the back of the cat. Again in. And out the belly of the back of the cow. In. And out the head of the back. In. And out. In. And out, come up and back up, make it a top and backwards, shoulder, shoulder. Again, the arms up. Out, open to the side. In and up. And out, bring them over the sides, down and going down into the chair. You can come halfway up. High up. And out and we're coming up. Breathe in and reach high. Out, up to the side. In and up. And out over the sides, down into the chair. You can come halfway up. High up. And out and we're coming up. And bring the arms back without. So shoulder blades together. Breathe in the arms up. And out again down. Drop the shoulder blades together. In and up. Close the feet and also the hands and lean back. Again in. Out and lean again back. In and up. And out over to one side. In and to the middle. Out over to the other side. In and to the middle. Out across the arms and turn the fingers, reach high. Breathe in. And breathe out, reach in front, out of the back. Again, in and up. Intertwine the other way around, breathe in, reach high. Breathe out, reach in front, out of the back. In and up. And out, come up onto tiptoes. Breathe again in, reach high. And out and sink down into the chair. On tiptoes. In and up. And out and down. In and up. And out. Feet together, heels together, arms over sides down, we are down. And breathe again in. Bend the right leg. And breathe out and stretch the left leg. Breathe in and change. And out and stretch the right leg. Breathe in and change. And out and stretch the left leg. In and change. Out, stretch the right leg. In, into the middle, and just out and down. Breathe in, lift the right hand up to the sky. Breathe out with the left knee, look over the right shoulder to the right hand. In and the arm down, bow leg straight. Out. Breathe in, lift the left hand up to the sky. Breathe out with the right knee, look over the left shoulder to the left hand. In and the arm down, and down, breathe out. Now the pelican, make a hand to space between the feet, shift the weight to the heels, and breathe in and come down. And breathe out, come up. In and down. And out and up. The last time in and down. And out and up. Take hold on the elbows, trebuchets, counterweight, and gently rock from side to side. Bring the hands down, the feet together. Breathe in, come halfway up with a straight back into monkey half lift. Breathe out, come up. Breathe in, come halfway up, straight back. And out and down. And now breathe in, the up diving swan, hands over sides up, hands together, hands down. Now have the feet pointing to the outside and all the limbs spaced between the heels. Breathe in, lift the arms up. Then breathe out and sink down and place your elbows against the insides of the knees. Now breathe in, straighten up. And out and come with the belly up. Breathe in. And out and down. And breathe in and straighten up. Now you can go again back up, or you breathe in and come up. One straight line. Hands down. Breathe in. Wherever you are, arms up and out, and we're coming back into the garden pose, even if you were back up. Breathe again in and out, shoes up, back, and again down, again in and up, and out and down, and one more round. Breathe in, straighten up, out, shoes, arms down, again up, out and down, and for last time, breathe in, straighten up, and out we all coming up in one straight line. And hands down. On the sun board, legs wide apart, breathe in, lift the arms up, and breathe out, sink down. Now come one foot onto the toes. The other one. Now breathe in and press something imaginary heavy up. And out and down. And in and out. One more time, breathe in and up. Down. Breathe in and up. Bring your hands down and ankles. Now have your feet standing kind of wide apart. Stretch your knees, intertwine your fingers behind the neck. Breathe over to one side, breathe in and up. And out, bring the head over to one side. Chin down to the clavicle. Breathe again in. And out, pull the arm and the shoulder down. Lift the gaze, bring it back into the middle and out to the other side. Bring the hand out to the other side, one side, breathe in. Out, chin down to the clavicle. Pull the arm and the shoulder. In, lift the gaze, and the hand back into the middle. Now have the legs standing and shoulder wide apart, breathing in, coming up. And out and sinking down. And now come with the leg up. And down, back up again. Also again. And again. Breathe in, lift the arms up. Out, sink down. Elbows right inside of the legs. And come with the leg up. Come down. You can do this again, or you do the diver, but the diver can go onto the back. Legs wide apart, arms up to the side, breathe in. Out, lean in front, this can go onto the back. Make a round back. Round back. And again, arms up to the side, this can go onto the back. Forward, straight back. Round back. And come up with the crown of the head first up. One more time. In front, this can go onto the back, straight back. Round back. Come with the crown of the head first up. And down with the arms. And we're ending. Feet are standing together, breathe in with the arms up. And out, lean back, long arms. Skyarker. Breathe in into the middle. And out and back. Into the middle. And out and down, we're ending. The feet swings, breathe in with the arms up. Go the arms down. In the arms down. Out and down. Now the cactus collecting its stings in the evening. We've ended the arms up. Bring the hands to touch. Allow the hands slowly down to heart center. And also standing yoga. I thank you very much and next time. Hi and welcome. I'm trying to learn medicine today. Celiac disease. After we've done it, we're going to do standing yoga. And if you participate in the standing yoga, that is at your own risk. And we're talking about a disease, internal anatomy, and eating disease. And this is no medical advice, so we're just reading about it. Celiac disease. That is a rare disorder in which the patient is unable to absorb essential food from the intestines. Celiac disease runs in families and commonly affects babies, while mild cases might not be diagnosed until adult life. Okay, where the intestine is not properly absorbing the things in the food. At least some of them. And it affects babies, but mild cases are not diagnosed until the adult life oftentimes. Symptoms in babies. Failure to thrive and grow after weaning between the age 6 to 18. I don't know what weaning is. Okay, they don't grow between 6 and 18 months. The child is often miserable and weak with wasted saddle muscles and a distended abdomen. I don't know what distended means. Okay, the child is miserable, weak, and has feeble muscles. And now we're talking also about defecation a bit. Stools are abnormally bulky, soft, pale, and exceptionally smelly. Symptoms in adults. Unpredictable attacks of diarrhea. Stools are typically pale, bulky, frothy, and greasy and tend to float. The patient may suffer badly from wind, and the abdomen is often distended. Wasting and weakness of the rest of the body. Duration. In children, the disease may last into adolescence when it tends to subside. It may recur later. Why does it subside? Okay. Causes. The disorder is due to an intolerance of gluten, a protein found in wheat, barley, rye, and possible oats, and so symptoms do not appear until flour is added to a baby's diet. Okay, the disorder is due to an intolerance of gluten, a protein found in wheat, barley, rye, and possibly oats, and so symptoms do not appear until flour is added to a baby's diet. Now, this book's from the 80s. It might be that some things have changed here, but we're saying that the first initial sentence, maybe something has changed in the knowledge since the 80s, but a rare disorder. Now, next thing, complications. If untreated, growth and development may be affected. The child easily contracts infections of all kinds. So if untreated, growth and development may be affected. Vitamin and mineral deficiencies may cause anemia. Sore tongue and mouth, thinning of the bones and a tendency to bleed. This all sounds pretty drastic, what is all here. A rare disorder is all pretty drastically. So misdiagnosing seems not to be that obvious, but maybe there's more to it. If the symptoms consist for several weeks, then to consult a doctor. When to consult a doctor? If the symptoms persist for several weeks. What the doctor might do: send the patient for tests to confirm the diagnosis. So making a test to confirm the diagnosis. Advice about diet and supply prescriptions for gluten-free dietary products and any necessary vitamins. Let's do it again. Advice about diet, so about what is to eat, and supply prescriptions for gluten-free dietary products and any necessary vitamins. Okay, there is told what not to eat because there's gluten in it and what to eat instead, and also which necessary vitamins are to obtain. Rice, corn, or soy flour can be substituted for wheat flour. Okay, we're saying rice can be eaten, or corn, or soy flour. Suggest that parents and other children of the family be investigated to see if they are intolerant of gluten. So they said it runs in the family. So suggest that parents and other children of the family be investigated to see if they are intolerant of gluten. Outlook. Once the offending foods are cut out of the diet, the patient will enjoy normal health. Now, what were the complications? The complications were, if untreated, growth and development may be affected. The child easily contracts infections of all kinds. Vitamin and mineral deficiencies may cause anemia, sore-tongue, mouth, thinning of the bones, and a tendency to bleed. Symptoms in babies: failure to thrive and grow after weaning between the ages 6 to 8 is urinary. Now, the child is often miserable and weak, with wasted feeble muscles and a distended abdomen. Stools are abnormal bulky, soft, pale, and exceptionally smelly. Symptoms in adults: unpredictable attacks of diarrhea. Stools are typically pale, bulky, frothy, and greasy, and tend to float. The patient may suffer badly from wind, and the abdomen is often distended, wasting and weakness of the rest of the body. Anemia. We were before. Here's anemia. It is written with an A. Anemia. A reduction in the quantity of oxygen-carrying blood hemoglobin in the, I can't remember it. A reduction in the quantity, so in the amount, of oxygen-carrying hemoglobin in the blood. Why can't I remember it? Because I don't understand the word. So yeah, they have to look up where the word comes from. What are the pieces out of which the word is built? Anemia. I've been looking at it for the second time, but we were not previously. Now, that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now Wristtraining yoga. If you stay and participate in Wristtraining yoga, then it's better at your own risk. We're starting with eagle swings. Feet are together and we're breathing in and lifting the arms up. If you participate, it's better at your own risk. And out the arms down. And again, this was no medical advice. I just read it. We're beginning. And out the arms down. Again in the arms down. And out the arms down. In the arms up. Out the arms down. In the arms up. Out open to the side. In the arms up. Out open to the side. In the arms up. Bring it in space between the toes and out open to the side. In the arms up. And out and sink halfway down. Before you come up. Out open to the side. In and up. And out and sink down. In and up. Out the arms down and we're leaning onto the knees, standing cat and cow. Breathe in. And out, make a round back, ahead of the back cat. And into the middle. And out, the belly of the back, cow. In. And out, the cat. In into the middle. Out, the cow. And in into the middle. Out, come with the round back, up, back into the top, back with shoulder. Again, the arms up. Out, up to the side. In the middle. And out, bring all the sides down into the chair. We then come halfway up. Higher up. And out and come up. Breathe in, reach high. Breathe out, open to the side. In into the middle. Out, the arms over the sides down into the chair. Breathe in, come halfway up. Higher. And out and coming up. Now breathe in, come up onto the toes. And breathe out and sink it down into a chair. Breathe in, come up. And out and down. Again, in and up. And out the arms of the sides, down, feet together, long straight legs and hanging down. You're doing the marmot. Breathe in and bend the right leg. Bend out and stretch left leg. In and change. And out and stretch right leg. In and change. Out, stretch left leg. In and change. Out, stretch right leg. In and top of middle. Out and down. The penguin. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in, hand down. Breathe out, hand down. Breathe in, left hand up. And breathe out, bend the right knee and look over the left hand to the left. Or the left shoulder to the left. In, arm down, out. Over extreme. Now the pelican. Make a hand of space between the feet. Shift the weight to the heels and breathe in and come out. And now they come up again. And down again. And out and up. And the last time back. And out. Now the trio shakes counter. Take hold on the elbows and gently swing from side to side. Both arms again down, your feet together, close your feet, and breathe in, come halfway up with a straight back into monkey half lift. Breathe out again down. In halfway up. Out and down. Breathe in the updiving swan, arms over the sides up, and bring them again down. Now, the garden pose. The toes to the outside, all in a space between the heels. Breathe in, lift the arms up. And breathe out and sink down and place the elbows against the insides of the knees. Breathe in and straighten up. And you can breathe now out and come to the back up. And breathe again in. And out back into the garden pose, or you do the variation, you breathe in. And out you come up in one straight line, you can go back if you like to. The arms down, again in, the arms up. And out. Back into the garden pose wherever you have gone back or up. And again, breathe in, straighten up, and out, go either back or up in one straight line. If you go up, tuck the pelvis in and come up in one straight line with the crown of the head first. Breathe again in, and out again back into the garden pose. Breathe in, straighten up, and if you go up, tuck the pelvis in and come with the crown of the head first up. Arms down and up, and out and down, and last time. Breathe again in, and out, we're coming up in one straight line, you can go back again, arms down, and last time into the garden pose, we're breathing in, and out, we're ending the garden pose by coming up in one straight line. The next exercise you can do again, a variation. You have the legs standing quite apart, and you breathe in, and out, you roll back down to the ground. And you bend the knees, the elbows on the outside. You can come over the garden pose or just round back up. And the other variation. Breathe in and down, further back. And just up again. So, good shoulder. Or you do something else with diver, but that can go to the back, arms to the side, breathe in. Out, lean with a straight back forward. This can go to the back. Make a round back. Come with the crown of the head first, wieder up. Again up. Breathe again in, and out, lean with a straight back forward. This can go to the back, make a round back, and come with the crown of the head, again up. One last round, breathe in, out, straight back forward, round back, and crown of the head. First up, and arms down. Now stretch of Venus, intertwine the fingers behind the back, bring them over to one side, turn up, shoulders back, breathe in, out. Head over to the side with the hands arched in, down to the clavicle. Breathe again in. Out, pull the shoulder in and down. In, lift the gaze, turn over to the other side, hands over to the other side. Breathe in. And out, down to the clavicle, pull the arm and the shoulder down. Lift the gaze, turn it back into the middle. The feet are standing together, breathing in, lift the arms up. And breathe out, lean back, draw the shoulder blades together. In the arms up, we do the marker over, cross your fingers and turn your fingers to each other. And breathe out, reach the front all over the back of the chair. In the arms up. Out, lean back, draw the shoulder blades together. In over, cross your arms again, intertwine the fingers to each side. Breathe out, reach the front all over the back. In the arms up. And out, lean with long arms back, with cargo. In the arms up. And out and back. In the arms up. And out, bring more of the sides down. We're doing the cactus, collecting its things into the evening. Bring the hands to touch, lower them down towards the center. That was the Senior Yoga. I thank you very much. And until next time. Hi and welcome. I'm trying to learn Acroparesthesia. And after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at their own risk. And we're talking about a medical disorder. And this is no medical advice. We're just learning about it. And this is part 2, if I remember correctly. Acroparesthesia. Now we want to do a presentation, so I'm going to practice with the word Acroparesthesia. Acroparesthesia. Paresthesia. Acoparesthesia. Acroparesthesia. 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 Okay. An intense prickling or tingling sensation in the extremities of the body, the fingers or toes. Acroparesthesia. Acroparesthesia is an intense prickling of the extremities or the fingers or the toes. In the extremities of the body, the fingers or the toes. All 4, I think. In the extremities, arms, lower legs, fingers and toes. In the extremities of the body and the fingers and the toes. Acroparesthesia. Intense prickling, tingling in the extremities and the fingers and toes. The feeling may be caused by pressure on a nerve, as for example when it is experienced after sleeping in an uncomfortable position. Now I don't know if it is an example, it feels like as if you have that, or is that if you have that is acroparesthesia. So we're keeping that vague. We're not going to say it in specific. We're not going to say it at all. It is either wrong or just an explanation of how it feels, but we're saying it's prickling potentially. That's enough. It can be caused through pressure on a nerve. That's what we say. More rarely, it may be a sign of a trapped nerve. Then it is that of sitting on it, that is with acroparesthesia. But it can be also trapped nerve, carpal tunnel syndrome, or a disease of the nervous system. The feeling may be caused by pressure on a nerve, as for example when it is experienced after sleeping in an uncomfortable position. That they would not write it just as an explanation. In what is when that, if not acroparesthesia. It can be caused by sleeping in an uncomfortable position and putting thereby pressure on the nerve. But it can also be a sign of a trapped nerve, like carpal tunnel syndrome, or a disease of the nervous system, or a disorder of the circulatory system, or Raynaud's syndrome, such as Raynaud's syndrome. And this is also we have to do that. But it can be also the sign of a trapped nerve, for example by carpal tunnel syndrome, or a disease of the nervous system, or disorder of the circulatory system by Raynaud's syndrome. Acroparesthesia. Acroparesthesia. Yeah, that's enough. Anything else? Key photographs? Medical. Okay, I think we have it. I'm going to start the camera and we just going to look over it. Acroparesthesia, that is a feeling of prickling or tingling in the extremities of the fingers and toes. And it can be caused through pressure through sleeping in an uncomfortable position, or it can be caused also through more rarely than through a trapped nerve through carpal tunnel syndrome, or a disease of the nervous system, or disorder of the circulatory system through Raynaud's disease, for example. And that is according to Keith Hodgkin's Family Medical Advisor, page 62, but this is no medical advice. I think I've got something in there. Oh no. Okay, I'm going to start the camera. And I started it again because I have something else. We had the problem with the esophagus and the esophagus. It's just British and American spelling. I want to say it now. Esophagus is British spelling and esophagus is American spelling. It's just a different spelling. Both means the esophagus, the food pipe from the pharynx at the back of the mouth down to the stomach. I'm going to start the camera again. And doing something else, but we're not going to record that. We had the question. No, we had not the question. We were talking about the sphincter at the lower end of the muscle ring at the lower end of the esophagus. And there's another one at the top. So the esophagus has two, one on the bottom and one on the outside. I was sorting all the videos we did, and I came across it. And now the other thing that I'm going to do in the video was that the adrenal glands. We had adrenaline, and it was said that it was made through the adrenal glands, and I needed to know if it's adrenaline or adrenaline. I haven't paid attention to it, but it seems to be both. But that's not the point. I found out that the adrenal glands are. So they are above the kidneys. The kidneys are half underneath the last strip of rib cage, and they are directly above them. So I'm not going to say anything. The adrenal glands are directly above the kidneys. The kidneys are on both sides half underneath the lower strip, and the adrenal glands are a little bit above the kidneys. Now I'm going to stop the camera. And now we have it all. Now, if you were here for medicine, you can already get to the next part of medicine. We will do now the shoulder impingement training. If you're staying participating in the shoulder impingement training, then it's better to ask. Good in same stance. And then we shot a second, so we can't back. And backwards. Now, long arms, strong fists. Go as far back as you can with the shoulders. Along the four corners, always as far as you can. And change the direction. Into the knees, hinge forward, round back, straight back. Let the arms hang and pinch the scapula together. Big fists, lift the arms up and pinch the scapula together. Next round. Fists up. And next exercise. Your knees hinge forward with a round back with the arms hanging like fists and the arms to the inside. Lift the arms high up, bring them together, straighten up, bring the shoulders down, together. Arms high up and together, shoulders down, together. Release and a second round. Hinge forward with a round back, let the arms hang like fists and the arms to the inside. Arms high up and together, straighten up, shoulders down. Arms high up and together, shoulders down, together. And release. And now lift the arms up. Let it go. One more time. Arms to the side. Good in still stance, long arms, strong fists, shoulders down, together. Turn the arms to the inside, shoulders down, together. Arms to the outside, shoulders down, together. In the reverse position. Straight. Arms up to the side, with in front. Arms in front, shoulders down, together. And arms back, shoulders up and front. Arms in front, stop, together. Arms back, shoulders up. And release. I don't know what's going on. Shrug. Arms up. Shoulders up. And release. Arms up. Shoulders up. Arms up. Shoulders up. And release. Arms together. Down to the outside. Sometimes. Long arm to the outside, let it fall down. I'm trying to catch it again. And lift. And stitching. Now front, shoulders back, and down. Hold the arm in 15 minutes to right, relax the arm, lower the back of the shoulder, then palm up to the sky. And the other arm in front. Shoulder back, down. Hold the arm in 15 minutes to try to relax the arm, lower the back of the shoulder, palm up to the sky. And that was a short Wristtraining training. I thank you very much, and until next time. Hi, I'm Becca. I'm trying to learn medicine today, Addison's disease, and after we've done that, we're going to do median plane training. And if you participate in the median plane training, then it's at your own risk. And we're talking about a disease, internal anatomy, and this is no medical advice, so we're just reading about it. Addison's disease, this is part 2. Addison's disease, a very rare disorder in which the body becomes incapable of reacting to physical stress. because the adrenal glands, we found it out, the other one above the kidneys, and these glands which control the metabolism of salts and sexual organs keys to work. Symptoms often come on gradually and may be difficult to recognize. But if early symptoms are neglected, the first apparent symptom may be sudden collapse. Okay, symptoms: increasing weakness and tiredness leading to complete exhaustion. Loss of appetite, nausea and abdominal pain, fainting on standing, caused by low blood pressure, darkening of skin, accentuated by sunlight. Dark patches inside the mouth, collapse after minor physical stresses such as slight infections or injuries. Okay, we're going to treat it now the way as if we hadn't done it previously. Okay, this is a very rare disorder we're studying. So, a very rare disorder in which the body becomes incapable of reacting to physical stresses because the adrenal glands, the glands which control the metabolism of salts and sexual organs, cease to work. The whole system of the glands. I noticed that when I saw the picture, I also saw one of the course where the glands are, but they are above the kidneys, the adrenal glands. Are they just as the organs all over the body and in some places? It seems like that, with a pituitary gland in the brain, and we had something else. But I never have seen someone having a model like with the organs, with the stomach and the intestine, the heart, the lungs, and so on. I never had seen someone the model with here are the glands. The whole concept of the glands is and these glands and also are these glands when doing different things, and also the names. They are called this gland. The organs are not called lung organ, heart organ, at least not in normal speaking. But if, let's say, the adrenal glands cease to work, and the person then, if undiagnosed and untreated, the condition can cause eventual circulatory collapse and death, if they are as important as an organ. Is there a lack in something? Okay, the adrenal glands, they stop to work. It is a very rare disorder. And the adrenal glands are stopping to work because they are not other glands who can then jump in, or is it like the organs? They cannot just start the heart, start to breathe if the lungs collapse. Symptoms often come on gradually and may be difficult to recognize. But if early symptoms are neglected, the first apparent symptom may be sudden collapse. Okay, Addison's disease. Now the symptoms: increasing weakness and tiredness leading to complete exhaustion. Okay, the person gets more and more weak and exhausted and then completely exhausted. Loss of appetite, nausea and abdominal pain. I came across nausea. So we're talking a little bit more over the course of the video also more about more medical things. Vomiting is a pure act of puking out. And nausea is the feeling, I think. And there was another thing. There wasn't bloating, but something similar. That is the feeling of being full. Nausea is feeling something like that. And vomiting is when puking out. I think that's it. Loss of appetite, nausea, and abdominal pains can have marked Addison's disease. Faintness on standing, caused by low blood pressure. So fainting when standing up, because of low blood pressure. Darkening of the skin, accentuated by sunlight. The people have darkened skin, accentuated by sunlight. Dark patches inside the mouth. Collapse after minor physical stresses, such as slight infections or injuries. Now we're interesting how long it takes for the thing, weeks, months, or years, for Addison's disease to come. Duration: the condition is permanent and drug treatment must continue indefinitely. This book's from the 80s. Maybe some things have changed. Okay, the condition is permanently and drug treatment has to be done and continually. Causes: destruction of the outer layers of the adrenal glands by autoimmune processes. That is, the body's own defenses somehow react against the gland's tissue. Maybe he had it. Okay, the autoimmune system attacks the own adrenal glands, and also really by tuberculosis infection. Now we're going to do a second part to Addison's disease because there's something else. We have the adrenal glands, where we are, that was already last part, and the nausea, that is the feeling of being about to puke up or something, or close to it, and the bleating, bloating was it, I think. Bloating, but it was a feeling of fullness in the stomach also. Now the other thing which we didn't know where the breastbone is. Now the breastbone is the sternum, the sternum is here. Now, and I want to do it in the video, and I want to say that. So I have a second camera, so I'm going to start off. And I want to say that that's what is the title? The breastbone is the sternum or something like that will be the title. It's just another name. The breastbone is here in the middle, and I already did once a video about the sternum. It have two clavicles, and they have then here the suprasternal notch, and then comes the sternum down between the ribs, and it has the manubrium at the top, and the body in the middle, and then the xiphoid process down. And what I want to say, just that it is the same. The breastbone is the sternum, it's just another name. The sternum is here in the middle of the chest. Here are coming the two clavicles, then here the suprasternal notch, and then that is the sternum or the breastbone with the manubrium part, the body part, and the xiphoid process, sternum or breastbone. I want to stop the camera. But there's another thing about which I came across, and that is, we were wondering about Achalasia of Cardia, and it was that I'm actually not read so much about it, but it is in which the muscles at the esophagus gullet fail to work properly. We call it gullet, fail to work properly. And the sphincter muscle ring at the lower end of the esophagus relaxes and lets the food pass through. And in Achalasia, the esophageal muscles and the sphincter do not respond to swallow, and so food and saliva are retained in the esophagus, which becomes swollen. Now, Cardia. I was wondering about it. And because it sounds like heart, because of cardiology and all the thing. But the cardia is the region, and I want to do it now in the video, is the region in the stomach where these esophagus ends in. And the sphincter there is then also called cardiac sphincter. There's one, we have it in the last video followed, that there are two sphincters, one on top and one on the bottom. And the one on the bottom is also called cardiac, or cardiac sphincter, cardiac sphincter. In the region of the stomach where the esophagus and esophagus is the same, just American and British spelling, where it comes in, what is called the cardiac region. I also came across, I looked at it a little bit up, but I came across it, I think, that there's maybe also, one source said that also the region of the heart can be also called cardiac region, but it was just one source. The other one said all the rest. The cardiac region is in the stomach, the region where the esophagus comes in. The esophagus comes from the pharynx down and through the cardiac sphincter into the stomach, and the region where the esophagus through the cardiac sphincter comes into the stomach is called the cardiac region. Now stop the camera, but I have something else. Now, and Achalasia, A is as always Greek and means not, or not. A something. Achalasia. And Achalasia, that means relaxation in Greek. Achalasia means relaxation. So it's Achalasia of the cardia. And it's just non-relaxation of the cardiac sphincter region, whatever. And because it does not relax, the food cannot pass into the cardia, the upper part of the stomach, and gets stuck. And I think I want to have at least one video about the Greek word. No, what is it? Video really. About the Greek word Achalasia. Achalasia is Greek for relaxation. I'll stop the camera, and I think I'm going to start it again. But I don't know yet. Achalasia of the cardia. No, I don't know what the word means. Yes, I know what it means, but I don't really know what cardia means. It is for the cardiac region. So the word, basically, it means what it says. If we just know these one or two words in Greek, we don't have to speak completely Greek or Latin, but if we just know these one or two vocabularies in Greek or Latin, Achalasia means relaxation, and it's achalasia, non-relaxation of the cardia and cardiac region. Then all these names make sense. But I think it was one. So I stop the camera, and we're gonna do now the rest. So that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now the medium plane training. If you stay and participate in the medium plane training, that's better. How is good. We're bringing my neck up, and we're pointing the foot down. I did another thing. Okay. Now the leg to the side. Toes are pointing forward and stretching the inner side of the leg. And over to the other side. And over side to side. And now to the next exercise. One leg up. Right angle with the leg, flex foot, even hips taller with the back, and press forward top against. Little bend in the elbow. And the other leg up and press foot up again. And next exercise, leg up and now press for the inside, hands fully, right angle with the leg, flex foot, even hips taller with the back, little bend in the elbow. And the other leg up. A little bit in. And next exercise, one leg up and the knee presses up to the side. And the other leg up. Knee presses up to the side. And now, leg up, the heavy swing low. Press on the outside. And up. And cross it. Up again. And the last time. And the other leg up. On the inside. And the other side. And now walk on the place. And the triangle bend the legs for the park again. Now, everything cross the legs. And breathe out. It was the medium plane training. I thank you very much and until next time. Hi and welcome. I am trying to learn medicine today. Addison's disease, and after we've done that, we're gonna do standing yoga. And if you participate in the standing yoga, then it's at your own risk. This is part 2 or 3, and we're talking about internal anatomy and the disease or disorder, and also the symptoms of the disease. And this is no medical advice, we're just reading about it, learning it. Now, it is a rare disorder in which body becomes incapable of reacting to physical stresses, so the adrenal glands are stopping to work. And they are controlling metabolism of salts and sexual organs, and now they cease to work. Now the adrenal glands cease to work above the kidneys. The adrenal glands stopping to work, Addison's disease. If the symptoms are starting gradually and becoming them over time. But if early symptoms are neglected, the first apparent symptom may be sudden collapse. The symptoms are getting more severe, up to sudden collapse. Basically, weakness does it start with. We have it in the last part, so I'm just reading it. I'm just recapitulating. No, what is it? Whatever, it's named. Increasing weakness, tiredness, loss of appetite, nausea, abdominal pain, faintness on standing caused by low blood pressure, darkening of the skin accentuated by sunlight, dark patches inside the mouth, collapse after minor physical stress such as slight infections or injuries. Duration permanent even if drug treatment is done. Causes destruction of the outer layer or outer layers of the adrenal glands by autoimmune processes. That is, the body's own defenses somehow react against the gland's tissue. Okay, the causes that, for some reason, that, maybe you want to say it actually, that somehow, that's quote, the autoimmune processes in the human body attack the outer layer of the adrenal glands. The adrenal glands stop to work, and Addison's disease happens. The adrenal glands are doing a lot of metabolism, and the other person gets more weak gradually does it start, but it gets more severe, and even with drug treatment, Addison and definite disease, not so. And the symptoms are weakness, tiredness, nausea. If they are not treated, it starts with, it's oftentimes the first signal that some comes, we'll see. If early symptoms are neglected, the first apparent symptom may be sudden collapse. So weakness, tiredness, lots of appetite, nausea, abdominal pain, nausea, faintness on standing, darkening of skin, and dark patches inside the mouth, and collapse after minor physical stress. Complications: failure of the circulation from low blood pressure. Okay, the complications are the collapse, failure of the circulation from low blood pressure, and severe infections. I do understand why these infections are severe, such as pneumonia, will happen. Treatment in the home. None is advised until the condition has been diagnosed. Once the condition has been diagnosed and stabilized, close collaboration between patient and doctor is required to manage the disorder. So we want to mention also. The condition is permanent, and even if drug treatment has to be done indefinitely, and therefore a close working of the patient, of the doctor and the patient and the doctor is required to manage the disorder. Sufferers must learn how to regulate the dosage of the drugs they take. It's obvious, but I think what I mean that is actually why this thing is not always steady. Which is interesting. Just as a side note, that there are glands or hormone producers which don't produce all the time the same, and many different ones, without any apparent further reason, maybe. But they're not producing all the time the same. When to consult the doctor, as soon as any of the above symptoms occur. Once management of a condition has begun, the doctor should be consulted if there are any unusual symptoms or problems. Okay, what the doctor might do: arrange for blood tests to confirm a diagnosis, refer the patient to a hospital specialist. The specialist will probably admit the patient to hospital for further tests to show the level of salts and extent of steroid hormone deficiency. Okay, testings are done on salt. The glands which control the metabolism of salts and extent of steroid hormone deficiency. If Addison's disease is confirmed, special steroid tablets will be prescribed to replace the gland's own hormones. Special steroid tablets will be prescribed, yes. So the special steroid glands are then replacing the gland's own hormones. And the drugs are replacing the hormones which is actually the adrenal glands should put out, should set free, release. Outlook. Addison's disease is readily controlled with tablets which replace the hormones produced by the adrenal glands, and with treatment the outlook is good. But if treated indefinitely with these drugs in close cooperation with doctor and patient, then the outlook is good. If undiagnosed and untreated, the condition can cause eventual circulatory collapse and death. Okay, I think we have it all. Addison's disease. The adrenal glands above the kidneys cease to work or stop to work, and normally they are, for example, having to do with the metabolism of salt and regulation of sexual organs, or whatever you say it. They are having to do with the metabolism of the salts, the glands which control the metabolism of salts and sexual organs, and the sexual organs. And now we cease to work. And what was it here? To show the levels of salt and extent of steroid hormone deficiency. And it's been tested on, if it is tested then on salt level and steroid hormone deficiency. The symptoms are gradually starting, getting more severe. If not diagnosed, the first symptoms can be sudden collapse, increasing weakness, tiredness, nausea, loss of appetite, fainting, and collapse after minor physical stress. Darkness of skin. Maybe we should not do the presentation now. Let's do a proper one next. Okay, we're going to come back to Addison's disease in the next part, and then we will do the presentation and saying for ourselves in a separate video what Addison's disease is. But before we're going on, we had in the previous parts the question what constipation is. Now, and we're talking now a bit about defecation, and it has to do with defecation. I haven't read properly in, but it has to do with problems of passing the stool. That's constipation. And I looked a moment ago. It's actually by CO, constipation. Now, that was not the medical part. If you're here for medicine, you can go directly to the next part of medicine. We will do now the standing yoga. If you stay and participate in the standing yoga, that is at your own risk. The feet are standing together, the breathing in and lifting the arms up. Then breathe out your arms again down. In and up. Out and down. In and up. Out on the side. In and up. Out on the other side. In and up. Into the space between the feet. Breathe out on the side. Up. And out and sit down. Again, in and up. Out on the side. In and up. Out and down. In and up. Out the arms down to the knees. Breathe in. And out around back, and another back. In into the middle. Out already. In into the middle. Out. In into the middle. Out. And in. Out of the round back up and then shoulder backwards, shoulder. Breathe again in, lift the arms up. Out over the arms to the side. In and up. Out over the sides down. You think I'm halfway up? Breathe in each side, and out over the side, in and up, out over the sides down, halfway up, higher up, out and up, down. Now to the end of the neck, and breathe in, and out, bring the chin down to the chest, and roll vertebra to vertebra, deep down, walk in front, into the downward facing dog. Now lift one leg up and bring it in front. And lift the arms up. Breathe in, reach in front. Out in front. Arms to the sides. In front. Up. And now bring them to the side of one leg. Open. Again to the middle. Back and again. Side of the leg. Try to come down. Back into the middle, and again the leg high up, and again down facing dog. Lift the other leg up, bring it in front, Again, in, come up, arms up, breathe and reach high. Out in the front, arms to the sides. And elbow over to the knee side, towards the knee. Up with the arms. Close again. And now down beside the leg. Into the middle. And bring the leg up. And again down. Down facing dog. Now into high plank. And the box leg. Go back and in front again. And out. Breathe in when you go in. And out when you're back in high plank. Again in. And out the last time in. And out. Back into downward facing dog. Up on the tiptoes into stretching dog. And Acrocyanosis, however, pull my knees in. Back into stretching dog. Heels down to the ground. Walk slowly in. Breathe in. And out and walk slowly to the round back up. Make it the top of it, let's try it out. And we can lift the arms up. Up on the tiptoes and out and sink down. In and up. Out and down. In and up. And out the arms over the sides, down, down. Breathe in, bend the right leg. Out, stretch your left leg. In. Out, stretch your right leg. In and change. Out, stretch your left leg. In and change. Out. Into the middle. And out. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee, look over the right shoulder to the right hand. In, down the arm. Down. In, left hand up. Out, bend the right knee, look over the left shoulder to the left hand. In and down. And out. Make a hand of space between the feet. Shift the weight to the heels. Breathe in and out down the belly can. Bring in. And out and down. In. Now in and down. Down and up. Last time in and down. Out and up. Take hold of the elbows. And gently rock from side to side. Hands together, feet together. Breathe in, straight back. Out and down. In, straight back. Out and down. Breathe in, bring the arms over the sides up. And down. Bring the palms together, the elbows together, breathe in. And out. Bring the elbows up. Again in. And out again up. Hands together, breathe in. And out, push the front, bring the head down. In and up. Out, push the front. In and in the middle. Down. Breathe in, lift the arms up. And breathe out, draw the shoulder blades together. In and up. And out and down. In and up. Out, lean to the side. In and up. Out to the other one. In and up. Intertwine the fingers, reach high. Breathe out, reach your foot out of the back. In and the middle. Intertwine the other leg around and breathe in, reach high. Breathe out, reach your foot out of the back. Breathe in the arms up. And out and down. Intertwine the fingers behind the back, bring them over to one side, breathe in, turn up. Out, head over to one side, chin down to the clavicle, pull the arm and the shoulder down. Breathe in, lift the gaze. Turn it over to the other side, hands over to the other side, breathe again in. Out, pull the arm and shoulder down and go with the chin down. And lift the gaze back into the middle. Breathe in, lift the arms up. Breathe out, lean back with the long arms, the Celiac. In into the middle. Out and lean back. In into the middle. Out the arms down. Again, in the arms up. Out and down. In the arms up. Bring the hands to touch and lower the hands slowly down to heart center. That was a fast and short Zen yoga. I thank you very much and until next time. Hi and welcome. I am trying to learn history. Today, Addison's disease. And after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's better you have this. And if we're talking about internal anatomy, this is part 3 or 4. And we're talking about a disease, and this is no medical advice. So we're just reading and learning about it. Now we want to do a presentation about it, so we're rehearsing a bit. Addison's disease. Where do the adrenal glands above the kidneys cease to work or stop the work and produce stop the work? And we are normally controlling the metabolism of salts and also the sexual organs. The symptoms starting gradually but becoming then more and more severe, and if they are neglected, if they are ignored, if they are not recognized, then oftentimes the first symptom is sudden collapse. No, it is fatigue and weakness. Fatigue and weakness, that's good, I think. Fatigue. Where was fatigue? There was never fatigue written. Weakness and tiredness. Weakness and tiredness. Loss of appetite, nausea, and abdominal pain. But I have to remember it, not just say it. I have to say it in a moment without the book. Weakness and tiredness, nausea, and loss of appetite and abdominal pain. Fainting. Yes, that's right. Fainting caused through low blood pressure. And then darkening of the skin, accentuated by sunlight, and dark patches inside the mouth. Okay. Tiredness and weakness, nausea, loss of appetite, and I want to say fatigue. Loss of appetite, nausea, abdominal pain. Tiredness and weakness, loss of appetite, nausea, and abdominal pain, and also fainting on upstanding. And it causes low blood pressure. And also darkening of skin, which is accentuated by sunlight, and dark patches in the mouth. Inside the mouth. Darkening of the skin, darkening of skin. And also then fainting after upstanding and collapse. What is the difference between fainting and collapse? And what is Vincent collapse? So, collapse after minor physical stresses, okay. The condition is permanent, even with drug treatment. And drug treatment has to be done in collaboration with patient and doctor. Is important to manage this. So that we can learn, or they have to learn, to regulate the dosage of the drugs. And it is caused through destruction of the outer layer of the adrenal glands. By autoimmune processes. So the own body is attacking for some reason. Or reacting against, attacking the outer layer of the adrenal glands. Failure of the circulation from low blood pressure, complications. Severe infections such as pneumonia. But that is because the person is weaker, I think, pneumonia. It doesn't really make sense if the person develops pneumonia just through Addison's disease. It is that they are weakened through Addison's disease and don't get it. If undiagnosed and untreated, the condition can cause eventual circulatory collapse and death. I think we're going to say nothing to that. Doesn't really make sense to say that. Because it's not medical advice, we're focusing on the disease itself. But if you would say it, we would say the problems are low blood pressure and failure of the circulation through low blood pressure, failure of the circulation through low blood pressure, and severe infections such as pneumonia. Yes, it comes through an infection. Pneumonia, and it can cause circulatory problems up to collapse and death. Now, special steroid tablets will be prescribed to replace the glands and hormones, and the drug treatment which is taken are steroid tablets. Okay. Now what we just started, and then we're going to look at what is missing. I'm starting the second camera. Addison's disease. By Addison's disease, the autoimmune system attacks the outer layer of the adrenal glands. The adrenal glands are above the two kidneys. And normally they're controlling the metabolism of salts and the sexual organs. And now they don't work properly anymore. Now, and the symptoms are weakness and tiredness and nausea, and also fainting when upstanding, and by small exercises also collapse. And also darkening of the skin, which is accentuated by sunlight, and dark patches at the inside of the mouth. And now, if it is ignored, if the symptoms are ignored or not recognized, then the first symptoms are the collapse. The whole Addison's disease can lead to through problems with the circulation, failure of the circulation, through low blood pressure, to collapse and death, and also to infections like Chlamydia. Now, and if it is diagnosed, there is drug treatment, and that has to be done indefinitely. The symptoms all start gradually to get worse. Now, the drug treatment has to be done indefinitely, and the close cooperation between the doctor and the patient is important, and the patient has to learn to take the right dosage. And that is according to, I don't want to handle it. What are we missing? The steroid tablets. That's what I'm going to say. Addison's disease is readily controlled with tablets that replace the hormones produced by the adrenal glands, and with treatment the outlook is good. Steroid tablets, I think that was the only thing missing. Okay. Addison's disease. By Addison's disease, the autoimmune process of the body itself attacks the outer layer of the adrenal glands. They are above the kidneys, the adrenal glands. Normally they are controlling the metabolism of salts and also the sexual organs. And now we don't do it anymore. And the symptoms are setting gradually on and getting worse. And if they are not recognized, then the first symptom is sudden collapse. Now it is tiredness and weakness and nausea, abdominal pain and loss of appetite. And also darkening of the skin, which is accentuated by sunlight, and dark patches at the inside of the mouth. And complications can be a failure of the circulatory system through low blood pressure, infections, pneumonia, and then also collapse and death. Now, if recognized, there is drug treatment through steroid tablets, and the treatment has to be done indefinitely. These drugs are then replacing the hormones which the adrenal glands actually should do. And a close cooperation between doctor and patient is necessary, because the patient has to know the right proportions or dosages of the tablets, of steroid tablets. But if they are taken, the outlook is good. And that is according to Keith Hodgkin's Family Medical Advisor, page 63. I think we said no. I'm going to stop this again now. That means that it was a medical part. If you go here for medicine, you can go directly to the next part of medicine. We will do now the shoulder impingement training. If you stay and participate in the shoulder impingement training, then it's better the own risk. Good and safe stance, and we're doing shoulder circles. We're going back, up, back, front. And backwards. Now long arms, strong fists, and go as far back as you can with the shoulders. High up. And around, up, front, down, and backwards. Up, back, down, front. Now go a bit into the knees, hinge forward with not straight back. Let the arms hang, and I don't know what it's called. Pinch the shoulders together, and pull the shoulders together, short blades. Make fists, lift the arms up and still draw the shoulder blades with force together. Lift the arms down with the shoulders, and then around. Pinch the scapula together. Make fists, lift the arms up and still pinch the scapula together. Lift the arms down, the shoulders, and again into the knees. Hinge forward, this time with the round back. Let the arms hang, make fists, turn the arms to the inside. Lift the arms high up, bring them together, straighten up, bring the shoulders down, together. So the arms high up, and together, shoulders down, and together. Again into the knees, edge forward, lift the arms back, with the arms staying, make fists. From the arms to the inside, lift the arms side up, bring them together. Straighten up, bring the shoulders down, together. Arms side up, and together. Shoulders down. Please. Now just lift the arms up. And now, if this or any other exercise causes pain, then don't do it. Arms to the side and up. And now we'll lift that. Good as you stand, long arms, strong fists. And bring the shoulders down and together. And turn the arms to the side. Arms to the outside, shoulders down and together. Arms again to the inside, shoulders down and together. And arms to the outside, shoulders down and together. And release. And now for a shrug. Lift the arms up. Shrug the shoulders. And go down. Again, the arms up. Shrug the shoulders. And go down. And last time. Arms up. Shoulders up. And go down. And now a press curl. Arms together, bring them down to the outside. Sound, you can use a sock or something else. Have a little longer with the outside. Let the foot on. Try to catch it again. And on the other side. Leg goes bent. Now stretching. One arm in front. Shoulders back. Down. Pull the arm in. Have flat fingers to the right to relax the arm. Go with back with the shoulder, turn the palm to the sky. So shoulders back and down. Pull the arm in, have flat fingers to the right to relax the arm. Go with back with the shoulder, turn the palm to the sky. And the arm. Shoulders back, down. Pull the arm in, have flat fingers to the right to relax the arm. Go a bit back with the shoulder, turn the palm up to the sky. That was a short impingement training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, primary cold sores, and after we've done it, we're gonna do standing yoga. And if you participate in the little standing yoga, then it's better the hour risk. And we're talking about a disease and also about internal anatomy and also about a sexually transmittable disease. So we're talking a bit about that also. And this is no medical advice. We're just reading about it. Primary cold sores. So cold sores. The virus which causes cold sores, known medically as herpes simplex, is one of mankind's commonest infections. There are two types, HSV-1, which carries infections of the mouth, face and eyes, and HSV-2, which causes genital herpes. Over 50% of the adult population have antibodies to HSV-1 in the body, which means that at some time they have been affected. But only a few recall having had the rash. Okay, there's the virus, and that causes something called cold sores. And the medical name for that virus is either HSV-1 or HSV-2. HSV-1 has a rash at mouth, face, eyes or something, and HSV-2 causes genital herpes. And 50% of the whole population have HSV1 in the blood, which means at some point in their life they have been affected, they have antibodies against it in the blood. That means 50% had at one point in their life HSV1. Now that book is from Britain, so I don't know if it's now for the whole world 50%. And the book is from the 80s. The virus lies dormant in the sensory nerve cells for many years, causing no trouble, but it can be activated at any time by stimuli such as fever, menstruation, extreme cold or sunburn. Okay, in the sensory nerve cells. Have a specific place, or just the sensory nerve cells? So somewhere in the sensory nerve cells, where it is sleeping, it's dormant there, and if a body is under stress by fever, menstruation, extreme cold or sunburn, then it can happen again. The virus can arise from its sleep. The infection is said to be primary, first attack, or secondary, recurring. Okay, some people have HSV1 for the first time, then it's first attack, or for the second time, then it's recurring. Adults who escape infection during childhood are at risk. So if people did not have it as childhood, they can get it during adulthood. Primary cold sores. Children from 6 months to 5 years are most liable to this infection. Okay, very little children get it, most likely. Symptoms. Most commonly the child is feverish and unwell for 3 or 4 days without any rash. The condition is treated as a cold and only blood tests will reveal cold sores as the cause. Okay, the young child, a year, so under 5 years, is for 3-4 days like a normal cold, like a normal cold sick. And only a blood test would reveal that the person has HSV1. The less fortunate child will be ill with blisters, sores, and bleeding ulcers of the lips, the leaning of the cheeks, the gums, and the tongue. I'm not want to repeat it so much, I don't know. If it has a problem with the next thing also, I'm going to read it at once. Or where with all the chemical position as this. In a similar way, in girls, the vulva and vagina may be affected. In adults, especially nurses, dentists, and doctors, the skin around the nail is affected. This is very painful and resembles a whitlow, except that no pus develops. I don't know what a whitlow is. Now, in adults, especially nurses, dentists, and doctors, the skin around the nail is affected. Why? Because we get very infected, so it is there the strongest to see? Or is it that we're working so much with it? But the main thing is, it's the most problematic thing if these people have it at their fingers. Is it when after these days of the illness being closed, can't be transmitted, or is it the whole time? Whatever. Let's read on. I think they have precautions, what the name of it is. Duration. The painful, distressing stage lasts 7 to 10 days, and recovery with healing of the ulcers is complete within 3 weeks. Okay, around a week, and then around 3 weeks to heal the ulcers. Causes. A virus called herpes virus hominis. No, it is not herpes simplex, HSV1 or herpes, whatever. It's some type of virus. In adults, primary herpes maybe, no, we're talking about, I said it already, we're talking about sexually transmitted disease or something like that, I don't know, I haven't read it, but stuff like that. In adults, primary herpes may be contracted as a vermal disease and spread by sexual intercourse. See genital herpes. I don't know what contracted means. Whatever can be transmitted through sexual intercourse. Treatment in the home. Rinse the mouth frequently with diluted proprietary mouth washes. I don't know what diluted means. Or proprietary. No, whatever. This is not medical advice. Sip iced water. Use soothing cream to soften cracked lips. Now, and when to consult the doctor? If an infected child has atopic eczema, see the doctor at once because the condition can spread rapidly. No, I think we're gonna have eczema by EZ or by EC. I don't know what eczema is. But if someone has it, then there should be a rush to the doctor. If a child becomes generally more ill and drowsy, then you should consult the doctor. What the doctor might do: prescribe antiviral ointment. Is it an ointment? I don't know what ointments are. Prescribe antibiotic ointments as there is usually a secondary infection with bacteria. That is interesting. So two at the same time. Secondary infection with bacteria. Blood tests may be needed to confirm the diagnosis. In the case of the ill or drowsy child, check for other possible causes of the condition. Okay, if the child comes, because the doctor looks, if it is HSV1 or whatever, and then they can be given ointments. Whatever it is. Prevention. Adult sufferers should avoid contact with children. Infection of the fingers may be reduced by wearing protective gloves when in contact with possible infected areas and other people. So the fingers can be infected. And especially nurses, dentists and doctors have it. So have they got the infection not through... No, how's the infection? It sounds as if the infection is by contact and not by breathing. So these nurses, dentists and doctors have got it through their fingers. That means that either their gloves do not work or they haven't worn them properly. This is not an accusation, I'm searching for a cause. Adult sufferers should avoid contact with children. Outlook. Complete recovery is usual. Over rare complications like meningitis and encephalitis to occur. Now, normally the recovery is good, but meningitis and encephalitis can occur, but the infection may be reactivated again and again as recurrent cold sores. So, it can get complications and come always back. Now, one thing interesting there, does it come back only if a person has something else, fever, menstruation, or what was the other thing here? Extreme cold or something? Or does it come just through age? Or through if other autoimmune diseases attack the body? So if the person all over gets more or less stable against infections. So basically the question is, does everyone who develops over the lifetime an autoimmune disease or just gets older and the immune system gets weaker, does it then come up again? Or has it be then actually like an extreme sunburn or the other thing, cold, menstruation or the other thing, fever, another infection or something? It's something different, because it is in the nerve cells. What was it here? It is in the sensory nerve cells. Maybe that is why it does, because I don't think it comes out, but it's why it does not come out if a person just gets an autoimmune disease or gets older. But only if they have a cold or sunburn, because that stresses the sensory nerve cells. I think that is an interesting point. Whatever. That was the medical part. If you are here for medicine, you can contract it to the next part of medicine. We will do now a short 5-minute yoga. If you stay and participate in the short 5-minute yoga, let's let the arm risk. And the feet standing together, breathe in and lift the arms up. Breathe out the arms down. In and the arms up. Out and down. In and up. Out to the side. In and up. Out to the side. In and up. Inch space between the feet, out to the side. In and up. Out to the side. In and up. Out to the side. In and up. And out and sit down. In and up. Out to the side. In and up. And out and down. In and up. And out, lean onto the knees. Breathe in. Out, heel to the back. In into the middle. Out, long back. The belly. Again in. Out, heel. Maybe. Out, the belly. Again in. And out the front leg up at the top of the backward shoulder. Breathe in the arms up. Out arm to the side. In and out. Out over the side, down into the chair. Breathe in halfway up. High up. And out and up. Breathe in, reach high. Now down to the side. And up. And on the arms on the sides down. Breathe in up. Higher up. And out and up. Breathe in, come up to the toes. And out and sink down. In up. Out and down. And in up. Now the arms down, feet together, and you down, down. Breathe in with the right leg. And breathe out and stretch your left leg. Breathe in and change. Then out and stretch your right leg. In and change. Out and stretch your left leg. In and change. Out and stretch your left leg. In and change. And out and straight. Breathe in the right hand up to the sky. Breathe out with the left hand. Look over the right shoulder to the right hand. In and down. In and down. Breathe in with the left hand up to the sky. Breathe out with the right knee. Look over the left shoulder to the left hand. Breathe in, out and down. Make a hand for space between feet. Shift the weight to the heels and breathe in down. And out and up. In and down. And out and up. Last time in and down. And out and up. Take out of the elbows and gently rock from side to side. Hands in and down, feet together. Breathe in halfway up with straight back. Out and down. In halfway up, straight back. Out and down. And breathe in the up down swan. Hands up and down. Bring the palms together, elbows together. Breathe in and lift up. Down and down. And again, in and up. Out and down. Hands together, breathe in. And out, stretch your front, bring the head down. In back. And out and in front. In and back. Out and in front. Intertwine the fingers behind the back. Bring them over to one side. Turn up, shoulders back, breathe in. Out, hands, head over to one side. Chin onto the clavicle, turn to over to the side. The hands up, breathe in. And out, pull the arm in and shoulder down. And lift the gaze. Bring it over to the other side. Hands over to the other side, breathe in. Chin onto the clavicle, breathe out. Pull the arm in and shoulder down. Lift the gaze. Bring it back into the middle. And now the feet standing together and breathe in, lift the arms up. And breathe out, draw the shoulder blades together. In and up. Our cross the arms, intertwine the fingers, breathe in, reach high. Breathe out, reach your front out of the back. In and up. Out in back, draw the shoulder blades together. In and up. And reach high, breathe in. Breathe out, reach your front. In and up. Out, lean back, draw the shoulder blades together. In and up. And out, lean with long arms back. In and up. Out and lean back, long arms. In and up. And out the arms down. In and up. And out the arms down. Now bring the arms up. Bring the hands to touch the lobe. Slowly down to heart center. Breathe out. That was a short 5-minute yoga. I thank you very much and until next time. Hi, welcome. I am trying to learn medicine. Today, enlarged adenoid. Now for this downward, we're gonna do median plane training. And if you participate in the median plane training, then it's better the arm risk. And we're talking about internal anatomy, a disease, or a disease. And this is part 2, and this is no medical advice. We're just reading about it and learning about it. Enlarged adenoid. The adenoid is a single pad of lymphoid tissue. Okay, it is a pad of lymphoid tissue, and the tissue that helps to protect the body from infections, that is lymphoid tissue. And it lies at the back of the nose, close to the point where it joins the mouth cavity. It is small at birth, but begins growing at about the age of 3. It reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. Enlargement of the adenoid may block the opening of the eustachian tube, the tube that connects the middle ear to the throat and to the nose, resulting in otitis media. The adenoid may also obstruct the flow of air from the nose to the throat, forcing the child to breathe through the mouth. The flow of air through the mouth can then cause the tonsils to become larger. Now I read it now through the introduction, because I'm wondering what of that is now part of enlarged adenoid and what of normal sized adenoid. Is lymphoid tissue at the back of the nose, around where? At the back of the nose. Who's it? The back of the nose or the lymphoid tissue? At the back of the nose, close to the mouth cavity. Small at birth, but begins growing at the age of 3. It reaches maximum at the age of 8, and by puberty no longer causes obstruction. Enlargement of the adenoid may block the opening of the Eustachian tube, that is the tube connecting from the middle ear to the throat. So, it doesn't really make sense. Enlargement of the adenoid may block the opening of the Eustachian tube. Eustachian tube is the tube that connects the middle ear to the throat. Now, if we read it without the brackets, may block the opening of the Eustachian tube into the nose. Goes it not to the throat or to the nose? Then from here to the furnace. Oh, it's we don't know. It blocks Eustachian tube, which goes from the from the middle ear to the throat, or to the nose, resulting in otitis media. Okay, when the adenoid is enlarged, then it results in otitis media. So I think that's inflammation of the middle ear, because the Eustachian tube cannot lead what is there through the Eustachian tube from the middle ear out to the nose throat. The adenoid may also obstruct the flow of air from the nose to the throat. Air from the nose to the throat, forcing the child to breathe through the mouth. The flow of air through the mouth then causes the tonsils to become larger. The flow of air through the mouth then causes the tonsils to become larger. I don't know where the tonsils are. I said it in the first part, I don't know where we're going actually in the details. I don't know where we are. But we could just say it when we're talking about the enlarged adenoid, that the tonsils become larger. As soon as we or other people who understand it, it's clear. The adenoid is small at birth, but begins growing at about the age of 3. It reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. By enlarged adenoid or normally. Symptoms: breathing through the mouth, blocked nose, snoring, nasal speech, deafness, recurring otitis media. Duration: mouth breathing and a blocked nose may last for months. Recurrent ear infections or deafness may occur over a period of months or years. Now the problem is that we don't have a fundamental idea or the fundamental fundament of enlarged adenoid because we don't know what is normal. It doesn't make sense to explain it if it is not normal. To say 3 at the age of 3, at the age of 8. It doesn't make sense if it is normal. But what is not a normal thing? But it does not grow, it's just there. Or it is not enlarged. Causes recurring or long-standing infection of the adenoid. Complications: repeated ear infections and deafness. Treatment in the home. There is no home remedy for enlarged adenoid. It is a normal process of childhood and is best ignored unless there are complications. Let's read that again. There is no home remedy for enlarged adenoid. It is a normal process of childhood and is best ignored unless there are complications. It is a normal process of childhood, or does it happen just normally during childhood? When to consult the doctor. If a child has earache or deafness in one or both ears lasting more than 4 or 5 years, if the nose is blocked for more than a month, and the child is unable to breathe with the mouth closed, what the doctor might do? I don't think it is normal that children cannot breathe through the nose. And it wouldn't really make sense to write an enlarged adenoid. It would make sense, even if everyone has it. What the doctor might do? Examine the ear and mouth. Test to see how well the child can breathe through one nostril at a time. Test hearing. Send the child to an ear, nose, and throat specialist. The specialist may decide that an operation is necessary to remove the adenoid and possibly the tonsils at the same time. Recovery is usually rapid. Outlook. From the age of 8, the adenoid decreases in size, and both the risk of complications and symptoms decrease. The specialist's decision to operate on it depends on reaching a balance between symptoms and age of the patients. Let's take a look if we find the tonsil somewhere. Eleven tonsils. The tonsils. Whatever. There, by 11 there. Down there. See those bright white thing comes in the bend there. 11. That's the back of the mouth. Do you have an explanation? I don't think so. Okay, I don't really know what we should do with it. Maybe almost nothing. Or just a little bit about where the lymphoid, the adenoid is. Because I can't get further. Maybe we just forget about it and just explain enlarged adenoid. And we don't have to explain now. At one point, it's logically that not everyone has it, so it's not normal that people have it from the age of 3 to 8. It might be occur most of the time during the age of 3 to 8. I think that is it, but anyway, way over time. So I just don't know how to continue now. Which means we will continue the next part. Maybe you have a better idea. We will do another medium plan training. If you were here for medicine, you go directly to the next part of medicine. We will do another medium plane training. If you stay and participate in the medium plane training, you bring one leg up and the pointing with the foot down. And take the other leg up and the pointing with the foot down. And we're going to the side. The torso pointing forward and we're stretching the inner side of the leg. And over to the other side, torso pointing forward, we're stretching the inner side of the leg. And now the mentis, go from side to side. And back into the middle. And now bring one leg up into a right angle with a flexed foot, have even lined hips, be tall with the back, and press from the top against the knee and have a little bend in the feet. And the other leg up, same setup, and press from the top against the knee. And the other leg again up, and now press on the side against the knee. And the other leg up, and press on the side against the knee. And next exercise, one leg again up, and the knee presses up to the side, up to the side. And the other knee up, and the knee presses up to the side. And the last exercise already, the heavy swing door, one leg up, same side up, and press on the outside against the knee, and up slowly. And close again. And open again. And close again. Another time. And last time. Down the leg and the other leg up. And press on the outside and up slowly. And close again. Up again. And close again. And now for the last time, open. And close. And leg down. Now legs wide apart, finger down. And breathe out. In. Out. Now we're feeling close the legs. And breathing out. Now it was for medium plane training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn history, today enlarged adenoid, and after we've done that we're going to do shoulder impingement training, and if you participate in the shoulder impingement training, then it's better the honors. This is part 4, something of the adenoid, enlarged adenoid. Now, introduction, we have a little problem with introduction, we're a bit stuck there because there's not said what the adenoid is now normal and what is now a problem when someone has enlarged adenoid. So, what the idea is just, we're just assuming whatever is it, how to that is the problem. Or the other way around, we are just telling now in our presentation what the problem is with an enlarged adenoid. We don't have to say now what it is now when who has it or what. We're just going to read it, but we're basically going to say what I just said. The adenoid is a single pad of lymphoid tissue, the tissue that helps to protect the body from infection. I didn't say that. We're talking about internal anatomy, about diseases, and stuff like that. And this is no medical advice, we're just reading about it. The adenoid is a single pad of lymphoid tissue, the tissue that helps to protect the body from infection. Lying at the back of the nose, close to the point where it joins the mouth cavity. It is small at birth, but begins growing at about the age of 3. It reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. Enlargement of the adenoid may block the opening of the Eustachian tube, the tube that connects the middle ear to the throat into the nose, resulting in otitis media. The adenoid may also obstruct the flow of air from the nose to the throat, forcing the child to breathe through the mouth. The flow of air through the mouth that causes the tonsils to become larger. We looked up where the tonsils are. There's somehow at the top of the mouth in the air canal, deep in behind the nose. I don't get it. Somewhere are the tonsils, we don't really say. Now, I don't really understand what the adenoid is doing when. We're just going to say, if it is too big, then that happens. No, but we're going to say what the adenoid is. The adenoid is lymphoid tissue. It is at the back of the nose, is it like that? Back of the nose, close to the mouth cavity. And it is lymphoid tissue, so it is tissue which helps to protect the body. The tissue that helps to protect the body from infections. And what else? And if it is enlarged, so if it is enlarged, the eustachian tube, which is normally clearing the middle ear, or how do we say it? The tube that connects the middle ear to the throat, may block the opening of the eustachian tube into the nose. Oh, this is how the sentences to be read. Enlargement of the adenum may block the opening of the eustachian tube into the nose, resulting in otitis media. That is it. The opening of the eustachian tube, where it comes out into the nose, or where that now exactly is, that is blocked and it cannot come out. And it could happen in otitis media. Okay, what did we have? It is lymphoid tissue. It is at the back of the nose. And it can block the eustachian tube where it comes into the nose. It can cause otitis media. It can also obstruct the flow of air from the nose to the throat. Also airflow from the nose to the throat. And that can make mouth breathing necessary. The flow of air through the mouth and causes the tonsils to become larger. So the tonsils must be the region where we're affected for breathing through the mouth. We had one here on the picture. It was not. The tonsils become larger. We are also in that region. Not necessarily. No. Symptoms: breathing through the mouth, blocked nose, snoring, nasal speech, deafness, and recurrent otitis media. Mouth breathing and the blocked nose, mouth breathing, let's say it like that, mouth breathing and the blocked nose, and also snore. Why do the tonsils become larger? Is it because of the breathing or through the snoring, or is it what happens? Because what are the differences? Maybe there are some respiratory differences between snoring and breathing through the mouth, and what if these differences causing then specific things? That would be an interesting thing. Maybe a tablet. Breathing through the nose, breathing through the mouth, and snoring causes these and these things, and then all next to each other. Breathing through mouth breathing, blocked nose, and snoring, and then also recurrent otitis media. And that is, can't say it completely. Is it an inflammation? So we just don't say what otitis media is? It's problem of the ear. It is inflation of the middle part of the ear, but I don't know if it's completely right, so I don't say. Recurrent otitis media and deafness. Nasal speech and deafness. Mouth breathing, nose blocked, and nasal speech, snoring, and deafness. Recurrent otitis media. Duration. Mouth breathing and a blocked nose may last for months. Don't really think that we're going to say it because we didn't really understand when the enlarged adenoid happens. Recurrent ear infections or deafness may occur over a period of months or years, and the whole condition can last for months or years. Maybe have it as a little. I don't know what it's called. And if it's called like that, if it's not called like that, and I'm just going to use the word for it, but it would be a problem if it's not called like that in the language, because then it would be slur. Whatever we're going to have. I know what it's called, but I'm not completely sure what it's that. But it wouldn't be prophanic if I would use that word. But I think that this is something to say that it's a little trump in our hand. So to play the cards, or trump. Recurrent otitis media. Duration. Mouth breathing. Duration already had it. Current ear over months and years. So it's our little trump in our hand, if we need it. We can say it lasts over months and years. I already pretty far. Causes. Recurring or long-standing infection of the adenoid. Why can the adenoid at all get infected? Has an infection to be through a virus or bacterium? Infection. How does that happen? Treatment in the home. There is no home remedy. It is a normal process of childhood and disability. I don't know that. Is it now that every child has it, or is it just that many children have it? That it's normally happening to children? Or is it that every child has it? And especially unless there are complications. So we're just going to stay away from it. When to consult the doctor. If a child has earache or deafness in one of both ears lasting more than 4 or 5 days. I don't think we're going to say that. It doesn't really make sense when we don't know when the thing happens at all. If a nose is blocked for more than a month and the child is unable to breathe with the mouth closed. But if you would say, we would say, if there's earache or deafness or a blocked nose, then consult the doctor. But this is not medical advice. Also, the video we're preparing is not medical advice, so I don't really have to say it at all. It is advice, we could say it like that, to give a better understanding of the disease, or what it is now. But if a blocked nose, or deafness, or earache is, then consult the doctor. What the doctor might do: examine the ear and mouth, test to see how well the child can breathe through one nostril at a time, test the hearing, send the child to an ear, nose and throat specialist. The specialist may decide whether an operation is necessary to remove it. Okay, that is all thing. The specialist may decide that an operation is necessary to remove the adenoid and possibly the tonsils at the same time. What happens when they are removed? They will not have a function. That was a lymphoid pitch to protect the body of infection, and that was one of these infections which was a problem with the enlarged adenoid. Now, if it is an infection, then it can't be that original. Recovery is usually rapid. Outlook: from the age of 8, the adenoid decreases in size and both the risk of complications and symptoms decrease. So I think they're saying that actually almost everyone has an enlarged adenoid. But just by some children it is so worse that there has to be something done about it. So people can have an ear infection because the adenoid is enlarged, which blocks the session tube, clearing the middle ear. From the age of 8, they said it right, from the age of 8, now I said it wrong, I forgot for this. The adenoid decreases in size above risk of complications and symptoms decrease. The specialist's decision to operate on it depends on reaching a balance between symptoms and age of the patient. Another thing is also interesting. Age of patients. Okay, we have it all together, but we don't have time left. That means we need another part for enlarged adenoid. If you were here for medicine, you can go to the next part of medicine. We will do now the shoulder impingement training. If you stay and participate in the shoulder impingement training, medicine, and again, this was no medical advice. We just read about it and speculated about it, so it's no medical advice. If you participate in the shoulder impingement training, medicine, we're having good and simple stance, and I forgot what we're doing. We're doing shoulder circuits. We come back and up and in front and down. And not backwards. Front. Down. And now. Long arms, strong fists, and go as far back as you can over shoulders. High up and in front. Down and again. Back. Up and in front and down. And again. Up. Down. Back. And down and front. Up. Back. And now, next right part, go it into the knees, hinge forward with a straight back, let the arms hang, and pinch the scapulars together with it. Make fists, lift the arms up, and pinch the scapulars together. Arms up, shoulders up, and again, pinch the scapulars together. Make fists, lift the arms up, and pinch the scapulars together. And shoulders down. And another round. No, not another round. We're doing the cheat round, what are we doing now? So into the knees, hinge forward with the round back, let the arms hang, make fists, lift the arms to the inside, lift the arms high up, bring them together. Straight up, bring the shoulders down and together. Arms high up and together. Shoulders down, together. And release. And another round. Into the knees, hinge forward, round back, let the arms hang, make fists, turn the arms to the inside, lift the arms high up, bring them together. Shoulders down and back and together. Arms high up and together. Shoulders down and together. And let the arms loose. And now, lift the arms up and then lower in. If this or any other exercise causes pain, we now do it. Now the arms to the side and in front. And now we'll build it up. Good and safe stance, long arms, shoulders down and together. And then the arms to the inside. Arms to the outside, shoulders down and together. And change arms to the inside, shoulders down and together. Last time changing, arms to the outside, shoulders down and together. And release. Next exercise. The arms up to the side, a bit in front, shoulders down and together. Change arms back, shoulders up and again the shoulders in front, shoulders down. No, the arms in front, shoulders down and together. So the arms in the pronation, shoulders. And change the last side, arms supination and shoulders into. I think it's anti-scapular. And release. And now the shrug, the arms up. And let go down. And out. Down. And now the principal first. Arms together, down and to the inside. And now stand up. I have a sock or whatever with a long arm to the outside. And then fall down. Try to get it again. And on the outside. Stretching, 1 hour front, the elephant trunk. Arm back, down, pull the arm in, have flat fingers, try to relax the arm, go with back or shoulder, down up to the sky. Now, yeah, shoulder back, down, pull the arm in, have flat fingers, try to relax the arm, go with back with the shoulder, then palm up to the sky. The other arm in front, shoulders back, down, pull the arm in, have flat fingers, try to relax the arm, go with back of the shoulder, then palm up to the sky. Now, why is it not a problem anymore when the people are older? It's just that the size decreases, was written, the size of the adenoid decreases, and infections are not so much a problem anymore. Also just that the cavity itself gets bigger, and now the adenoid has the same size as the problem. But it was written that way, so if I have measured properly, it is that way. So they get still these infections, but the overall size has decreased. So that now, even with infections and swelling, it's no problem. I read something about the stitching tubes, and I think it was written that children have often a ear block because it is more horizontal and less vertical because the face gets longer when people get older. But there was written that it was just an idea that they weren't so sure about that. Now, if they don't know that, horizontal and vertical, do we know any other thing? I think very much, anyways. Hi and welcome. I am trying to learn medicine, today enlarged adenoid, and after we've done with it, we're gonna do squat training, and if you participate in the squat training, then it's better if you're on risk. Now, this is part 6 or something of the enlarged adenoid. We're gonna say, the adenoid is at the back of the nose, at the region of the back of the nose, where it joins at the back of the nose, at the beginning of the, at the back of the nose, at the back of the nose to the mouth cavity, and it is a lymphoid tissue. So, and that lymphoid tissue is there to protect the body from infections. And when the adenoid is infected and enlarged, I said it is infected. Okay, we're going to stay with enlarged, but I think it was infected somewhere. If the adenoid is enlarged, then it can block the eustachian tube, clearing the middle ear to the nose. It can block the opening to the nose, the enlarged adenoid, and then that can result in otitis media. And also can it be that a person can only breathe through the mouth then. and that makes the tonsils get larger at the end of the. No, I'm not going to say what it is. If I would say it, what would I say? In that region, which are in that region, and the tonsils which are there in the mouth cavity. I don't know, they're in the mouth cavity, which are also up there by the enlarged adenoid. Let's try to say it. The symptoms are mouth breathing and the blocked nose, and also nasal speech, and deafness, recurrent otitis media, and snoring. Mouth breathing and blocked nose, deafness and recurrent otitis media, so inflammation of the middle part of the ear, and snoring and deafness. I did say it, snoring and nasal speech. That whole thing, if I would say it, can last for months or years. Causes recurring or long-standing infection of the adenoid, and the adenoid can be enlarged through recurring or long-standing infections. Then it can be removed, the adenoid, and possibly also the tonsils. And then the recovery is usually rapid, but it will be looked. It will be tried to reach a balance of the symptoms, and the age of patients try to be reached, because it is mostly in the early childhood and resolves more or less then. It reaches maximum size at about the age of 8, and by puberty no longer causes obstruction. Let's try it. It's not that long. If you mess up, we're going to do it again. I have a second camera, so I'm going to sit down. That's an enlarged thing. Enlarged adenoid. The adenoid is at the end of the nose in the mouth cavity, and it can be enlarged through recurrent infections or long-standing infections, mostly in early childhood by young children. Now, and if it is enlarged, then the eustachian tube clearing from the ear to the nose can be blocked at the place where the eustachian tube comes to the nose, and then it can come to a recurrent otitis media, so inflammation of the middle ear. And also, can it happen that then mouth breathing is necessary because the nose is blocked from the enlarged adenoid, and that can result in the tonsils becoming larger. The symptoms in all are then mouth breathing and the blocked nose, and nasal speech, and snoring, and deafness, and recurring otitis media. And also that whole thing lasts up months and years. And it can be remove the adenoids, which is lymphoid tissue. So lymphoid tissue is there to protect the body against infections. Now, but these adenoids can be removed, but that is a decision, because most of the times it goes away when the child gets older. If it is helpful to remove it or not, that is a decision which has to be made. And that is according to Keith Hodgkin's Family Medical Advisor, page 63 and 64, but this is no medical advice. I don't know what the thing is anymore. It's an adenoid. Not an Adonis, so an adenoid. I don't think I said it wrong. And as I said in the previous part, maybe it is even a bit good that it is a little bit from left to right, because it's not so much. This is not medical advice, so it is not that people listen to it and get medical advice. Maybe it is very good that it is even a little bit chaotic. I'm going to stop the second camera. And that was a medical part. If you were here for medicine, you could go directly to the next part of the medicine. We will do now a squat training. If you stay and participate in the squat training, that is at your own risk. What are we doing? We're bringing one leg up and pointing the foot down. Your foot up and down. And now turn it. And into the other leg. And the other leg up, point the foot down. Up and down. Turn it. And now to the side. We're just pulling forward and just touching the inner side of the leg. And out of the other side. And we're going from side to side. And into the middle. And now we're just doing 12 squats. So legs wide apart, and we're going down. That was the first one. And the second one. And number 3. And 4. And 5. And 6 was all for half. And 7. 8. And now for 9. And 10. Now it are just 2, 11. And 12. And now the 6-pack squat squeeze. Legs wide apart. We're going down into quarter squat and we're pressing against the top of a leg just on one side. And on the other side. And down into half squat, press against the middle of the leg. And on the other side. Down into 3/4 squat and press close to the knee. On the other side. And up again. And now the fastest giraffe of a water pond. We're going down into 3/4 squat. Press against the knee. And go towards the knee. And we have a knee. Press against it. And go towards it. And again. And again. And last 2. And up again. And now, already the last exercise is a propeller. Down into full squat. Arms to the side. Out to one side. Press against the leg and look up to the end. And into the middle. Out to the other side. Press against the leg. Look up to the end. In the middle and up. Now walk on place. Bring the leg up, point the foot down. Other leg up, point the foot down. Take the leg at the ankle. Make a straight back, point the knee down. Other leg, take it up. Take the leg at the ankle, make a straight back, put the knee down. And legs to the side, breathing in your dog. And out. Get in. Breathing close the legs. And breathing out. That was a squat training. I thank you very much, and until next time. Hi and welcome. I am trying to learn medicine today. Ulcerative colitis, and after we've done what we're going to do a bit standing yoga, and if you participate in standing yoga, then it's medically our risk. And we're talking about internal anatomy, a disease, stuff like that, and this is no medical advice, we're just reading about. Ulcerative colitis, a chronic inflammation of a large bowel causing ulceration. I was thinking, no, what I said. What I was talking about. Okay, there is a chronic inflammation of a large bowel, and we're talking about the whole digestive system. So a large bowel that is on the tummy. And that has ulceration, that causes chronic inflammation. Symptoms. At first, attacks of bloody... So we're going to talk about defecation, diarrhea, and so on. Symptoms. At first, attacks of bloody diarrhea at intervals. These may be sudden and severe, but more commonly they are mild, with cramps along the abdomen and urge to defecate and blood mucus in the stools. So we're just going on. If the disease is extensive or severe, diarrhea may occur 10 to 20 times a day. Sometimes the diarrhea consists of water, blood and pus only. Fever, malaise, whatever, loss of appetite and weight, and anemia may also occur. Now, they were right. Anemia was the thing that the blood cells don't have really the ability anymore to transport blood cells. Also, sorry about it. Causes. The cause is unknown. But the disorder may occur in other members of the family. Complications. Complications. The disease may be localized in the rectum, in which case it is known as bronchitis, and be very mild with few complications. Imagine someone has bronchitis instead of ulcerative colitis, and it is not found because it's just at another place. It's not so severe, but I think other people have thought about it before. It may spread to involve the whole colon, whatever, it's some part of the digestive system. Hemorrhage is common, whatever, some problem. The ulcer may perforate the bowel, causing sudden severe abdominal pain from peritonitis, which requires instant medical treatment. Let's do it again. So the ulcer itself in the bowel may perforate the bowel, causing sudden severe abdominal pain from peritonitis, which requires instant medical treatment. So the ulcer can eat itself through the bowel and make a hole in the bowel. But it's bad. And it requires instant medical treatment. This is no medical advice. Non-cancerous growth may occur of the bowel, of the ulcer. Whatever. Arthritis, eye inflammation, and skin disorders may also occur. Arthritis, eye inflammation, skin disorders. If colitis begins in childhood, involves the whole colon and lasts more than 10 years, risk of cancer of the bowel developing is high, nearly 200 times the usual rate, and more than half of patients will develop cancer after 30 to 40 years of colitis. This risk may be reduced by proper treatment. Okay, every second person who has that as a child gets cancer in the colon, which is 200 times more likely as normally. So normally people have 1 in 400. Okay. Treatment in the home. Mild disease can be managed by taking a normal diet. Actually, it sounds so severe, but no one would think that there's a treatment at all. Mild disease can be managed by taking a normal diet. Apart from cutting out raw fruits and vegetable roughage. What is vegetable roughage? Raw fruits and something with vegetables. So they're advising not to eat fruits or vegetables. No, I don't know what they're advising, and this is not medical advice because I don't understand them in the first place. Avoid stress and anxiety. Rest in bed during acute flare-ups. Take simple anti-diarrhea preparations and recommended doses to help lessen bowel activity. When to consult the doctor. If there are severe, rapid progressing symptoms, or if there are recurrent or prolonged bouts of diarrhea lasting more than 2 or 3 weeks. And also if blood or pus is present in the stool. I still don't know what pus is. Not really. I have an idea what this is called. I have an assumption what this is called. Maybe it's an assumption. What the doctor might do. Send the patient for a barium enema and internal examination of the bowel with a sigmoidoscope, a device with a light attached. So a sigmoidoscope is a device with a light attached. So it's a flashlight. It's a sigmoidoscope. And it is used to confirm the diagnosis and assess the extent of the disease. Prescribe drugs to help reduce the number of attacks. Yes, okay. These may include steroids in the form of tablets, suppositories or enemas, whatever, some type of drugs. Such enemas may be self-administered and retained in the bowel overnight. What? Such enemas may be self-administered and retained in the bowel overnight. Okay, I have no idea what enemas is. Enemas. Advise suitable diet to rest the bowel and reduce diarrhea. In severe prolonged disease, a blood transfusion may be necessary to combat anemia and help healing. An ileostome may be necessary. In this operation, the colon is totally removed and the small bowel, the ileum, brought out onto an opening in the opening where it empties into a special disposable plastic bag sealed to the skin. Okay, let's do that again, but okay. If ileostomy may be necessary, maybe that is necessary, and then in this operation, ileostomy, the colon is totally removed and the small bowel, the ileum, brought out onto an out, out, on to an opening in the abdomen. Now I'm not going to lose track of what I'm understanding here. I think it is right. Where it empties into special disposable plastic bags sealed to the skin. Outlook. About 10% of patients completely recover after a single attack. It's not much, 10%. About 10% of patients completely recover after a single attack. Very severe first attacks with hemorrhage, perforation, and infection may cause serious complications in another 10%. In the remainder of cases, so it's 80%, the symptoms may grumble on with bad and good periods. Can no one stop such an ulcer? What is the big problem with an ulcer? How does it even come about? And so in the other cases, it goes good with good or bad periods on. It is rare for the disease to appear in people over 60, but when it does, it is dangerous and more severe. Well, okay, we have now read through it. We want to do now standing yoga. And again, at the end, this was no medical advice, and the way we also talked about that, this was no medical advice. We've just read through it like a book. If you were here for whatever it was, whether it was medicine, if it was ulcerative colitis, if you were here for ulcerative colitis and medicines, then you were hopefully not here for medical advice because we just read through it in a loose way. If you were here for medicine, you can go directly to the next part of medicine. We will do now standing yoga. If you stand participate with standing yoga, it's your own way. It's your own risk. Having the feet standing together, if you participate in this, at your own risk. We have the feet standing together, the breathing in and this, the outside. And breathe out the outside. In the outside. Out up to the side. In and up. Out up to the side. In and up. Out up to the side and make an inch space between your feet. In and up. Out and sink down. In and up. And out up to the side. In and up. Out and down. In and up. And we bring the hands down and leaning onto the knees. We're breathing in. And out we're making a belly, a hill of the back. Breathe in a straight back. And out a belly of the back. Again in. And out a hill of the back. In into the middle. Out a belly of the back. Again in. And out come with a round back up and make it the top back with shoulders rolled. Now breathe in, lift the arms again up. And out into the side. In and up. And out, bring your arms on sides down into chair. Breathe in, come halfway up. High up. And hold and come up. Breathe in, reach high. Breathe out to the sides. In and up. Out, bring your arms on sides down into the chair. Breathe in, come halfway up. Come high up. And out and come up. And breathe in, come up. On the tiptoes, breathe in. And breathe out and sink it down. Again, in and come up. And out and sink down. And last time up. Out, bring the arms down, the feet together, and be just down. Now breathe in. Bend the right knee. And breathe out and stretch your left leg. Breathe in and change. Yeah, breathe out and stretch your right leg. In and change. And out and stretch your left leg. Breathe in and change. And out and stretch your right leg. In and change. Out and stretch your left leg. In and down in it. And out just back. Now breathe in, lift the right hand up to the sky. Breathe out, bend the left knee, look over the right shoulder to the right hand. Breathe in, hand again down. And out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee, look over the left shoulder to the left hand. Again, in and hand down. Now make a hand of space between the feet. Shift the weight to the heels. Breathe in and come down. And out and out. In and down. And out and out. One more time, in and down. And out and up. Take hold of the elbows. And gently rock from side to side. And hands sitting down, we can come up straight back. And out again down. Again, in halfway up with a straight back. And out and down. And now breathe in and come completely up with up down swan Bring the hands together and bring them down to heart center. Now to the garden pose. With the body to the outside, within all that is space between the heels. Breathe in with the outside. And breathe out and sink down. Elbows against the insides of the knees. Now we're going to straighten up. And breathe out and come with the back up. Breathe in. And out and down. And over in. And out and come in one straight line upwards. Hands down. And again in and up. And out and sink again down. Breathe again. And out with the back up. Breathe in. Now out into the palm pose. Again in, straighten up. And now tuck the pelvis in and come to the crown of the head first up. Heads down, again in at the ends up. And out and down. Breathe again. And out and come to the back up. Breathe in. Now back into the garden pose. And now last time. Breathe in. And now they come slowly in one straight line upwards. And the heads down. And down. Now we fly half the palms together, the elbows together, breathe in and lift the hands up. And breathe out and down. In and hands up. And out and down. And now, hands together, breathe in. And out and stretch your front. Okay. And out in the front. And over it. Feet are standing together, intertwine the fingers behind the back. Breathe in, turn up. Shoulders back. And out, head over to one side. Chin down to the clavicle. And pull with the hands down to the ground. And lift the gaze. Turn it over to the other side. Shoulders back, breathe in, turn up. And out, chin down to the clavicle. Pull with the hands down to the ground. Breathe in, lift the gaze. Back into the middle. Intertwine the fingers behind the back. Bring them over to one side. Breathe in, turn up. And out turn the head over to the side with the hands down, the chin down to the clavicle, and pull the arm and the shoulder down. Breathe in, lift the gaze and turn the head over to the other side. Breathe in, and out, chin down to the clavicle, pull the arm and the shoulder down. Breathe in, lift the gaze and turn it back into the middle. Now have the feet standing together, one arm behind the back, the other arm up. And bring the head over. Just bring it over, don't pull it. And down again. Our hand behind the back, we lift the hand up. Take the head and bring the head over, don't pull it back. And change. Now, we lift the hands up. And breathe out, lean back, draw the shoulder blades together. We lift the hands up. Our cross fingers, breathe and reach high. Breathe out, reach front out of the back. In and up. Over across the elbow down. Breathe and reach high. Breathe out, reach front. Breathe and reach high. Out, lean back with long arms. In and up. Out, lean again back. In and up. Out, the arms down. Breathe and lift the arms up. Bring the hands to touch and lower the heads down to heart center. That was sustaining yoga. Thank you very much, and until next time. Hi, welcome. I'm trying to learn medicine, today inactive column. And after we've done that, we're gonna do standing yoga, a bit standing yoga. And if you participate in the standing yoga, that is better than your And we're gonna talk about eating, digestion, defecation, internal anatomy, disease, and stuff like that. I don't know, I haven't read it. Now, the first thing. This is called inactive. And the other thing is ulcerative. Why is there no C in ulcerative? I spoke about it 20 parts ago. Why is it ulcerative, not ulceractive? Here's it inactive colon, whatever. Inactive colon doesn't sound good. What is it? A condition in which the large bowel is sluggish in its response to overfilling, is slow to pass on its contents, and fills with... Okay, I don't really want to... and fills with soft, putty-like feces. It is also known as sluggish bowel. So we're not going to talk just about defecation, but also about feces. Okay, I don't know what sluggish means. Okay, there's a problem with the bowel. That's a somewhere in the tummy. I don't know exactly. and its response to overfilling. It is slow to pass on the contents, and it fills up. And within the inactive colon is also known as sluggish bowel. That means something like lazy, sluggish. Okay. Symptoms: constipation, but with, we're going to talk a lot about these things. Constipation, but with soft and not hard faces present. We had not done constipation yet. We are by COL, colon, not constipation, COS. But there is a problem with the passing on of the internals of whatever. A problem with I don't know what word it is. With defecation. A problem with defecation. No, and this is now, people with inactive colon have also constipation, but it is not that it is hard as a constipation because it cannot come. We have not done that, but because it is not passed out. But it is soft. Futile efforts to defecate are made. I don't know what futile means, but I think that means people are putting much effort into it. Watery diarrhea may occur because the bowel produces fluid in response to continual irritation. We have to do constipation before we can draw conclusions, but I think these two together are very interesting. Okay, whatever. The human body responds to it by releasing fluids, and that whole thing makes then watery diarrhea. Cramps due to wind may occur in the abdomen and rectum. What wind? Whatever, people can have cramps in the abdomen and rectum. Duration. The condition may be lifelong, and although harmless, may be annoying and difficult to cure. And with ways with harmless, because nothing else happens except that people have problems. But it's annoying and difficult to cure. Lifelong. Causes. Yes, I didn't say, but this is not medical advice, so maybe you're not, this is not medical advice, we're just reading it here. It may persist in older people, so older people have it also. Causes: confining old and infirm patients to bed and letting them get constipated. Using bedpans instead of lavatory or commode may inhibit normal defecation. These are the causes? I don't understand what the causes are. Confining old and infirm patients to bed and letting them get constipated. So it is the causes. So it can be that old people are infirmed to bed. I don't know what it all means. I don't know what the word infirm means. But I think that old people are lying a long time in the bed. And that when they get constipated. No, you don't know what constipation is. Whatever, that problem can cause it. And the other thing, using bedpans instead of a lavatory or commode may inhibit normal defecation. I don't get it. And how does it now cause inactive colon? Whatever. Very honest with it. Treatment in the home. Use a mild laxative, whatever, some type of medicine. Train the bowels to open up at regular times. For example, half an hour after breakfast, and use the lavatory or commode. Are we speaking about the position in the person in which the person is defecating? Whatever. Try to we're advising it to regulate the time of defecation and also maybe the position. Eat plenty of raffages. For example, bran, fruit and vegetables. Whatever. Raffages are, bran, fruit and vegetables are. Regular exercise may be helpful. You should do sport, they say. Abdominal cramps can often be helped by lying face down on the bed. This allows the passage of wind. What is wind? Okay, abdominal cramps can often be helped by lying face. We're saying that abdominal pains can be helped by lying face down. This allows the passage of wind. Whatever. We're saying here. But again, this is not medical advice, maybe it's also bad for some things. But I think it's interesting. When to consult the doctor? If symptoms do not respond to the simple treatment described above, consult the doctor. What the doctor may do? Advise you about diet, exercise, and the use of suppositories or enemas when necessary. They're giving you tips how to live life. Arrange nursing care with enemas or removal of feces. I don't really know what we know. Whatever, more life advice, but I don't know what we're now talking about. Prevention. Suitable diet and exercise. outlook, the tendency is usually lifelong. If it's lifelong, but it can be prevented. Can it be caused once when it is? But if it is lifelong, or the tendency, what is interesting? Why do people have it? Now, what is the cause? Because the two things I don't know understand what we're talking about, but I think it's just about way of living. But there must be some people who have a tendency to have it. I want to know what the biological tendency to it is. Whatever. All we can say here is some changes in the lifestyle, and that should prevent it. But the tendency to have it is still there. Whatever. That was the part 2, inactive colon. If you were here for medicine, inactive colon, you can go directly to the next part of medicine. We will do now standing yoga. If you stand, participate in standing yoga, so that your arms and your feet stand together and be breathing in and out. Without the arms down. In the arms up. Out the arms down. In and out. Out open to the side. In and out. Out open to the side. In and out. And out onto the side. Make an inch space between your feet. In and out. Out and sink a bit down. In and out. Out onto the side. In and out. Out and down. In and out. And out, lean onto the knees. Breathe in. And out, make a hell with the back. In into the middle. And out around back. Belly with the back. In into the middle. And out a hell with the back. In into the middle. And out the belly with the back. In into the middle. And out, come with a long back up and make it double backwards. Shoulder joint. And now breathe again into the arms up. Out down to the side. In and out. Out the arms over the sides down into the chair. You can come halfway up. Come higher up. And out and we're coming up. We're going to reach high. Shoulder open to the side. In and up. Out the arms over the sides down. You can come halfway up. Higher up. And out and we're coming up. Breathe in, come up onto the toes. And out and sink down. And again in and out. And out and down. In and out. Out the arms on the sides down and bring the feet again together. Breathe in, bend the right knee. And breathe out and stretch your left leg. Breathe in and change. And out and stretch your right leg. In and change. And out and stretch your left leg. In and change. Out and stretch your right leg. In and double middle. And out and down. No neckstretching. Breathe in with the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in the hand again in. And out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. Breathe in the hand down. Out and down. Now the pelican. Make hand with space between the feet. Shift the weight to the heels and breathe in and come down. And out and up. In and down. Out and up. In and down. And out and up. Now take hold on the elbows and gentle from side to side. Hands again down, feet together. And breathe in, come halfway up with straight back, monkey half lift. And out and down. In and halfway up. Out and down. Breathe in, lift the arms up, Delix 1. Bring the hands together, lower down, hands down. Now we can have the toes pointed to the outside. Have an ulnar space between the heels. Breathe in, lift the arms up. And breathe out and sink down into the garden pose. Place your elbows against the inside of the knees. Breathe in and straighten the back up. And breathe out and come with the back up. Breathe again. And out, back into the garden pose. Breathe in, straighten up. and out, and come slowly, one straight line up. The crown of the head first, the arms down, and breathe again in. And out, sink again down, elbows against the inside of the knees, breathe in, straighten up. And out and come with the back up. Breathe again in. Out, back into the current pose. Breathe in, straighten up with the back. And out, tuck the pelvis in and come off the crown of the head first up. Hands. Now put the palms of the hands together and the elbows together. Breathe in and lift the arms up. And out and down. And again in and up. Out and down. Hands together, breathe in. And out, stretch in front, bring onto the hand down. In back. And out, stretch in front. And in back. Now have the feet standing together. Intertwine the fingers behind the back. Breathe in, tall up, shoulders back. And out, turn the head over to one side. The chin down to the clavicle. Breathe again in. And out, pull the hands down to the ground. Breathe again in. Lift the gaze and turn the head over to the other side. Breathe again in. Out, chin down to the clavicle. Pull the hands down to the ground. Breathe in, lift the gaze, and bring the gaze back into the. Now, the feet again shoulder wide apart, intertwine the fingers again behind the back, bring them over to one side, the stretch of Venus. Breathe in, shoulders back, tall up. And out, head over to the side where the hands are, and chin down to the clavicle. Breathe again in. Now, pull the arm and lift the shoulder down. Breathe in, lift the gaze. Turn it over to the other side. Also the hands over to the other side. Hold up, shoulders back. Breathe in. Out, chin down to the clavicle. Pull the arm and lift the shoulder down. Breathe in, lift the gaze and turn it back. Feet are together. One arm behind the back, the other one up. And bring the head over to the side. Don't pull at the head. Breathe again in. And out, look up to the hand on top. And the hand again up. Other hand behind the back. Breathe in, the other hand up. And out, bring the head over. Don't pull at the head. Breathe again in. And out, look to the fingers of the hand, which is taking the hand over. And the hand again. And now breathe in, lift the arms up. And breathe out, draw the shoulder blades together. Breathe in, the arms up. And out and down. In and up. Hands together, breathe out and lean back. In into the middle. Out, leaning again back. In into the middle. Out, lean over to the side with further wind. In into the middle. And out over to the other side. In into the middle. Now across the arms, intertwine the fingers to reach high with screw. Without reach round all over the back. In and up. Intertwine the other way down. Breathe and reach high. Without reaching front all over the back with drill. In and the hands up. Out and lean back with long arms with a sky arc. In and up. Then out, leaning again back. In and up. Out the hands down. Breathe in the hands up. Bring the palms together and lower the hands slowly down to heart center. Breathe out. That was the standing yoga. I thank you very much and until next time. Hi, welcome. I'm trying to learn medicine. Today, recurrent cold sores. And after we've done it, we're going to do stretching. And if you participate in the stretching, then it's better the own risk. Recurrent cold sores. We had in the previous part already the primary cold sores. We could go back to that probably in a moment. So here's the other thing. What we're going to do after the stretching, if you participate in the honors, and we're talking about internal anatomy and diseases and illness. And this is no medical advice. We're just reading about it. Recurrent cold sores. The condition usually recurs at the same site, the most common site being the lips and face, but any part of the skin may be affected. The same site we had here, but in adults, especially nurses, dentists and doctors, the skin around the nail is affected. and it occurs when at the same site, so it is when probably the infection come in through the nails at that point. Do I guess now? Okay, at the same site does the condition recur, the most common sites being the lips and face, but any part of the skin may be affected. Of the skin. Why the skin? Cold sores. The virus which causes cold sores, known medically as herpes simplex, is one of mankind's commonest infections. There are two types, HSV-1, which carries infections of the mouth, face and eyes, and HSV-2, which causes genital herpes. Over 50% of the adult population have antibodies to HSV-1. The virus lies dormant in the sensory nerve cells for many years. In the sensory nerve cells. So the question, as I said at the beginning, I'm wondering now, why is the skin affected? Why does this thing attack the skin? The virus, why not, whatever, I don't know. Does the word source mean something? But why does it not affect whatever? Like any other type of illness. Why does it affect the skin? The virus lies dormant in the sensory nerve cells for many years, causing no trouble, but it can be activated at any time. Primary cold sores, symptoms, duration, causes. A virus called herpes virus hominis, an adult primary herpes, may be contracted as a venereal disease and spread by sexual intercourse. So we're talking about also a bit about that, sexual intercourse and genitals. But okay, I have still the question: why affects the skin and not whatever, a headache or something? In general, why do different things affect different things? And why by people different things? People don't have all of the same symptoms. The onset is usually sudden. Tingling, burning, and itching may be felt for a few hours before the typical blisters appear. These break, crust, and become infected by bacteria and cause pain. Why do they become affected by bacteria? Is it inevitable that just there are everywhere bacteria, every kind of bacteria will infect, or is it just that it's most likely to happen? It's not that clean, but it will happen. But it would be possible if you take extra care. Why do they become infected with bacteria? It is a virus, as they say. So the onset is usually sudden of recurrent cold sores. It is tingling, burning, and itching may be felt for a few hours before the typical blisters appear. These break, crust, and become infected by bacteria and cause pain. Duration. The crusting develops in 3 to 5 days, and healing is usually complete within 14 days. Okay, then for around 3 weeks. 1 week of crusting, 1 week of whatever, this thing, and then 2 weeks of healing. Causes. The same virus that causes the primary infection, previously dormant in the sensory nerve cells of the affected area, it is just in the area. Does it not wander through the body? Why does it not wander? If not, why not? This is a very interesting question. For overall nerve cells and overall illnesses and the infrastructure and coordination system of the human body, whatever. We have HSV-1 and HSV-2. Two types. HSV-1 carries infections of the mouth, face, and eyes. HSV-2 causes genital herpes. Does it not matter where the infection of HSV-2 was? The condition usually recurs at the same site. Recurrent cold sores. I think that it's very interesting that it happens at the same site. It's the same place. It's the same site. Why does it not wander through the body? It is a virus. It infects the skin in some parts. It comes so easily in, and so many people have it. Why is it? Can people infect themselves at themselves? If they have it at the fingers and now touch their mouth and have it then if the mouth is wet while it's both together? Causes. Did we have now? Causes. The same virus that caused the primary infection, previously dormant in the sensory nerve cells of the affected area, becomes active. Reactivation appears to be produced by stimuli, for example, infection, sunburn, cold, menstruation, or an injury. Okay, basically, if there's something being a burden on the human body, an infection, a sunburn, a cold, menstruation, or injury. Complications. Someone should check completely down what types of injuries cause now recurrent cold source of HSV. It would be interesting what type of injuries would not do it. Complications. Because I think it's interesting that sunburn and cold do it. What happens when the sunburn is not at the place which is affected by it? So some people get a sunburn, whatever, at the arms or whatever. What if they have herpes at another place? Does it come? Does it come from an overall exhaustion of the human body? Or is it because at that place where the HSV virus is dormant in the nerve cells, at that place becomes where this, whatever, disrupted by the sun or whatever? And with cold, they mean with cold, the illness not being cold, huh? Extreme cold or sunburn over mean cold? Or do we mean extreme cold? I don't know. I don't know. Maybe. Complications. These are rare, but can include herptic ulcers of the eye and encephalitis, or the virus may spread to others by direct contact. Sexual intercourse or during childbirth to the baby. Is it only transmittable if it is right now recurrent? Would be interesting to read an article about basically an analysis about or scientific fact-based advices what to do that it is not right now recurrent while the childbirth is given. Treatment in the home. Application of alcohol, Vaseline and antibiotic creams may all help to soothe or even reduce the size of a cold sore, but there is no cure. No cure. Only treatment. When to consult a doctor? If the rash is anywhere near the eye. What if people have it at the fingers and then touch their eyes? Is it no way transmittable? Because if not, then if yes, it should be written here very, very big red, and then it should be maybe even closed, not just treated with less pain, but also that it cannot be transmitted directly onward with these people who are infected, wear gloves or something. When to consult the doctor, if a rash is anywhere near the eye, complications must be avoided by seeking early medical advice. So if it's by the eye. They say the complications. These are rare but can include herpes ulcers of the eye and encephalitis. What are ulcers and how can an ulcer happen at or in the eye? Okay, we'll talk about it. If the recurrence are frequent, as some underlying medical disorder may be responsible. Okay, if people have oftentimes recurrent, then they have maybe an underlying burden lying on their physiological whatever apparatus. What the doctor might do, apart from excluding other illnesses, the doctor may prescribe one of the newer antiviral drugs. Maybe there's new medicine. The book is from the 80s. Maybe there's new. Prevention. None is known. But the virus is found in the blisters, so avoid direct contact with others if blisters are present or broken. Why does it stay at the same site? Why does it not spread through the body? Can it anywhere penetrate, or can it only penetrate at one place because we have here sexual transmissible? Can it only at one places or at places which are open penetrate, or just at other places? So none is known, but the virus is found in the blisters, so avoid direct contact with others if blisters are present or broken. Why is it not transmittable if it is dormant? And how would it be able to make a medication which makes it dormant, like with HIV? I heard something like that before. Outlook. Each attack will clear, but the recurrence is always possible. So basically it's dormant, and from time to time it comes up. That was a medical part. If you were given medicine and it was no medical advice, then you can go directly to the next part of medicine. We will do now the stretching. If you participate in stretching, that's what I think. Make sure that we find a part for breathing and lifting the arms up. And breathe out and go to the side. Breathe in a little bit. Out to the other side. In a little. Out and down with your arms. Breathe again in. Out, my hand slides down the leg and the other shoulder stays down. Breathe again in. And out, we're taking one arm over. Breathe in and open the ribcage. And breathe out into the middle. Breathe again in. Out one hand slides down the leg, the other shoulder stays down. Breathe in. And out one arm off. Breathe in and open the ribcage. And out and back. Now have feet standing together. And breathe in and lift the arms up. Breathe out one arm down. And breathe in and reach. And breathe out. Again in. One arm down. And out and reach. And one arm up. And out and down. Now have the legs standing. Yes. Shoulder to body apart. And we're doing shoulder circles. Back. Up. And front. And backwards. Front. And one more time. And now, breathe in and lift the shoulders up. Breathe out and fall down. Breathe in and lift the shoulders up. Out and fall down. Breathe in and lift the arms up. Now pretend to reach higher into. Take an apple hanging high on an apple branch to turn it a bit around and then to pluck it out. And now to the shifter. Legs wide apart, arms up to a T, breathe in. And out, go over to one side. In into the middle. Out over to the other one. In into the middle. Out over to one side. In into the middle. Out over to one side. In into the middle. And out leaning onto the knees. And breathe again in. And out one shoulder front. In a shoulder back. Out a shoulder front. In a shoulder back. Out a shoulder front. In the back. Out a shoulder front. In the back. And out, and we're hanging down, we're doing the Niagara Fall. Just keep normal breathing in. And out. This is a leg stretch, not a back stretch. Breathing in. And out. Again in. And out, go over to one leg. Breathe in. And out over to the other leg. Breathe in. Out back into the middle. And we do Salto Angelo, bring the feet together and keep one hand down. Just breathe in through the nose. And out from the mouth. Again in. And out comes slowly with a round back up and make it the top of backwards. Shoulder, shoulder. I have a leg standing on white part. Breathe in, go down. And breathe out. Again. Again. Out. Again. Out. Breathe in, close the legs. And breathe again out. That was the stretching. Thank you very much, and until next time. Hi, welcome. I'm trying to learn medicine today, Alkali and Alkalosis, and after we've done it, we're going to do squat training. And if you participate in the squat training, then it's better. And this is no medical advice, we're just reading about it. Alkali, a substance that neutralizes an acid. Okay, alkalis. Okay, they are acids, and we can make it with acid. And these alkalis are neutralizing. Alkalis in the body help to ensure that the blood and the digestive juices from the liver and pancreas are kept slightly alkaline. Okay, they are alkalis in the body, and they are making sure that the blood and also the digestive juices from the liver and pancreas are slightly alkaline, so that they are not too acidious, whatever. So that they're not too sour. The main body alkali is sodium bicarbonate, formed from sodium in the diet and carbon dioxide. Okay, let's read it again. The main body of alkali is sodium bicarbonate. I understand that there are different types of alkali, or alkali is a bigger thing, and the main part of it, or the one of the alkali, non-important for us, whatever, is the sodium bicarbonate. And that is formed through sodium in the diet and carbon dioxide. Okay, the alkali which the human body uses to have not a too sour, too acidious digestive fluids and blood is sodium, which it gets from eating, and carbon dioxide, probably from breathing or whatever. Okay, that is alkali. The body needs it to have not too acidious digestive juices and blood. Alkalosis, a disorder caused by a considerable rise of alkali in alkalosis, so too much alkali. Okay. A disorder caused by a considerable rise of alkali in the blood and in other body fluids. Okay, alkalosis is when too much alkali. It can be caused by prolonged vomiting, which passes hydrochloric acid off a system. By taking too much sodium bicarbonate to treat indigestion, or by abnormally deep breathing, which results in excessive loss of carbon dioxide. Symptoms include tingling skin, muscle weakness, and cramping. When vomiting is the cause, a transfusion of a saline solution may be needed. Okay, let's do it again. Alkalosis, too little alkali in the... No, too much. Alkalosis, too much. Alkalosis, too much. Alkali in the blood and in the body fluids. And it can happen if someone vomits a lot, because then the hydrochloric acids are vomited without. It can also happen if someone takes too much sodium bicarbonate, if they are treating indigestion. We had here that sodium bicarbonate is the main body of this alkali. So they are taking sodium bicarbonate to help with digestion. But now we have too much sodium bicarbonate, so too much alkali can be produced out of this sodium bicarbonate. Sodium bicarbonate, too much alkali. Now we have too much alkali. Or also by abnormally deep breathing, which results in excessive loss of carbon dioxide. Breathing has something to do with carbon dioxide. And if someone breathes, we want to get oxygen in, and we're putting the carbon dioxide out. That is broad, I think. And if they're breathing deeply, they're putting too much carbon dioxide out. Is it not something which happens after a couple of seconds? If someone breathes for a few seconds too much? Or does it happen if someone over hours or days or weeks or generally breathes too deep? Other people who are doing it would be quite interesting. Symptoms include tingling skin, muscle weakness, and cramping. Are they short term? So the way I see this here as alkalosis, I would say that is something someone gets over weeks and has been over years. Now the way explaining it is with prolonged vomiting, taking tablets or taking drugs and medical drugs, or breathing deep, and when the symptoms are tingling of the skin, muscle weakness, and cramp. This sounds all like thing which happen immediately within a few seconds or minutes, and only for a few minutes and hours until it's over. Okay, whatever. Tingling skin, muscle weakness, and cramp. When vomiting is the cause, a transfusion of a saline solution may be needed. What does now a saline solution help? I have no idea. Okay, that was alkali and alkalosis. If you will use a medicine for alkali and alkalosis, you can go directly to the next part of medicine, where we will continue with something medicine. This was no medical advice. We read it a bit like that, but it's not medical advice. If you will use a medicine, you can go directly to the next part of medicine. If you stay and participate in the squat training, then it's better. One leg up and point with the foot down. Other leg up and point with the foot down. And now go to the side. And point with the toes in front and stretch inner side of the leg. Over to the other side. And now the mantis go from side to side. And now to the squats. We're just starting with legs wide apart, and we come down to the first one. And now again to the second one, and it's the third and fourth one. After we've done the 5 and 6, we have done the half. So we're going on to 7 and 8, another 9, and we have the 10 foot, but just 2 more, 11 and 12. And now the 6-pack squat squeeze. Legs wide apart, we're going down into quarter squat, and press at the top of the leg against the leg only on one side. And on the other side, press against the leg. Go halfway down into half squat and press at the middle of the leg against the leg. And on the other side. And now down into 3/4 squat and press close to the knee. And now on the other side. And now the fastest giraffe of a water pond. We're going down into 3/4 squat. Press against the knee. And go towards the knee. And again, press against the knee. And go towards it. And again, press against it. Go towards it. And again. And again. And again. Last 2. Press. Towards it. And again. And up. Already the last exercise, the propeller. Legs wide apart, we're going down into full squat. Arms to the side. Go over to one side. Press against the leg. Look up to the leg. And in the middle, over to the other side. Press against the leg. Look up to the leg. And up. Now stretching. Again, one leg up. Point the foot down. Other leg up, point the foot down. Take the first leg at the ankle. Make a straight back. And point the foot. Knee down, toe down. And the other here. Take it at the ankle. Make a straight back. And point the knee down, toe down. Legs to the side, breathing down, breathing in and go down. And again, breathe in and go down. And out. One more round. Out. Breathe in across the legs. And out. That was squat training. I thank you very much, and until next time. Hi, I'm Becca. I'm trying to learn medicine. Today, Alkali and Alkalosis. After we've done that, we're going to do leg injury prevention training. And if you're participating in leg injury prevention training, then it's better the arm risk. And we're talking about a bit about internal anatomy, digestion, I think, a bit, and the blood system. And this is no medical advice. We're just reading about it. This is part 2. Alkali. Alkali is a substance that neutralizes an acid. Alkalis in the body help to ensure that the blood and the digestive juices from the liver and pancreas are kept slightly alkaline. The main body alkali is sodium bicarbonate, formed from sodium in the diet and carbon dioxide. Okay, we want to explain now alkali in here what is important for medicine. Alkali is in the human body to neutralize the acids, and it makes sure that the blood and the digestive fluids from liver and pancreas are slightly alkaline. And the main body, alkali, maybe we're going to use the exact same words. The main body of alkali is sodium bicarbonate, and that is formed from the sodium in the diet and carbon dioxide. Okay, I'm able to say that alkali. Alkali are used in the human body to keep the digestive fluids and the blood slightly alkaline. Alkali makes things less acid. A substance that neutralizes an acid. Alkali neutralizes acid. And the digestive fluids of pancreas and liver, and also the blood system, alkaline. Alkali neutralizes acid a bit in the human body. And the main body part of the main body of alkali is sodium bicarbonate, and the body gets it through sodium of the diet and out of carbon dioxide. That's all. I have a second camera, which I'm going to start now. Alkali are used in the human body to keep the digestive fluids, which are made by the pancreas and the liver, and also the blood, a little alkaline. Alkali neutralizes acid a bit. And the main body of alkali is sodium bicarbonate, and the human body gets it through the diet. It gets the sodium out of carbon dioxide. That is according to Keith Hodgkin's Family Medical Advisor, page 69, but this is no medical advice. I said what I wanted to say, not the most directest way what I said. I'm going to stop the camera and start with the knot again. Because we're having a second part here. Alkalosis. Alkalosis. A disorder caused by a considerable rise of alkali in the blood, so rise of alkali, more alkali in the blood and in other body fluids. It can be caused by prolonged vomiting, which passes hydrochloric acid out of the system. So we're just going to say it before really understanding it. Which passes hydrochloric acid out of the system. Oh, but I understand it. It passes with the acid out, and therefore more alkali is there. And it makes sense that vomiting brings the acid out of the stomach, of the acid juices produced by the liver and pancreas, which are in the stomach, and if you vomit, they come out, and you lose all the acids, and now there's too much alkali. Okay, it passes the hydrochloric acid out of the system vomiting. It can also happen through taking too much sodium bicarbonate to treat indigestion. So it means that there are people taking sodium bicarbonate to treat indigestion. What exactly is not the problem of indigestion? But there are some problem with digestion. It can happen through sodium bicarbonate medication to treat indigestion. Sodium carbonate is one of the main part of carbon dioxide to make alkali in the human body, to make sodium bicarbonate, sodium bicarbonate is already to make the alkali which is used in the human body to make things like Addison and Alkalosis. There's not too much alkali, so people taking sodium bicarbonate, one of the main substances, to build it, or the abnormally deep breathing that results in excessive loss of carbon dioxide. Why? If they know losing carbon dioxide, when they have not the carbon dioxide to create the alkali, well, why do they have not too much alkali? Maybe it's too concentrated. That would be interesting. It's the same amount or even less or whatever, but it's more. Imagine the alkali gets stronger if there's less carbon dioxide in it, but more sodium bicarbonate. More sodium. The sodium and sodium bicarbonate is the thing together. Sodium bicarbonate is sodium and carbon dioxide. Sodium bicarbonate. I don't get it completely, but that's the word. Sodium bicarbonate. Sodium and carbon dioxide. Okay, so let's not go a bit much into details. I'm not going to explain all the details. Alkalosis, where the human body has too much alkali in it. A disorder caused by considerable rise of alkali in the blood and in other body fluids. Blood and body fluids, we're going to take it down to body. If you would say it would be blood and other body fluids. And the causes for which can happen is prolonged vomiting. Do we explain it? Let's explain it. No, not maybe it is. Which passes hydrochloric acid out of the system. Because when the hydrochloric system it passes out of the body, and why is when there too much alkali there? It would be just in a relationship to the now less hydrochloric acid in the human body. It will not be automatically more alkali. Considerable rise of alkali, because the introduction sentence says it has to rise, but just because the hydrochloric acid goes down does not mean automatically that the alkali goes up. But they say it as if it would happen, and that is interesting. Because there's a big difference. If just one drops because people vomit out, and now there's a difference, and that would be a problem, too much alkali, or if it actually rises if hydrochloric acid is vomited out. So we're not going to say, let's keep our explanation short. We're going to take the one here, because when hydrochloric acid is passed out, then it can happen for people taking sodium carbonate to treat indigestion. Sodium carbonate is one of a part of carbon dioxide of the main bodies for the human body to make the alkali, which is normally used to neutralize the acids in the blood and the digestive fluids formed through the liver and pancreas. And it can also happen through abnormally deep breathing, because when excessively carbon dioxide is lost. Symptoms: tingling skin, muscle weakness and cramp. Tingling skin, muscle weakness and cramp. Skin, muscle weakness and cramp. Muscle weakness and cramp. It's interesting. An interesting combination. When vomiting is because a transfusion of saline solution may be needed. We're not going to say it. Maybe it is an interesting information, but I don't think we're going to say it. Because we have no explanation why that should happen, and we don't want to even sound like giving them medical advice. Alkalosis. Alkalosis is if the human body has too much alkali. I think we can shorten it down to that. That's okay, I think. Considerable rise if there's too much alkali. And it can happen through vomiting, because when hydrochloric acid is passed out. It can happen through taking sodium bicarbonate tablets to treat indigestion. Sodium bicarbonate is one of the two parts, a part of carbon dioxide, to form. But it doesn't make sense with the third thing, with excessive breathing, which can excessively pass carbon dioxide out. With the abnormally deep breathing passes out excessive loss of carbon dioxide. Symptoms: muscle weakness, cramp, and tingling of skin. Let's try it. I'm going to stop the camera. How do we say the thing with a saline solution? Let's look at it. When vomiting is because a transfusion of a saline solution may be needed. This is sometimes treated with a saline solution. Then we're going to say alkalosis. Alkalosis is a medical condition in which a human body has too much alkali. And it can happen through three things. It can happen through vomiting, because when hydrochloric acid is passed out. And it can happen through taking sodium bicarbonate medicamentation to treat indigestion. So the bicarbonate is a part of carbon dioxide, one of the main parts to make for the human body alkali, and they are used in the human body to neutralize acids, the acid in the blood and of the digestive fluids produced by the liver and pancreas. And then the third cause is, for example, that people are breathing abnormally deep and when excessive carbon dioxide is passed out. And the symptoms are muscle weakness, tingling of the skin, and cramps. And that is according to Keith Hodgkins, Family Medical Advisor, page 69, but this is no medical advice. I'm going to stop the camera. And it was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now leg injury prevention training. If you stay and participate in the leg injury prevention training, that's at your own risk. One leg up now. Stand on one leg and swing the other one with the next foot to the side and in front. And the other foot to the side and in front. And now bring one foot in front and the back. And the other leg in front and back. And now bring one foot up, pine pulcro, lift out to the side, again in, out and down, other leg up, out to the side, in the middle, out and down. And now one leg up, arms out, and turn with the upper part of the body with the arms over to one side. And go to the other side. The middle, and now arms over and also leg over. And change. And the middle and down. Other leg up and go with the hands to one side. Over to the other side. And leg over to one side. And off. And a little and down. And now one leg up and press with the knee up and to the side. And the other knee up and press up to the side. And now next exercise, I think it's called the prospector. This exercise can go a bit under the knee. Stand good with one knee, turn over to the leg, go down to the knee, over to the other side, go up again. Then around, stand good, turn over to the standing leg, go a bit down, over to the other side, come up again. With the other leg. Good standing, turn over to the leg, go down, go to the other side, and come up again. And another round, stand good, turn over to the leg, go down, turn to the other side, come up again. Now the clock can go again onto the knee. Go in front, go a bit down to the knees while you do it. And always in 90 minutes intervals. The clock. And the line. And we also do 10:30 at 9. And over the other leg. And front. And there. And back to 6. And to 4:30. And to 3. And also there. To 1:30. And 3. Now, one hand on tummy, one on lower leg, and bring one leg up and watch a straight line. Foot is flexed. If the leg cramps, then bring the leg up and point the foot down. Try to bring the leg higher. Straight leg, flex foot. Try to bring the leg higher. Control with the hands that you don't fall back. And bring the leg up and point the foot down. And the other leg. One hand on tummy, one on lower back, and bring the leg up. Flex foot, try to bring the leg higher. And bring it up. And now the stamp here and down. Down. Our leg up and down. 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 Baby pad. Heel to the ground. And lift the heel off the ground, place it again on the ground. And the other leg, place it on the ground, lift it off the ground, off the ground. And the horse. Knee in and out, again in and out. And the other leg, knee in and out. And now the camel you can do instead of the horse. So knee in and out, but this time the whole body comes with it down. And with the other leg, knee in and out. And next one, breathing out on. Breathe out. Breathe in, close the legs. And breathing in out. That was leg injury prevention training. I thank you very much, and until next time. Hi, welcome. I'm trying to learn medicine. Today, common cold. And after we've done it, we're gonna do stretching. And if you participate in the stretching, then it's at your own risk. And this is no medical advice. So we're just reading about it. This book is from the 80s. This is no medical advice. We're just reading about it. And this book is... Common cold. A highly contagious virus infection, more usual in winter months or common all the year round. Okay, the common cold is easy to transmit to another person, and it is more usual in winter, but it can happen for all the year. It can be caused by many different viruses, and as these are constantly changing, any immunity developed from one infection may not protect against further infection. Okay, there are many different viruses of them. and they are mutating, constantly changing, and therefore people cannot develop immunity. Immunity developed from one infection may not protect against further infection, because there are many different viruses and they are mutating. However, some immunity is developed over the years, and adults are usually less vulnerable than children. Okay, they are saying that adults are less vulnerable to get ill as children are. Maybe. The following groups of individuals are Now, I just saw something about that. Prevention. Regular exercise, stop smoking. What if, because the kids are probably not smoking, what if this is even distorted? What if even less adults would be ill if they would not smoke? What if something like that, because the adults have it already this, because they have a little immunity, maybe, but what if they're having behavior like smoking, which the kids don't have, the following groups of individuals are at special risk. The frail and elderly, babies and the very young, patients who are obviously ill or who have a persistent fever for more than 3 days. Okay, so people who are frail, whatever that means, and people who have aged longer, and also babies and very young people. And then also patients who are obviously ill or who have a persistent fever for more than 3 days. But don't they get the persistent fever from the common cold? Now, how are we now in particular vulnerable to get the common cold? Do we not have it already? Whatever. As you see, this is no medical advice. We're just reading about it and reacting to it, speculating about it. The virus affects the whole upper respiratory tract, producing a swollen, inflamed, leaning to the nose in particular, and also the throat and often the sinuses and larynx, the voice box. So the virus affects the whole upper respiratory tract. It produces a swollen and inflamed leaning to the nose. Lining to the... Something is swollen somewhere in the nose, some line or whatever. And also the throat and often the sinuses and larynx. So the sinus are we have 8 of us, or 4 paired. They are swollen, so they block the nose, and also the larynx is affected in the throat. Yes, it's called throat. Okay. Mucus from the nose is loaded with viruses, and the air breathed the air breathed. Even I just forgot them because we're talking about the nose. The air out of a nose is infected with viruses. That would be interesting. It would be strange if not. So mucus from the nose is loaded with virus. So the mucus in the nose is the virus is full, and also the air breath out and coughing and sneezing out by an infected person may infect others in the vicinity. Okay, people can just infect. I don't know. Yeah, other people if they're breathing. Symptoms: sore throat, headache, and a stuffy feeling in the front of the head. A stuffy feeling in the front of the head. Running nose. The discharge is clear and runny at first, later becoming thicker and greenish yellow. Tending to block the nose. Sneezing is coming. People are sneezing, having thick and greenish discharge out of the nose, and the start is more clear and running all the time. A core which may be dry or tickly. Some type of core. Lack of appetite, people don't want to eat that much. Although the patient may feel hot or cold, the temperature, if measured, is normally or only slightly raised. Okay, that is interesting. They're saying here that the temperature, again, this is not medical advice, they are saying here that the temperature is not or only a little raised. That is interesting. What the person can feel, the person can feel hot or cold. General feeling of lack of energy, so people feeling less energetic. Duration. The incubation period is approximately 2 days, so around 2 days after the people has gotten the virus in. Symptoms usually last at least 3 days and subside over the following 3 to 7 days. 3 days, do I say? And subside over the following 3 to 7 days. So again, 3 to 7 days. So 6 to 10 days, do we say? The nose may run or feel blocked for up to 3 weeks afterwards. Up to 3 weeks afterwards. The infection of 10 days plus 3 weeks. Causes. Numerous viruses. Colds are not caused by getting wet or physically cold, but infection is more likely if the body's resistance is reduced by factors such as chronic illness, fatigue, stress, or depression. Okay, colds are not caused by what colds now? The cold, so the common cold, so the virus cold, is not caused by getting wet or if a person gets physically cold. But it is more likely that the body's resistance is reduced if a person is chronically ill, has fatigue, stress, or depression. Complications. Colds may trigger off other secondary infections in the lungs, sinuses, or ears. Okay, then can get other infections based on the same common cold, or of another infection somewhere which is already there, or are they more likely to get it? I think some are all three. When the sinuses, the ears, and the lungs. Treatment in the home. Keep the patient's temperature down. Although the patient may feel cold, his temperature may actually be raised. Do not wrap up in extra clothes or blankets, and do not heat up the room excessively or sit in front of a hot fire. Rather, allow the body to lose some of the excess heat being generated. Babies are particularly vulnerable to overheating. They should be kept in a comfortable, warm room and wear as little clothing as possible to prevent dehydration and convulsions. I don't know what convulsions are. Okay, they are advising here that people should not make it in particular warm. Tepid sponging may cool and soothe children. Whatever it is. Take extra drinks, especially cool drinks, to replace fluids being lost and to cool the body. People should drink. Lack of food is not important. Lack of food is not important, but fluid loss makes the patient feel worse, and the babies can be dangerous. Babies should, if possible, be given additional water or diluted fruit juice between milk feeds in sufficient amounts to produce at least 3 wet nappies in 24 hours. Okay, people should. They are saying here, lack of food is not important. Again, this book's from the Addison, and this is not medical advice, but I think that's an interesting thing. Lack of food is not important, but fluid loss makes the patient feel worse. In particular, babies, that's important. Take painkillers in recommended doses. This helps to keep the temperature down. Now, is the temperature raised or not? Whatever. As linctus or co-mixture may ease irritation, cause symptoms. A linctus or co-mixture may ease irritation, cause symptoms. Something or something else may ease the core symptoms. Steam inhalation may help. Be careful not to expose children to the danger of scalding if boiling water is used. Whatever, boiling water is dangerous. Do not smoke and avoid tobacco fumes. So don't smoke. Do not use nose drops. They may appear to give immediate relief, but can cause the nose to become more blocked. Again, this book is from the 80s, and I don't know if it was more later, but we're saying here, do not use nose drops. They may appear to give immediate relief, but can cause the nose to become more blocked. A walk in the fresh air may ease symptoms. A walk in the fresh air may ease symptoms. Why? Why? Why should the symptoms be easy? Is it just because the mind is distracted? Is it because other sensors and its other sensors are sensing other things? Like the feet are just walking, and now there's more to measure. Yeah, over time. I want to come through. Extra sleep or rest in bed assists recovery. Okay, they're saying to sleep a little more, or to rest may assist recovery. When to consult a doctor. Colds get better on their own. Doctors cannot cure them. Okay, they cannot be cured, but they get better on their own. Antibiotics such as penicillin are of no value unless there are complications which respond to them. But the doctor should be consulted if, there are no antibiotics, but if there are complications, then these antibiotics can be used against complications. And they say that people should consult a doctor if there's a chronic lung disease, such as emphysema, so if people have a chronic lung disease, green or yellow phlegm is being caught up. People should see a doctor if they're calling a green or yellow phlegm. Or phlegm, or whatever it is, or how it's pronounced. Then you should see a doctor. This one here. A raised temperature persists for longer than 3 days. Earache or a runny ear develops. So if people have earache or a runny ear, they should also see the doctor. A stiff neck develops but cannot be bent forward. For children, you should consult a doctor. If you get a stiff neck, they should then consult a doctor. If crying is inconsolable, do we mean now if a child does it? For children, you should consider such a That's for children. If a temperature cannot be reduced by removing clothes, tepid, spongy, and extra fluids. So for temperature, these are. If the crying keeps going, if a child becomes drowsy and unresponsive, if a child vomits more than twice, if there is difficulty in breathing or noisy breathing, what the doctor might do. So it's also for children, but I think if an adult has this, what the doctor might do. Look for complications. Look for complications, particularly chest infections or in children ear infection. If there are complicating infections, we may prescribe antibiotics. Prevention. Regularly exercise, stop smoking. For some time, non-medical sources have recommended regular large doses of vitamin C as prevention, but there is no medical evidence that this is beneficial. Okay, we're saying do sport or fitness or stay fit, do exercises. It doesn't have to be always the full thing. But again, this is not medical advice. Regular exercise, stop smoking, and for some time, non-medical sources have recommended regular large doses of vitamin C as prevention. But there is no medical advice that this is beneficial. Outlook. No long-term problems if secondary complicating infections can be avoided. So if no complications happen, then it should clear up and get completely fit again. Now this was the medicine part. And now we're going to the fitness part. Now, if you were here for medicine, you can go directly to the next part of medicine. What did I say? Expert of medicine. if you stay here and participate in the short stretching 2 minutes, then it's better the arms. We are having the next any. Shall we find a part for breathing into the arms up? We will go over to one side. In and out. And go over to the other side. In and out. Out and down. Breathe again in. Out one hand slides down the leg. Breathe in. And out one. Breathe in down the ribcage. Out into the middle. Breathe in. Out one arm down. Again in. Out one arm over. Breathe in down the ribcage. Hold it on down. And feet standing together. Breathe in the arms up. Breathe out one hand down. Breathe in and reach in the both directions. Up and up. Again in. Out one hand down. Breathe in and reach. Out and up. And hands down. Now feet standing shoulder wide apart. And we're doing shoulder circles. Go back. Air front. Down. Up. Air front. And down. And backwards. Front. Up. Back. And down. From up. Back. And down. Now breathe in the arms up. And breathe out, bring the arms down, hanging down the other forwards. Breathe again in. And out down the leg. Breathe again in. Out over to the other leg. Breathe again in. Out into the middle. And breathe in. And out comes slowly with a round back up. You get up to the good shoulder shower. And breathe again in, go down. And breathe out. Again in. Out. And breathe in, close the legs. And breathe out. It's also 120 seconds stretching. But nevertheless, I think you will watch it next time. I'm welcome. I'm trying to learn medicine today, Amoebiasis, and after we've done that, we're going to do martial arts basic training. And if you participate in the martial arts basic training, then it's very on risk. And we're talking about a disease and a parasite disease, I think. So, yeah. And also internal anatomy and faces, and this is no medical advice, we're just reading about it. Amoebiasis, a parasitic disease found worldwide, but more commonly in tropical countries. Okay, it is a disease caused through a parasite. It is more commonly in tropical countries, but it's worldwide. The infection is spread by food or water which has been contaminated by flies carrying the germ from human feces. Okay. There are flies, and it could be that they were at human feces which had this amoebiasis, and now these flies are flying on and going onto other water or food, and that way it is spread. Travelers to the tropics, especially areas where amoebic dysentery is common. I don't know what it is. Should avoid water unless they know it is being purified. I don't know what it means. And fruit and vegetables from sources where contaminated water may have been used to wash them. It means it can be that people wash the fruit with contaminated water. Okay, the people should take only purified water, and they should take care that the food is not washed with contaminated water. Iodine-releasing tablets added to the water will kill the amoeba, but they cannot be destroyed simply by boiling water or adding chlorine to. Oh, it is interesting. So, it's not purified does not mean boiled, because boiling will not work. Boiling does not work. Can we read it again? Boiling does not work. Iodine-releasing tablets added to water will kill the amoeba. And chlorine in the water, or also boiling the water, does not work. Symptoms: diarrhea. This may be profuse with blood and mucus, amoebic dysentery, or less severe intermittent. Something of that is amoebic dysentery, I don't know, but whatever, diarrhea with blood and mucus. Abdominal cramps, so cramps in the abdomen, I don't know exactly. If the infection spreads to the liver, it will produce an abscess which can be felt by the doctor, and the patient will suffer fever, sweats, and weight loss. Okay, it can spread to the liver, and that can make a feelable, what is it called? Whatever, a feelable, I won't use feelable, we have something better. A feelable abscess. The patient suffers fever, sweats, and weight loss. Symptoms. Sometimes there are no symptoms, but the patient is carrying the disease and will excrete germs in his or her feces. Okay, sometimes the people don't have the symptoms, but they're still spreading. Duration. Infections may persist indefinitely if not treated. Some people say indefinitely. Infected by Amoebiasis causes a parasite called Entamoeba histolytica, which attacks the intestines. Okay, there's a parasite and it attacks the intestines, and it is called Entamoeba histolytica. Treatment. In severe cases, bed rest and replacement of lost fluids are essential. Okay, the people need rest and lost fluids replaced. When to consult the doctor. If there is a severe or prolonged attack of dysentery. So dysentery seems to be the diarrhea of blood and mucus. We're just with C, so maybe we're gonna have it by D. And so if there is dysentery, and if a patient is in an area where amoebic dysentery or dysentery is known to occur. Okay, if the people believe they have it, maybe. Or if they have dysentery. What the doctor might do: check stools for amoeba or their cysts. I mean the cysts of the parasite. Whatever we're checking. Prescribe an anti-amoebic drug. And we're getting an anti-amoebic drug. Now, he's not written off if it works. Okay. That was Amoebiasis. I think it's too early to make a presentation. We haven't done this. This is our first part that we're doing, Amoebiasis. But we have time to go over it again. Amoebiasis. Now, it can be transmitted by flies, which are on human faces which are, and if the humans are infected with Amoebiasis, they can then go and swim on the pool or go on the vegetables, and people can eat normal vegetables, drink the water, or wash the vegetables with infected water. And even boiling of the water or chlorine in the water doesn't work. The water has to be whatever with some iodine tablets cleared, purified, whatever. And the people who have it, they have severe diarrhea. We have the diarrhea and maybe dysentery, which seems to be diarrhea with blood and mucus. And they can have cramps, abdominal cramps, and maybe if it spreads to the liver, they have a liver abscess, which is feelable. And when they're having sweats and weight loss and fever. And sometimes they don't have symptoms, but they carry it onto other people. And the fault is Entamoeba, that is a parasite. And bed rest and loss of fluids has to be done. They replace the fluids. And if there is basically a suspicion of a disease, consult a doctor, or dysentery, consult a doctor. When it's analyzed, and there are some drugs against it. Whether it works or not, it's not really. Let's go back to the name of the parasite. Entamoeba histolytica. Entamoeba histolytica. Let's stay a bit longer on the name, because in the next part will be in the next part of Amputation, when we're trying to do the presentation, this will be the hardest thing. That name, Entamoeba histolytis. Entamoeba histolytica. Entamoeba histolytica. Histolytica. Entamoeba histolytica. Entamoeba histolytica. But that was the medicine part. If you were here for medicine, you can go into the next part of medicine. We will do now the martial arts basic training. If you participate in the martial arts basic training, we'll just one leg up and point with the foot down. Then the foot up and down. And circle the foot into that direction. And the other foot up, leg up. Then bring the foot up and down. And now circle the foot. And now take the leg at the ankle. Make it straight back and point with the knee down the foot. And the other leg. Make it straight back. Point with the knee down to the ground. Now with the ring stop, go over to one side. The toes are pointing in front, we are stitching the inner side of the leg. And over to the other side. Again, the toes in front and stitching the inner side of the leg. And now mantis, go from side to side. And back into the leg. And now a few lunges. We're going in front with one leg, and down with the knee, and we're going back. Front, down with the knee, and we're going back. And again with the right leg, back, and in front, back, and two more. And now the shoulder snow plow. Leg up and back, 1, 2, 3 steps in the middle. Our leg up and back. Up, back. Back, 2 more. And now stretch kicks. Hand out, kick against it. 2, 3 steps. Out and kick against it. 1, 2, 3, kick. And 1, 2, 3, hand down and kick. Last 2. That's 2 more. And another 2. And then you're right. And now the frog. Leg up. And again. Up, back, up, in. Back, up, and in. And 1 round more. Up and back. In, up and back. Up and in. And now the Crescent kicks. Kick up and back. And up and in. Up, back, up and in. And 1 more time. Last side. And now, lunge kicks. I'm going to kick more close to the camera. So go in front with the right foot, make a lunge down, and kick, and again back. Now the left foot in front, down with the knee, and kick in front, again back. Right foot in front, knee down, and kick, and again back. Left leg in front, and kick. And right foot in front, knee down, and kick. One more time with the other foot, in front, down, and kick. And now squat kicks. Down into squat, and kick to the side. Squat, and kick, and again. Squat, and kick, and again. Squat, and kick. And last two, squat, and kick, and squat, and kick. And swing kicks. Kick in front, back. 1, 2, 3, front, and back. 1, 2, 3, front, and back. 1, 2, 3, front. And 1, 2, 3, swing kicks. And 1, 2, 3, last one. And now, 12 push-up. Down on the floor, and hands underneath the shoulders, and bring the elbows close to the rib cage, the first one. And second one, and the third one, and number 4, and 5, and 6, and 7, and 8, and 9, and now the number 10, and 11, and to the last one, number 12. And now the high cast hilltop stretch. Heel to the ground and pull the toes in. Foot to the left and pull the toes in. Foot to the right and pull the toes in. To the middle and turn the leg from left to right. Upper heel to the ground, pull the toes in. Foot to the right and pull the toes in. Foot to the left and pull the toes in. To the middle, move the leg from left to right. Walk on the place. Legs wide apart, everything go down. And breathe out. Again in. Out. Breathe in, close the legs. And breathe again out. That was martial arts basic training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, Amoebiasis. And after we've done that, we're gonna do leg injury prevention training, and if you participate in the leg injury prevention training, then it's like honest. And we're talking about a disease, internal anatomy, a parasite disease, and feces, and defecation, and diarrhea, and so on. And this is no medical advice, we're just reading about it, and it is part 2. Amoebiasis. Okay, it is a parasite disease found worldwide, but it's more commonly in the tropics. The infection is spread by food or water which has been contaminated by flies carrying the germ from human feces. Travelers in the tropics, especially areas where amoebic dysentery is common, should avoid water unless they know it has been purified, and fruit and vegetables from sources where contaminated water may have been used to wash them. Okay, we have found this information so far. That it is spread over flies which were at human faces infected with amoebiasis and then got to water or something else, and fruits which are washed with contaminated water can have also the parasite on them. Iodine releasing tablets added to the water will kill the amoeba, but they cannot be destroyed simply by boiling water or adding chlorine to it. Okay, boiling the water or chlorine does not work. Iodine releasing tablets kill the amoeba. We said we are really around. Iodine, it's iodine tablets. Iodine tablets. Iodine releasing tablets can kill the amoeba. Boiling the water or chlorine, putting chlorine into it does not work. Boiling chlorine does not work. Okay, we have that. It is spread by human flies carrying the germ from human faces to food or water. And also food or water can have it. And iodine tablets work, but not boiling and not chlorine. Symptoms: diarrhea. This may be profuse with blood and mucus, amoebic dysentery, or less severe and intermittent. We're going to say just diarrhea. I don't really understand now. If no, this part with blood and mucus is dysentery or milk dysentery, whatever. We're going to say diarrhea. Maybe with blood and mucus. We're going to say it. Diarrhea, maybe with blood and mucus. Abdominal cramps. The infection can spread to the liver, and then an abscess can be felt. I don't think we want to say, but we could say fever, sweat and weight loss. Then fever, sweat and weight loss. Okay, we're having diarrhea and cramps and abscess. And it persists if not treated. We could say that causes Entamoeba histolytica. We're just going to say it at the beginning. It is the parasite Entamoeba histolytica and amoeba. The parasite Entamoeba histolytica. And Amoeba histolytica. And Amoeba histolytica. And severe cases, bed rest, fruits replacing. Let's stay away from it. I don't understand what it means here now. And this is no medical advice, so I don't really need for it. If there is a severe or prolonged attack of dysentery, I don't understand what it means. Particularly if a patient is in an area where amoebic dysentery is known to occur. So consult a doctor to have it. Check stool for amoeba or where cyst, prescribe an anti-amoebic drug. Now, in the last part, I speculated that that cyst means all the larvs, but I think they mean if there is amoeba in the stool or cyst in the liver, or something else, maybe that is meant with cyst. I understood larvs. Okay, we have all the information together. Are we able to say them? We have, it is common, amoebiac disease. Amoebiasis. I think amoebiac disease, it's okay. Amoebiasis happens from the parasite Entamoeba histolytica. And amoebic, no, it's not entamoebic. Entamoeba histolytica. And that parasite can carry the germ from human feces to food or water. If food is washed with it, then it can be contaminated. And boiling does not work. And chlorine does also not work. Iodine releasing tablets kill the parasite. And Amoeba histolytica. And the people have diarrhea, with blood and mucus maybe with blood and mucus, and they have abdominal cramps, and maybe a cyst at the liver which can be felt. And okay, let's look if he's safe on anything else. Sometimes no symptoms, but the disease can be still carried. We could say that even as we end, that would be quite good. And if not treated, persist indefinitely, these two things. Then not the thing with that, not. We said the thing with the cyst. We could say there is an anti-amoebic drug. Replacement of lost fluids. That's diarrhea. Maybe bed rest and that sounds too harmless. Lost fluids can be replaced because of the diarrhea, but there is anti-amoebic drug. If not, how would we try it? What did I say? How would we try it? Entamoebic. No, it's Entamoeba histolytica. How do I come entamoebic all the time? Entamoeba histolytica. What is opposite? Amoebiasis. It is from the parasite. Let's look up how it comes. Amoebiasis. It comes from the parasite Entamoeba histolytica, and it can be transmitted by a fly coming onto human faces and transport. No, I want to say also a little more. This is about a parasite disease affecting defecation in faces. Amoebiasis. Amoebiasis, it comes from the paradise, or is transmitted. No, what is it? No, it is actually the thing. It is the thing. It's transmitted by the flies, and the other thing is it. This is about a paradise, not a paradise. What is it even? Parasite. This is about a parasite disease and one which affects defecation and human faces. Amoebiasis, it is the parasite and Amoebia histolytica, and it can be transmitted by flies which are coming onto human faces and then transported to food or water. And if vegetables are washed with contaminated water, then vegetables can also have it. And boiling or chloride does not work to kill it. Iodine releasing tablets should kill the parasite. And the symptoms are diarrhea, which can have latent mucus and also abdominal cramps. And it can also spread to the liver, and then a cyst can be felt there. There are anti-amoebic drugs, and there are also people who have no symptoms but still have it, and if it's not treated, it is indefinite. And that is according to Keith Hodgkin's Family Medical Advisor, page 72, but this is no medical advice. I think we did it, so I'm going to stop the camera. And that was whatever it's all. That was for medicine part. If you're here for medicine, you can go directly to the next part of medicine. If you stay here, then you can participate in the leg intervention training, which we're going to try now. If you stay and participate in this video, then we go to standings. Go to standings stance, which is actually correct. And just bring our leg, the flex foot to the side. And the other leg. Just bring it to front, not to the side. Anti-amoebic. I think there was an anti-amoebic. Anti-amoebic histolytic. Next exercise, both foot in front and back. And the other leg, bring it in front again. And the next exercise, one leg up, breathe in, one leg to the side, again in, out into the middle, down, other leg up, breathe in, out to the side, and in, out to the middle, down. And next exercise, one leg up, arms out, and bring the arms out to the side. Those are the upper part of the body. Down for long. And on the other side. And now the arms over to one side and the leg to the other side. And change. And down, and now the same with the other leg. The leg up, and we bring the arms out, and we bring the arms to one side. Middle over. And now arms over to one side, leg over to one side. Change. Then down. And we're doing the next exercise. How old is one? The preceptor. Good standing leg with exercise, kicking out to the knee. We're turning over to the knee. We're going down. Hold to the other side. And up. And again. Good standing. Hold the leg. Down. The other side. And up, and now the same with the other leg. Good standing. Turn over to the leg. Go down. Another time. Stand good. Turn over the leg. Go down. Up. Let's do a clock. Can go again onto the knee. So this exactly what we stand good and go with the other foot always in 90 minutes intervals to always 90-minute intervals on the thigh. And to the leg. And now with the other leg. Staying good, leg front, Okay, 10, 9, and 7, and 6, and also 4, and 3. And now let's do rapid pat down to this exercise if you're pregnant. Heel onto the ground, lift the heel off the ground and place it again onto the ground. Upper foot onto the heel onto the ground and lift it, heel off the ground and place it again. And the next exercise is stem, knee up, down. And the other leg up, down, down. And we make our exercise. One hand on tummy, one lower back, and lift the leg in a straight line up with the flex foot. If the quad muscles cramp, then bring the foot up, leg up, and point with the foot down. So, bring the leg up. Flex foot, try to bring the leg higher. Control with the hands with your downfall back. And bring the leg up and point the foot down. Try to relax the leg. Again, one hand on tummy, one on lower back, and lift the leg up. Try to bring it high. Flex foot and try to bring it higher. And bring the leg up. Pull the leg up, point the foot down, and try to relax the leg. And now for horse. Leg in and out again, in. And the other leg in. And now the camel. You can do also the horse with the stem or the rest. Now the whole body comes down. And the other leg up. Back. And with another exercise, you can do the rest, the stem for horse or the camel. Or you do that exercise, you swing your whole leg back. Have a flex foot, lift the leg, stand taller with a standing leg. Try not to fall in the down. And then your leg. And ending. Next one part, breathing it down. Breathing close to the legs. Breathe again out of that force, the leg in the Regurgitating. I thank you very much. Next time. Hi and welcome. I am trying to learn medicine. Today, amputation, cholera, and Amoebiasis. So together, amputation, and also second chapter, Amoebiasis, Amyloid disease. And after we've done what we're gonna do, we're doing squat training. And if you participate in the squat training, then it's better at your house. And we're talking about internal anatomy, amputations. And this is non-medical advice, we're just treating about. Then again, this is separated. We're doing first amputation and then separate from that this amyloid disease. So amputation. The removal by a surgeon of a diseased part of a limb or organ of the body. So an organ removing is also amputation. Diseased part of a limb or organ of the body. Okay, not so much which can be taken out. An amputation is normally performed to prevent the spread of infection from diseased to healthy tissues. It would be interesting to know how it is even spreading. An infection. Or to remove a structure that cannot carry out its usual function, in order that an artificial substitute or prosthesis may be fitted. That is an interesting thought. Okay, in order that an artificial substitute or prosthesis may be fitted. Okay, we have it all together. We need all these medical terms. An amputation. We wanted to make a video about it in this film called Medical Term Amputation or something like that. And then we have all the other ones also together like that. All in one now. So amputation is the removing, by a surgeon, is the removing of a diseased limb or organ, and that is normally done to prevent spreading of an infection, or also to remove a structure that does not or cannot carry out its usual function, so that an artificial substitute or prosthesis can be placed. Okay, amputation, which is done by a surgeon. Amputation is done by a surgeon. Amputation is done by a surgeon. It is the removing of a limb or an organ, because to stop spreading, to stop enlarging, to stop spreading of an infection of a disease. Now performed to prevent the spread of infection from disease to healthy tissue. It's done to prevent the spreading of an infection from disease to healthy tissue. To stop or prevent the spreading of an infection from disease to healthy tissue. Or if there is a structure that is a key term, we're going to use one. If there is a structure that does not carry out its usual function, in order to place an artificial substitute. I'm not really familiar with the term substitute. Artificial substitute, so it doesn't mean anything to me. Artificial substitute, prophysis. To place an artificial substitute of prophysis. Let's try. I'm going to start the same camera. En eso corre. Amputation. An amputation is done by a surgeon, and it is the removing of a limb or an organ. And it is done to prevent the spreading of infection from disease to healthy tissue, or if a structure is not carrying out its function, to place an artificial substitute or prophysis. And that is according to Keith Hodgkin's Family Medical Advisor, page 72, but this is no medical advice. I'm going to stop the camera. And actually, it would have been enough for medical part. But we're having time left, and we're having here amyloid disease. Amyloid disease, a disorder in which an abnormal wax-like protein called amyloid invades the tissue of internal organs. Okay, that thing is not in the order, it's a disorder. And there comes a protein which is wax-like wax or like a candle, I think you know what I mean. And it comes for some reason into the internal organs, and it should not be there. And it's just the wax-like protein which invades and settles over there is called amyloid. The disease sometimes occurs as a complication of prolonged infections, such as tuberculosis, prolonged inflammatory illnesses, such as rheumatoid arthritis. I still get this. Is arthritis, are two different things? Rheumatoid arthritis, or certain other disorders, including Hodgkin's disease. Okay, it can come as a complication out of tuberculosis, rheumatoid arthritis, or Hodgkin's disease, or prolonged inflammatory rheumatoid arthritis or Hodgkin's disease. In other cases, amyloid disease occurs in isolation. The organs most commonly what is isolation? Do we mean it happens just without another just without being brought about by another disease? The organ most commonly affected are the spleen. I don't know what the spleen is. I think I heard it one or two times, but I have no idea what it is. The organs most commonly affected are the spleen, liver, and kidneys. Okay, the liver is here, the kidneys are here. But I don't know what the spleen is. When the disorder is secondary to some underlying illness, treatment consists of controlling that illness. In other cases, amyloid disease occurs in isolation. I don't understand the sense, but I think it means it happens without anything. We have actually 2-3 minutes left. Let's look if we are able to make it as a video as well. Amyloid disease is a disorder in which an abnormal, we don't say it is an abnormal amount, so it seems to be at all abnormal. But it will be interesting if this amyloid has used at a proper place and a proper amount, in which an abnormal wax-like protein, they don't say that it is abnormal amount, so we're going to say just the way. Maybe there are proper uses in the human body for amyloid, maybe not. Again, it's not medical advice. Okay, amyloid disease, by that wax-like protein called amyloid invades tissue of internal organs. It can come as a complication of tuberculosis, rheumatoid arthritis, or disease. And most affected are spleen, liver, kidney. Maybe you're going to say treatment consists out of controlling the disease which had brought it about. I'm going to start the camera and let's start. Amyloid disease. Amyloid disease. Amyloid is a wax-like protein which by amyloid disease invades the internal organs and stays there. And it can come as a complication out of tuberculosis, rheumatoid arthritis and Hodgkin's disease. And most affected are spleen, liver and kidneys. And if it is as a complication of these three, for example, diseases, then the treatment of these diseases is the treatment of amyloid disease. And that is according to Keith Hodgkins, Family Medical Advisor, page 72, but this is no medical advice. So if I look at one little thing I said, and it stays there. A disorder in which an abnormal wax-like protein called amyloid invades the tissue of internal organs. I didn't know it stays there for 40 years. I mean, it stays there, it is there, no, it is there. So I think I'm going to take it like that. I'm going to stop the second camera. And yes, I understand it like that. So I said it as I understand it. But it comes into the internal organ and not just comes in it and goes out again, like a hormone or whatever. Now it goes there and it stays there. It goes into it and it stays there. It's not for 3 days or 3 months or 30 years, whatever. It stays there. That's not just. Now, I said what I meant, and if not, I understood as well. Now, that was a medical. If you're here for medicine, you can go directly to the next part of medicine. We will do now the squat training. If you stay and participate in the squat training, then it's better at your own skill. And we're starting with bringing one leg up and with pointing the foot down. Move it up and down. And circle the foot. And in the other direction. And the other foot up. Point the foot up. Bring the foot up and down. And circle the foot. And now we'll try and stop. And with one leg, point the toes forward and use the chin in the leg. And do the other side. And now the mentis go side to side. And now let's do some squats. We're doing 12. So next one part, we're going down. Also the first one, then the second one, and the third one, and the fourth one, and number 5, and 6, and with 7, we have already over the half 8, and 9, 10, and the last 2, 11, and 12. And now the 6-pack squat squeeze. Next one part. We're going down into quarter squat and press against the top of the upper leg. Only on one side. And now on the other side. Go down into half squat and press club in the middle of the leg. And on the other side. And down into 3/4 squat and press close to the knee. And on the other side. And up again. And now the fastest giraffe of a water pond. Down into 3/4 squat. Press against the knee. Go towards it. Again on the other side. Press against the knee. Go towards it again. And again. And again. Last 2. And last exercise already. The propeller down into full squat. Arms to the side, over to one side. Press against the leg. Do it. The middle out to the other side. Press against the leg. Up to there. in, up, and a bit stretching to walk with. And one knee up for crane again, one foot down, other leg up, mushroom, now the crane. Take the leg as the ankle, make a straight back, point of the knee down to the ground. And the other leg. Take the leg as the ankle, make a straight back, point of the knee down to the ground. And legs wide apart, breathe in. And out. Again. And out. Breathe in, close the legs. And breathe again out. At full span. Squattraining. Thank you very much, and next time. Hi and welcome. I'm trying to learn medicine. Today, iron deficiency anemia. And after we've done that, we're going to do martial arts basic training. And if you participate in the martial arts basic training, then it's very honest. And we're talking about internal anatomy, the blood system, and disease. And this is no medical advice. I'm going to say that this time very clearly. This is no medical advice. We're just reading about it. Now, anemia, it was a couple of times mentioned, and we thought we had this, but we didn't know what it was. Now we see that this anemia part is sectioned into iron deficiency anemia, perineucleus anemia, and sickle cell anemia, and megaloblastic phosphate deficiency anemia. We haven't done anemia ever. Okay, let's read the introduction of anemia. A reduction in the quantity of oxygen-carrying hemoglobin in the blood. So the hemoglobin in the blood is transporting the air, the thing to breathe, the oxygen, and now there are not so many ones often there. So basically there are not so many trucks. So there's not so much coming to the destination place. Anemia is the most common of all the blood diseases and occurs in various forms. Iron deficiency, perineucleus, sickle disease, and megaloblastic. Okay, the different types of it. And again, this book is from the 80s. Maybe that's the fun one. It's the most common one, and there are different types of it. Symptoms are tiredness, shortness of breath, dizziness, disturbed vision, headache and insomnia, palpitation, pallor of skin, loss of appetite and indigestion, swelling of the ankles in severe cases, chest pain in older patients. Each form of anemia may have one or two additional symptoms which are specific to it. These are listed below under the relevant form. Okay, we're having a tiredness, so when people feel tired, shortness of breath, they can't breathe, they don't have that much air to breathe heavily to run it down. Dizziness, I still don't really know what dizziness means. Disturbed vision, so they can't see completely good. Headache and insomnia, so they have pain with the head and they can't sleep good. Palpitation, I still don't know what palpitation is. Pallor of skin, I don't know what that is. Loss of appetite, so they don't like to eat that much. And they have problems with digesting the food. Swelling of the ankles in the big case, so the ankles get bigger, and also chest pain in older patients, and they have pain in the chest as well. Okay, iron deficiency anemia. The most common form of anemia. It is caused by a lack of iron in the blood necessary for the production of hemoglobin. So the hemoglobin is a reduction in the quantity of oxygen-carrying hemoglobin. So hemoglobin is transporting it. And iron is necessary to produce the hemoglobin. It's like steel is missing. Iron is missing to make the steel. So steel is missing, and the body cannot build trucks to deliver the oxygen. So iron is necessary to build the things which are carrying the oxygen. The condition is aggravated by pregnancy, heavy periods, or any blood loss. Premature babies are very liable. Okay, it gets worse when people are pregnant, when people have the periods, and also if they have blood loss at all, and if babies are born too early. Then I don't know what liable means, but then it's also a problem. Symptoms: sore tongue and inflammation on the side of the mouth. So the other things with the tiredness, shortness of breath, dizziness, and so on, blurred vision, disturbed vision. I don't even know what the other thing is. So furthermore, symptoms by iron deficiency are sore tongue and inflammation of the side of the mouth. I think that's interesting. And this is an interesting symptom. Why the sore tongue? It would be interesting to know. An inflammation on the side of the mouth. Dry and brittle nails. People have dry and brittle nails if they have iron deficiency. Maybe. This is not medical advice. Maybe. Duration. The condition persists until treated. So until it is treated consistent. Causes. Loss of blood due to heavy periods or tooth extraction, for example. They will not just say it cannot be the only reason. Let's see that. So a lot of blood loss, for example, through a heavy period, and also if tooth are extracted, and there's also blood loss, I guess. Not just tooth extraction itself. But a diet deficiency in iron. So it can also be caused because people don't eat enough iron. And again, this is not medical advice. Diseases of the bowel in which absorption of iron is prevented. So if the bowel is for some type of reason not getting the iron out of food. Diseases of many chronic infections which interfere with blood formation. Many chronic infections which interfere with blood formation. What about blood formation? And why is not that the cause of iron deficiency anemia? Whatever, there can be also a problem with production of blood. But what has it to do now with iron deficiency? Diseases such as gastric ulcer, cancers, and piles, in which there is hidden blood loss. Okay, people can have an ulcer, I think in gastric tract somewhere. People can have cancer or piles, and that condition causes somewhere blood loss. And now the iron deficiency, of course. Now, I said it in the histology part. How much blood loss or how much iron could the body need to produce hemoglobin? How can it be that a body with 50, 60, 70, 80 kilograms has an iron deficiency just because of a little blood loss? This is on the total amount of the human body. How can that lead to a deficiency? Are some things in the human body so sparely, I think is the correct word, barely there, but just a little imbalance for the whole thing out of the order. And maybe the first question would be, how fast does an iron deficiency in eating lead to such things? Because then it could be trackable. How long is the, what is it called? How long could the body go basically without it? How much capacity, how much storage does the human body has for things like iron? Hours, days, weeks, because how's it all built? Several diseases of the blood in which the red blood cells are destroyed. So people can have also diseases in which the red blood cells are destroyed. And these red cells, blood cells, obviously hemoglobin things. Whatever, this is a problem. Complications, none. They say none. But I think they mean serious complications. Treatment in the home, none. But I think people can eat if it is part of the eating. When to consult the doctor? If the symptoms described develop, so if people have these symptoms, to consult the doctor. What the doctor might do? Examine the patient, so examining, take a blood sample for testing. We're taking a blood sample. If a diagnosis is confirmed, prescribe a course of iron tablets or occasionally iron injections. So iron tablets are there. How much iron is in them? And how much iron does the human body need? And why is such a little thing causing... And I have to know first how little thing, so how much the amount of iron is. And how fast it comes not to what consequences in the human body. Exactly. Not more, or not words like more or less or more likely, so exactly. With numbers, with math. And also treat any underlying cause. Well, if I find it and if we're able to treat it, then we're treating it. Prevention. Ensure that the diet contains sufficient quantities of iron. So people should make sure that the diet contains sufficient quantities of iron. And this is not medical advice. Report any excessive loss of blood to the doctor so that it can be treated before anemia develops. I don't get it. I get what is your I'm wondering about anemia. I said the amount of iron needed in the human body. How fast does what deficiency of iron lead to what? How fast blood cells produce? Report any excessive blood. Okay. During pregnancy and heavy periods, women should seek medical advice and take iron tablets conscientiously. With conscience, is that it? Conscientiously. Whatever. There are some tablets in people who are pregnant or having heavy periods, so to consider them with a doctor is not medical advice. Outlook. Excellent. Writing excellent. The condition should be cured within 6 months of treatment. 6 months of treatment. So this is how fast does not 6? Now we're talking simply about 6 months. So it's not a thing which happens after 2 days. How long is the storage of blood? Now it would make a bit sense if just the amount of blood loss of 100 milliliter, which is already quite a lot, but 100 milliliter on the whole body with 70, 80, 100 kilogram, whatever, or 60 or 50, is not much. And there's still a lot of blood away if people lose 100 milliliter. If that causes us already, it makes sense if it would need for the human body 6 months to restore blood. So, how much storage has the human body of things like iron, in case that they have blood loss or something, and why does it take 6 months to refill it? The condition should be cured within 6 months of treatment. If the underlying cause is diagnosed and treated, anemia is much less likely to recur. Okay, people can get it again if they have some underlying cause or whatever. And that wasn't treated. I'm having a lot of questions still to iron and the blood and all the thing. Not so much to anemia, actually. So that means the text was good. I understand what iron deficiency and blood is, but they have way more questions to the metabolism or whatever of our body. We will continue then something else. Now, what was the iron deficiency part of medicine? If you were here for medicine and this was no medical advice, then you can go directly to the next part of medicine. We will probably not answer these questions. I have to iron and all that. We will do it someday, wherever I find the answers to that. If you were here for medicine, you can go directly to the next part of medicine. If you're here for martial arts basic training, we're going to do the martial arts basic training. If you stay and participate in the martial arts basic training, then it's better at your own risk. Then we're starting with bringing one leg up. And you're putting the foot down. And the other leg up and point the foot down. And now the train stop, go to the side. The toes are pointing in front of the stretching the inner side of the leg. And over the other side. Another mental scarf from side to side. And now, what are we doing now? I'm thinking about the iron thing. We're doing the next thing. We're doing lunges. We're going in front and we're going back. No, the other leg in front, and knee down and back. And leg in front and back. And last time. And now the shoulders now pull. Leg up and back. Back 3 steps. So leg up and back. 1, 2, 3. And back. 1, 2, 3. Up and back. And now a frog. Up, out, and in. Up and back. Now stretch kicks. Hand out, kick against it. 2, 3 steps in the middle. Hand out, kick against it. Hand out and kick against it. And again. 1, 2 more. So, and now Crescent kicks. So, leg out and back, up and in, up and back, up and in, up and back, up and in. Okay. And the next exercise, I think actually, lunge kick. So I'm going to kick now close to the camera. In front with a knee down lunge, and then kick in front, and come back. And with the other leg, right leg in front, knee down, and kick, and back. And left leg in front, lunge down with a knee, and kick. And right leg in front, knee down, and kick. And again, left leg in front, knee down, and kick. And now squat kicks, down into squat, and kick to the side. Down, and kick. Down, and you can do wider squats. Down, and kick. And now with side kicks with swinging, bringing it up. 1, 2, 3 steps, swing and up. 1, 2, 3. Let's swing. 1. Swing. 1. Swing. And now 12 push-ups. Hands underneath the shoulders. Strong neck. Tuck the pelvis in. And go down with the elbows close to the ribcage. And this was the first one. And the second one. The third one. And the fourth one. And the number 5. And the 6. 7. And the number 8. Another number 9. And 10. And let's do 11 and 12. The last one. A bit stretching your heel onto the ground and pull the toes in. Put to the left and pull the toes in. Put to the right and pull the toes in. Into the middle. Move the leg from left to right. Our heel onto the ground, pull the toes in. Put the right, pull the toes in. Left, pull the toes in. Move the leg from left to right. And legs wide apart, breathing around. And breathe out. Breathing close the legs. And breathing out. And that was emotional basic training. Thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, pernicious anemia, and after we've done that, we're going to do leg injury prevention training. And if you participate in the leg injury prevention training, then it's better the honors. And we did this already. We had in the previous part iron deficiency anemia. Now, and there was something to it. Since we did that part, in the last part, I heard someone talking about that, and I'm taking it with a grain of salt. I have no reason to suspect that something is wrong, or overall, but I'm not really convinced. Now, the thing was that it was said in this video that in the United Kingdom, the guidelines were that people should take once a day a tablet if they have prescribed to take iron deficiency, whatever tablets. And in the United States, that the people are told to take them 3 times a day. And that it was changed in the United Kingdom down from 3 to 1. And as a reason was when explained that the human body releases, after having gotten doses of iron, some stuff, some hormone of which sounds like something like heptasis or whatever. And the human body releases it, and that then furthermore absorption of iron is because of that hormone was released, because just a dose of iron was received. So iron is then for some time not receivable after iron was taken. So iron is taken, this hormone is released from the human body, and further iron is not absorbed by the human body for, was said precisely 24 hours. I think it's oddly specific, maybe also around it's like 6 or 28 or whatever, around a day. And that is the reason when told in this video that people in the United Kingdom are advised to take a tablet once a day, because it doesn't bring anything to take a signal further. Now, I'm taking it all, I didn't say that at the beginning, we're talking about internal anatomy, blood, and this is not medical advice in any form. Now, and the idea here was written by iron deficiency anemia, that people, Simon was something said for 6 months. Outlook, excellent, the condition should be cured within 6 months of treatment. Now, this book is from the 80s, that sounded recently. If something like that was found out, that now 1 tablet per day is sufficient, but it could change something with 6 months. Maybe it doesn't change anything because it's still the same. It's still 6 months. But I think that is very interesting, and I also want to know. Okay, I have a lot of questions to it. And I don't know if that is true, and I don't know, maybe the guidelines. That would be something which someone could look up. What the guidelines are for iron tablets in the United Kingdom and the United States. I don't know, and this is not medical advice. I wanted to say a few things more to that, but I don't remember right now. Yes, we were thinking about a part of this iron deficiency. How much stores has the human body of iron? And it is interesting. If it is even true, but there's basically a stoppage, a block, an obstacle in the way, something released which stops to get more iron in a short period of time. I think that is something interesting. And I want to know way more. This is not really part of medicine, but I want to know way more about how it works with iron. If it's actually, but after people have gotten air doses, now what is the dose? Does it have to be that high? That high? What if you waste basically your dose? Imagine you take just one dose, one little form of iron is then released, and that those supposed to load. Imagine that is because of people. This is also speculating. This is not anything right. Imagine people taking a low doses of iron, and when the hormone is released, I don't even know if that hormone exists, and that is why we have an iron deficiency, because the first doses was too low. So how high has to be the doses to effectively release the hormones if it even exists? And why is it released? Can the human body get too fast iron? Could it be when something we made out of stopping that hormone to be released? So basically, I just wanted to give you a little, what is it called, a little catch-up, or what is it called? But I heard something new to that thing, since we had the first part of iron deficiency. Now, pernicious anemia. A form of anemia which develops when the bone marrow lacks vitamin B12 or other substances needed for the proper formation of blood. So anemia is the too little amount of the hemoglobin in the blood. And by iron deficiency, it was too little iron there, so that the production could not be done of hemoglobin. And now we're having that vitamin 12 is missing, or other substances to form it. Yes, because this is about anemia. Anemia has too little hemoglobin. It can be caused in most common times out of iron deficiency, but also something else like vitamin B12 can be missing to make the hemoglobin. This is not about iron deficiency, but this is about anemia, so missing of hemoglobin. And again, this is not medical advice. The condition is common in people with blood group A than in those with blood group, I think it's 0. People have different blood groups, and it's more common in people who have A than in people who have 0. Symptoms. The tongue is sore, smooth, and inflamed in places. I'm talking about no medical things. So, medical symptoms. People have persistent diarrhea and tingling in the fingers and toes. In severe cases, the facial skin may assume a lemon yellow tint. Duration. The condition persists until treated. Let's go to what is it again? So the symptoms are to having a sore, smooth, and inflamed tongue at some places. How does it? What is it from combination? So smooth and inflamed. People have persistent diarrhea, so they have problems, and it's tingling in the fingers and toes also, and also a lemon yellow coloring of the face maybe. Duration, persistence until treated. Causes. Failure of the stomach to produce an enzyme, the intrinsic factor, I don't know what intrinsic means, intrinsic factor, which is needed for the absorption of vitamin B12. Oh, that is interesting. So here's the problem, not that vitamin B12 is not there, the problem is that now the stomach cannot get the vitamin B12 out of the food, so that whoever is doing the blood cells cannot do the blood cells. So the problem is not even that the vitamin B12 is not eaten, the problem is that it's not absorbed. This failure results from autoimmunity, certain drugs, or follows removal of the stomach. And that has been called gastrectomy. People can have a stomach removed. This failure results from autoimmunity. I don't know what that means. Certain drugs and also a removal of the stomach. Complications. With early treatment, these are few. They may include heart failure, degeneration of the spinal cord, and cancer of the stomach. Okay, so complications of having pernicious anemia, and that is that the human body cannot get the vitamin B12 out of the food, so it cannot produce the hemoglobin, the oxygen-carrying blood cells, and that can then cause, and I don't understand why, in heart failure, degeneration of the spinal cord, and cancer of the stomach. But the symptoms are tongue is sore, smooth and inflamed, persistent diarrhea, tingling in fingers and toes, and lemon yellow. Why is it completely different symptoms when we're having a symptoms of iron deficiency anemia, sore tongue and inflammation, dry, brittle nails? It's both anemia. Why is it so different? Okay, the complications can be the failure of the heart and also degeneration of the spinal cord, so of nerves basically inside of the spine, and cancer of the stomach. Treatment in the home, none all the time. When to consult the doctor? Immediately the symptoms described develop. So if people have a sore, smooth and inflamed tongue, persistent diarrhea, tingling in fingers and toes, and in severe cases, the facial skin may assume a lemon yellow tint. This is no medical advice. And then also, what to document to? Take a blood sample for testing. We're taking blood and testing it. We refer the patient to hospital for further examination. We're examining even more, and which may include testing the stomach or a sample of bone marrow. How does it look to take a test of bone marrow? If the diagnosis is confirmed, prescribe a course of vitamin B12 injections. So injections don't work. It is the stomach who can't absorb it, but the human body still needs it. And the human body also can use it. It just cannot absorb it. And how does that problem happen? Why can it be that the stomach can do everything full fine, and just this one particular thing, B12, can it not? Or is it that there are also then other things? It would be interesting if people have vitamin B12 from an absorption problem, if they also have problems to absorb other things. And if not, it would be even more strange, as if they could also not take other things. Why could it happen that the stomach cannot absorb the vitamin B12, but the human body needs it and can use it? If they get it through injections, it all works. So the people can get vitamin B12 injections. Prevention. The only types of pernicious anemia which can be prevented are those which have an underlying cause, such as gastrectomy or prolonged treatment with an anti-epileptic drug. Okay, people have for some reason the necessity to take an anti-epileptic drug, or people have also something called gastrectomy. And if that is cured, then it could be cured like that. If not, then there has to be the vitamin B12 injections. And again, there's no medical advice in this book from the 80s. Outlook, good. After the initial course of treatment, injections must be given indefinitely to stop recurrence. Okay, as long as treated, it looks good. Do basic. Now, that was the medicine part. If you will give medicine, you can go directly to the next part of medicine. And we will do now the leg injury prevention training. If you stay and participate in the leg injury prevention training, that is that you always go to a stable standing stance and just bring your leg in front to the side. And the other leg swing to the side. It would be good to know what the word panikios means. I heard it a couple of times already. And the other leg in front and back. Other leg in front and back. And now lift one leg up, breathe in, pine pill crow, and breathe out, leg to the side, again in, and to the middle, and down, other leg up, out, again in, out in the middle, and down, and leg up, breathe in, no, we're not doing that another time, leg up, hands out, and go over to the side with the hands, and don't roll over, go over to the side with the hands, and to the other side with the hands, to the middle, and now legs over to one side and hands over to one side. And change. Then a little bit down. Other leg up. Hands over to one side. Over to the other side. And now one leg up and press with your knee up to the side. Up to the side. Other leg up, press with your knee up to the side. And next exercise, it's the bycatcher, not the proceptor. We're standing go to one leg. This exercise can go onto the knee. Turn over to the knee. Go down. Over to the other side. And up. And again, stand good. Turn over. Go down. Over. And up. And other leg. Stand good. Turn over. Go down. To the other side. And up. And again, stand good. Turn over. Down, over, and up. And now the clock. This exercise can go again on the stand good. And I'll go always in 90-minute intervals to the sides with the leg. And go always with the knee a bit down. And now the same thing with the other leg. Start front, the other side. It's 9 o'clock and 7:30 and 6 and 4:30 and 3. And now the pipette. Don't do this exercise if you're pregnant. Stand good with the leg upper heel onto the ground, lift the heel off the ground and place it again on the ground. Have a heel onto the ground and lift the heel off the ground and place it again on the ground. And we stamp the leg in and down, in and down. Other leg and down. Another horse, another leg in. And with the other leg in and out. And you can do now the horse again, or you do the camel, where the whole body goes down. And the other leg in and back. And we're ending legs wide apart, breathing out on. And breathing out. Again. Out. Again, in close the legs. And breathe again out. That was the leg intervention training. I thank you very much, and at the next time. Hi and welcome. I am trying to learn medicine. Today, androgens, and afterwards we're going to do anencephaly. And after we've done what we're going to do, squat training. And if you participate in the squat training, then it's very on risk. And we're talking about internal anatomy, hormones, and this is no medical advice. We're just reading about it. Androgens. Male sex hormones whose function is to produce secondary sexual characteristics after puberty. For example, facial hair and a deep voice. Okay, androgens. It is a hormone and it's gender specific and it produces the secondary sexual characteristics after the puberty of facial hair and the deeper voice. Most androgens, including the principal one, testosterone, are produced in the testicles. Okay, we're talking a bit about this stuff. Others are formed in the adrenal glands. I forgot again where we were. And produced in the testicles. Others are formed in the adrenal glands on top of the kidneys. Where is it? Okay, the adrenal glands are on top of the kidneys. And the androgens, that seems to be multiple. So the androgens, there are multiple androgens, and one of these androgens, and the principal one, is the testosterone. And they are produced in the testicles. Others are formed in the... So most androgens, including the principal one, testosterone, are produced in the testicles. And there are other androgens, which are androgen hormones, which are produced in the adrenal glands. And they are above the kidneys. And they are here. So. Small amounts of androgens are also produced in women's ovaries and adrenal glands. When production is excessive, it causes virilism. In men or in women or in both. It causes virilism. If a sexual development of an adolescent boy is retarded, I still don't know what an adolescent is. So if his sexual development of an adolescent boy is retarded, he may be given injections of natural or synthetic androgens. Okay, if the adolescent doesn't set in, can you say that? If the sexual development of an adolescent boy is retarded, if the development of an adolescent boy is retarded, then an injection of natural or synthetic androgens can be given. These are also used to treat breast cancer in women. Okay, androgens. We have androgens. Androgens are important to produce the secondary sexual characteristics after the puberty. For example, facial hair and deep voice. That is the first thing we're going to say. Most of the androgens, including the principal one, or most important, the principal one, testosterone, are produced in the testicles. Other androgen hormones are produced in the adrenal glands. Small amounts of androgens are also produced in the ovaries and the adrenal glands of women. And when the production is excessive, it's called virilism. Virilism. If the development of an adolescent boy is retarded, then natural or synthetic androgen injections can be given. Androgens. And these these injections can be also used to treat the breast cancer in women. But you think of also been a breast cancer in men. But it doesn't have to be shown. I don't know if this is not medical advice. I don't know if it's not even the opposite. No, better androgens. So now I try to make it a video and say what we have today. So I'm starting, I think. Yeah? And now I try to say it. Androgens. Let's just start it if something is missing, we're going to do it again. Androgens. Androgens are important to make the secondary characteristics. That is the secondary characteristics. Androgens are important to make the secondary sexual characteristics of a boy after puberty. Androgens are important to make the secondary sexual characteristics of a boy after puberty, facial hair and a deeper voice. And they are produced, these androgens, in most. Let's start actually with most. Androgens are important for the development of secondary sexual characteristics of boys after puberty, facial hair and deeper voice. And most of the what are we talking about? Androgens are important to develop the secondary sexual characteristics of boys after puberty, facial hair and deeper voice. Most of the androgens, including the principal one, testosterone, are produced in the testicles. Other androgens are produced in the adrenal glands. Women produce also in the adrenal glands and the ovary androgens, and an overproduction of androgens is called virilism. And if let's make it a bit more clear. Is this virilism? It is virilism. Now your thing was, if the sexual development of an adolescent boy is retarded, it's hard to express. It also has to be pretty detailed expressed. Androgens are important to make the secondary sexual characteristics of boys after puberty, facial hair and a deeper voice. Most of the androgens, including the principal one, testosterone, are produced in the testicles. Other androgens are produced in the adrenal glands. Women also produce, in smaller amounts, androgens in the ovary and in the adrenal glands. An overproduction is called virilism of androgens. Androgens are important for the development of a sexual. I knew I would make it once wrong if I talk this fast. Androgens are important for the development of secondary sexual characteristics of boys after puberty, facial hair and a deeper voice. And most of the I can't get it of the androgens. Forget the time. Androgens are important for the development of secondary sexual characteristics of boys after puberty, facial hair and a deeper voice. Most of the androgens are produced in the testicles, including the principal one, testosterone, but others also produce in the adrenal glands. Women also produce in a smaller amount androgens in the ovary and in the adrenal glands, and an overproduction of I can't get it. Androgens. Androgens are important for the development of sex. Androgens are important for the development of secondary sexual characteristic of boys after puberty, including, for example, facial hair and a deeper voice. Most of the androgens are produced in the testicles, including the principal one, testosterone. Others are produced in the adrenal glands. Women also produce androgens in a small amount in the ovary and in the adrenal glands. An overproduction is called virilism. If the development of secondary sexual characteristics of boys in adolescence is retarded, then natural and synthetic androgens can be injected. And these injections of natural synthetic Androgens can also be used to treat the breast cancer and more. And that is according to Keith Hodgkin's Family Medical Advisor, page 74, but this is no medical advice. Where we have, I'm going to stop the camera. And now we have something else here. Anencephaly, a rare abnormality in which the major part of the brain of a fetus fails to develop. Okay, anencephaly, in which the major part, the brain in which the major part of the brain of a fetus fails to develop. Anencephaly. The bones of the back of the head are also partly or completely missing. The bones of the back of the head are also partly or completely missing. Okay, anencephaly, major part of the brain is not developing of the fetus, and also the bones at the skull, the bones at the back of the skull are not there. Death occurs at birth. The abnormality tends to run in families. A pregnant woman from such a family can have early tests carried out on the fetus, and if these indicate anencephaly, she can have a pregnancy terminated. And I want to stress at that point again, this book is from the 80s, so also the thing here previously it can be used to treat breast cancer in women. Maybe there's also more known to treat it also in men, and also anencephaly, maybe there's also more known to men. And the book is from Britain, so maybe there are differences in different countries. Anencephaly, are we able to do a video? This is pretty short. We're doing squat training. It'll take me here for a minute. Anencephaly, major part of the brain is missing of a fetus and also the bones at the back of the skull. Death occurs when at birth, but maybe the information is outdated. Death occurs at birth. The abnormality tends to run in families. We're going to say that then. The abnormality tends to run in families. Okay, anencephaly, major part of the brain fails to develop, and bones at the skull at the back are missing. Death occurs at birth, and abnormality tends to run in families. I'm going to start the camera again. Anencephaly. I want to say a little warning. This is about a fatal condition during pregnancy. Anencephaly. By anencephaly, the major part of the brain of a fetus is not developing, and also the bones at the back of the skull are missing. Therefore occurs at birth, and it tends to run in families. That is according to Keith Hodgkin's Family Medical Advisor, page 74, but this is no medical advice. I'm going to stop the camera. And now, that was for medicine. If you were here for medicine, you can go directly to the next part of medicine. If you stay here, we have 3 minutes left for squat training. If you participate in the squat training, then it's very ask. Leg up, point with the foot down. Pull the leg up, point with the toes down, and relax the leg, and circle the foot. Foot and legs. And other leg up. Pull the leg up, point with the toes down, and relax the leg. Circle the foot. Other direction. Legs wide apart. Go to the side. Toes pointing forward, stitching in the side of the leg. And over to the other side. And then from side to side, mentis. And now a few squats. Legs wide apart, and we're doing 12. So come on. 1 and 2 and 3 and 4 and 5 and 1 more. And now we're having the half of 6 and 7 and 8. And let's do the last quarter. 9, 10 and 11 and 12. It was not a quarter. Next exercise. Legs wide apart, we're doing the 6-pack squat squeeze. Down into quarter squat, press at the top of the leg. And press on the outside. And half squat and press on the middle of the leg. And on the other side. 3/4 squat and press close to the knee. And on the other side. And directly on to the next exercise. 3/4 squat, press against the leg. Go towards it on the other side. Press against the leg. Go towards it again. Press against the leg. Go towards it. Press again. And leg at last exercise with propeller. Full squat, arms to the side, over to one side. Press against the leg. Look up to it. And to the middle, to the other side. Press against the leg. Look up to it. Middle and up. Now it's stretching. Heel onto the ground, pull the toes in. Behind a sit-up stretch. Foot to the left, pull the toes in. To the right, pull the toes in. Into the middle, move the leg from left to right. Upper leg with the heel onto the ground, pull the toes in. Foot to the right, pull the toes in. To the left, pull the toes in. To the middle, and move the leg from left to right. And again, no, we don't need to. Take the leg as the ankle, make a straight leg, and point with the knee onto the ground. And other leg, take the leg at the ankle, make a straight back, point with the knee onto the ground. The legs wide apart, breathing down, and again out. Last round, breathe in, out, breathing across the legs, and breathing out. Now, let's pause for squat training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, sickle cell anemia and megaloblastic anemia. And after we've done that, we're going to do a bit standing yoga. And if you participate in the standing yoga, then it's very down. And we're talking about the blood system and internal anatomy. And this is no medical advice, we're just reading about. Sickle cell anemia, an inherited condition found almost exclusively in black people with black skin. Symptoms start in childhood. Both sexes are affected equally. Okay, sickle cell anemia. That is a form of anemia. So anemia is a reduction in the quantity of the hemoglobins, which are carrying the oxygen in the blood. And sickle cell anemia, that is something which almost exclusively people with black skin have. And the symptoms start in childhood. Symptoms: slight yellow discoloration of the skin and eyeballs. So there's a slightly yellow discoloration of the skin and the eyeballs. Feverishness, weakness, and anemia, especially after strenuous physical exercise. But what is it? It's not the anemia. By sickle cell anemia happens after physical exercise. I haven't thought about anemia that way. But people can have it, but the real anemia happens when the hemoglobins are necessary, are needed. Feverishness, weakness, and anemia, especially after strenuous physical exercise. Okay, anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. How fast does anemia not happen? I ask it here with iron deficiency anemia. There wasn't written here. The condition should be cured within 6 months of treatment. Now this with the breathing sounds again like something happening within seconds or minutes. Anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. This is sickle cell anemia, it is completely different. Blood clots may occur anywhere in the body. Okay, blood clots. Okay. Duration. The condition is chronic, persisting throughout a patient's life. Okay, persists, causes an abnormal hemoglobin presence in what? Anemia, a reduction in the quantity of oxygen-carrying hemoglobin in the blood. So, sickle cell anemia, an abnormal hemoglobin present in the blood. Hemoglobin is the red pigment in the blood which carries oxygen from the lungs to the tissues. Okay. If, because of exertion or respiratory infection, the amount of oxygen in the blood is reduced, the abnormal hemoglobin causes the blood cells to deform into a sickle shape. Okay, the hemoglobin is there, but it isn't working properly. So, if because of exertion or heavy breathing, respiratory infection of a flu or whatever, common cold, of a respiratory infection, the amount of oxygen in the blood is reduced. Okay, people have less oxygen because they're doing sport or they're having an infection. And when the abnormal hemoglobin causes the blood cells to deform into a sickle shape. Okay, there's something wrong with the hemoglobin. This is about sickle cell anemia, but has nothing to do with iron deficiency. Anemia, we have to understand it. Anemia is a condition in which the quantity of oxygen carrying hemoglobin is reduced. It has nothing to do with iron in the first place. Just the hemoglobin is in its quantity reduced. That can be because the hemoglobin is not produced because iron is missing. That can be because vitamin B12 by peritoneous anemia is missing to produce the hemoglobin. It can be because the hemoglobins are abnormally, and if there is too less oxygen, they are deforming and getting sickle shaped. So the sickle is used to cut grass. And getting sickle shaped instead of more flat or round or something, and they're deformed, they're changing the form. So it has nothing to do with iron, it is just too little hemoglobin. It can be by iron deficiency because of too little iron to produce it. It can be by perinicius because vitamin B12 is missing, because the stomach isn't taking it from the food. It's not eaten, the stomach isn't taking it. And sickle cell, they are not properly. They are deforming into sickles. These cells are then destroyed by the body's immune system, causing anemia. And they are deforming it, and then the body says you are sickle, and we don't want you, and then they destroy the sickle anemia. The sickle hemoglobin. And now we're to the hemoglobin. Complications. Ulcers and local infections may occur in bones, kidneys, and other organs. Okay, people can get ulcers and also local infections in the bones, in the kidneys, and other organs. Okay, ulcers and local infections in different places, and the organs, bones, and kidneys. Treatment in the home, none. When to consult a doctor? If any symptoms of the illness are noticed. Symptoms were slight yellow discoloration of the skin and eyeballs, feverish weakness and anemia, especially after strenuous physical exercise. Anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. Anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. Blood clots may occur anywhere in the body. Okay. So basically the two main symptoms were feverish weakness, anemia after sport, or heavy breathing, and also slight discoloration of the skin and the eyeballs into yellow. What the doctor might do: take blood tests to find out whether abnormalities are present. Okay, we take blood tests, arrange for the patient to have regular blood transfusions if sickle cell anemia is diagnosed. This is the only form of treatment available. This book's from the 80s, so maybe there was something done. But they are saying over here, blood transfusions, people getting new blood. And this is the only form of treatment available. Prevention. There is no way of preventing the disease, but avoiding strenuous physical activity may reduce the risk of severe crisis. So basically the people are unable to do sport. And they get a problem if they have respiratory infections. In that case, I actually want to have a real case. Interview, instead of just a book, theoretically. Outlook. Complications arising from the anemia may result in death at any age, but many sufferers survive beyond middle age. That means if it gets really worse, the people actually die. Megaloblastic anemia. A form of anemia similar to pernicious anemia. It develops if a diet is deficient in folic acid, which is present in liver and vegetables. Okay, the people don't eat enough of some type of folic acid since they are in liver and in some vegetables. Pregnant women and the elderly are particularly vulnerable. You would like to know why? Because this is about food. The other thing was iron deficiency anemia. That can be because during pregnancy or heavy periods and any blood loss at all. Now, why no megaloblastic anemia, where it is not enough eaten of this folic acid? Why is that now with pregnancy? And also with people who have aged longer. The symptoms are similar to those of pernicious anemia. The symptoms were The tongue is sore, smooth and inflamed in places, persistent diarrhea, tingling in the fingers and toes. In the case of the facial skin, I assume lemon yellow tint. That means some people can have these problems when they're pregnant because of megaloblastic anemia, because they're not eating enough folic acid. Let's look what I write how it can be prevented. The symptoms are similar to those of pernicious anemia. The treatment is to give folic acid tablets. Is it also possible to eat then liver or vegetables right away? If the diet is deficient, we're not saying there's a problem with absorption as it was here by pernicious anemia, failure of the stomach to produce an enzyme, the intrinsic factor which is needed for the absorption of vitamin B12 from food. So we cannot get it from the food because we're not producing an enzyme necessary to get it from the food. And also the treatment. If the diagnosis is confirmed, prescribe a course of vitamin B12 injections. So here's saying if the people are not producing the enzyme to get with it to absorb with it the vitamin B12 out of the food, they are getting the vitamin B12, not the enzyme. I think this was at least something interesting to point out that that's true. So megaloblastic, there is enough folic acid probably eaten, but it's not enough eaten. And it's taken out, but it's probably not enough eaten. And we're saying again, folic acid is my question, is it also possible to eat more vegetables? This is why such tablets are given often as a preventive to those who may be at risk. And who would be at risk? Elderly and pregnant women? Or anything else? The problem is deficiency in folic acid. If a diet is deficient in folic acid. Okay, I think this is a bit shortened down here to megaloblastic anemia. Whatever, it is still a problem that there is not enough folic acid eaten. And this is in particular been a problem, or it happens particularly by people who are pregnant or who are already aged. And that's it. Okay, that was megaloblastic. Is it megaloblastic? Megaloblastic and sickle cell anemia. If you were here for anemia, you can go directly to the next part of medicine. So if you were here for medicine, this was no medical advice. Again, this was no medical advice. We just read about it and speculated about it. If you were here for medicine, you can go directly to the next part of medicine. We will do now the same yoga. If you stay and participate in the short yoga, that's where the arms are doing a bit power yoga. They are standing. If you participate, that's where the arms. The feet are standing together, we will the arms up. Go on down. In and up. Go on down. In and up. Out to the side. Up. Out to the other side. Up. Inch space between the feet and out to the side. In and up. Out and down. In and up. Out to the side. In and up. In and out and down. In and up. Arms down, we're leaning onto the knees. Breathing in. And out, make a head with the back. In into the middle. Out around back. In into the middle. Out around back. In into the middle. Out around back. In into the middle. Out, come around back up. Make it to the backward shoulder. Breathe in with the arms up. Out up to the side. In and up. Out up to the other side. In and up. Out over the sides down. Breathing, come up there. Come higher. And out and come up again. Breathe in. And out again down. Breathing, come up and down. Up. Higher. And out and up. Come out onto the toes. And breathe out and sink slowly down. This can go a bit under the knees. And come out. Out and down. Again up. Out with the hands down, feet together, and lid down. Breathe in with the right leg. Breathe out, stretch the left leg. Breathe in, change. Out and stretch the right leg. In and change. Out and stretch the left leg. In and change. Out and stretch the right leg. In into the middle. Out and down. Breathe in, lift the right hand up to the sky. Breathe out, bend the left knee and look over the right shoulder to the right hand. Breathe in the hand down. Out and down. Breathe in, lift the left hand up to the sky. Breathe out, bend the right knee and look over the left shoulder to the left hand. In and down. Down and down. Make a head of space between the feet, shift the weight to the heels, breathe in and get up. And out and up. In and down. Out and up. Take out on the elbows and gently rock from side to side. Down with hands, feet together. Breathe and come halfway up with a straight back. Out and down. In halfway up. Out and down. Breathe in. And out and come. And the torso pointing to the outside. Tall up, under the space between the heels. Breathe in. Out, chin down onto the chest. Taking the round slowly down. One vertebra at a time. Slowly down to the round. Elbows against the inside of the knees. Breathe in straight. And out, tuck the pelvis in and come with the crown of the head first up. And hands down. Have the feet sink together. Breathe in, lift the arms up. Over across the arms. Breathe in, reach high. And out, reach in front of the back. In and up. Over across the abdomen and around. Breathe in, reach high. Out, reach in front of the back. In and up. Out, lean back with long arms. In and up. Out, lean back. In and up. Out, hands down. In and up. Out and down. In and up. Let my hands together and bring them down to heart center. It was a fast and shortened senior. I thank you very much and next time. Hi and welcome. I'm trying to learn medicine. Today, iron deficiency anemia, and after we've done that, we're gonna do stretching. And if you participate in the stretching, then it's better if you hold this. This is part 2 of the iron deficiency anemia, and in the other parts we did the other ones here with pernicious anemia, sickle cell anemia, and megaloblastic anemia. We're talking about internal anatomy, the blood system, diseases, and this is no medical advice, we're just reading. Now, in this part, we want to make a presentation about the iron deficiency anemia. Let's read the thing with the overall description of anemia again. A reduction in the quantity of oxygen carrying hemoglobin in the blood. So anemia is that the hemoglobin which is carrying the oxygen for the body, but there are not so much of it. There are not enough functioning hemoglobin, whatever it even says, hemoglobin and whatever in the blood. We had here just this little thing, the part by sickle cell anemia, they were worthy, but they were then, because they were abnormal, they were then deformed into a shape of a sickle, if the people were in the need of much oxygen. And when the immune system was attacking the hemoglobin because it had the wrong form and then destroying them, and then to less hemoglobin cells were there. Okay, anemia to little hemoglobin cells who would carry the oxygen. Anemia is the most common of all the blood diseases and occurs in various forms. Iron deficiency, pernicious, sickle cell, and megaloblastic. And again, now, even as I said when we read the introduction to anemia, as now after we did all 4 singularly or individually, it sounds to me as if there would be a 5th, 6th, 7th, 8th, 10th one. Just not here listed or not found yet. Symptoms. Tiredness. I mean, just saying that more or less just for completed. I believe that what is written here is not. This is not a full picture, so I want to say what I believe is a full picture. That's basically why I say it. Tiredness. Symptoms. Tiredness, shortness of breath, dizziness, disturbed vision, headache and insomnia, palpitation. Still don't know what palpitation is. Pallor of skin, loss of appetite and indigestion. Swelling of ankles in severe cases, chest pain in older patients. Each form of anemia may have 1 or 2 additional symptoms. So iron deficiency anemia. The most common form of anemia, it is caused by a lack of iron in the blood necessary for the production of hemoglobin. Okay, iron deficiency anemia, there's too little iron in the body, as in blood in the body. Too little iron in the body which is necessary to produce the hemoglobin, which would carry oxygen. The condition is aggravated by pregnancy, heavy periods, or any blood loss. Premature babies are very liable. And the iron deficiency anemia gets worse if the people get pregnant, have heavy periods, or otherwise blood loss. Okay, recent version I think we have them so far. Let's go on. Symptoms: sore tongue and inflammation on the side of the mouth. We're gonna add them so, and dry and brittle nails. We're gonna say, what do we say to the symptoms? Maybe we keep the symptoms short. Now, I noticed already a part of this medicine series that we're talking about the symptoms of iron deficiency anemia. These are not the symptoms of iron deficiency. These are the symptoms of iron deficiency anemia. So if we would list now the symptoms, maybe some people understand it as the symptoms of iron deficiency. I would say these symptoms here listed are so grave, or so big, so dire, that I would say these are more symptoms of anemia. But again, this is not medical advice, just what I read here. It seems to me that these are the symptoms of anemia, not of iron deficiency. Iron deficiency can cause anemia, but... So I'm right now thinking, how much do we try to save from these iron deficiency anemia symptoms? Most of them. The symptoms of the iron deficiency anemia are a sore tongue and inflammation on the side of the mouth. Sore tongue, inflammation on the side of the mouth, and dry and brittle nails. And then furthermore, tiredness, shortness of breath, dizziness, disturbed vision, headache and insomnia, insomnia. Headache and insomnia, palpitation, pallor of skin, loss of appetite and indigestion, swelling of the ankles in severe cases, chest pain in older patients. These are a lot of things to remember. Sore tongue, inflammation of the side of the mouth, dry and brittle nails, tiredness, shortness of breath, dizziness, disturbed vision, so far so good. Headache and insomnia, palpitation, pallor. I don't know what pallor means. Headache and insomnia, palpitation, pallor of skin, loss of appetite, indigestion. Pallor of skin, loss of appetite, indigestion. Is it really necessary to say them all? These are so many symptoms. They could mean. Let's go back to symptoms later. Causes: loss of blood due to heavy periods or tooth extraction, for example. Okay, it gets worse through pregnancy, heavy periods, or any other type of blood loss. For example, also tooth extraction. So we're going to say that. A diet deficiency in iron, and also it can be caused other than heavy blood loss through deficiency in iron, iron intake, iron in the food, diseases of the bowel in which absorption of iron is prevented. But it can be also biologically that the bowel, I don't really know what the bowel is, it's somewhere in the part of the gastrointestinal tract, one part of it, doesn't absorb the iron. Many chronic infections which interfere with blood formation, and there are also, no, I don't get that part. Many chronic infections which interfere with blood formation. If there are other, they say that, but why is there no iron deficiency if it's caused through infections? So we're just going to take the thing apart. If you would say it, it would be, there are also chronic infections which interfere with the blood formation. Diseases such as gastric ulcer, cancers, and fleas in which there is hidden blood loss. And the blood loss can be also hidden, so not noticed, through a gastric ulcer, cancer, or plies. Can be also hidden through gastric ulcer, cancer, and plies. We're not going to be able to do it in this video. And plies. And it can be also part of rheumatoid arthritis and myxoedema. Rheumatoid arthritis and myxoedema. No, it creates a lot to name, but it's so far so good. Let's go to the symptoms in a moment. We have a dry and brittle nails and the sore tongue and the inflammation of the sides of the mouth. Then we had dizziness and headache and palpitation just palpitation. We had pallor of skin and insomnia, and then we had also chest pain in older people and disturbed vision. Loss of appetite, indigestion, swelling of the ankles in severe cases. Shortness of breath, tiredness, and insomnia. Complications, none. Really none? What I mean with complications, as we say with other things, with complications, would we say to Peritoneous anemia, the way say complications are heart failure, degeneration of the spinal cord, and cancer of the stomach. So, I mean, direct consequences of it. Treatment in the home then. If the symptoms are, consult a doctor, examine the patient, take a blood sample if the diagnosis is confirmed, prescribe a course of iron tablets or occasionally iron indigestions. There are for treatment iron tablets, we could say that. Okay. How to prevent it? Ensure that the diet has sufficient quantities of iron. Report any excessive loss of blood to the doctor so that it can be treated before anemia develops. During pregnancy and heavy periods, women should seek medical advice and take iron tablets conscientiously. I don't know what the word is. Is it consequently, or is it consciously, or is it conscientiously? Whatever. Maybe you're going to say actually these two things. A part of sufficient quantities of iron in the diet. If there's heavy blood loss, maybe a doctor should be consulted to prevent anemia from developing, and also by pregnancy or heavy periods. So that the treatment could be done, which would be in the form of iron tablets or injection. Outlook. Excellent. The condition should be cured within 6 months of treatment. You're going to stay away from it. The book is from the 80s, so maybe there's something changed. Within 6 months of treatment, there are certainly people who are able to get iron faster. I don't know. But maybe it's about the production of the hemoglobin, not about the amount of iron in the body. So there are multiple things which we have to consider if you want to explain why 6 months are may or may not sufficient. If the underlying cause is diagnosed and treated, anemia is much less likely to recur. We're going to stay a bit away from it. Now, we don't have time to do it. We have just 5 minutes. That's barely enough for stretching. We're going to do another part, and we're going to do the presentation. Let's go for one moment to the symptoms, but I don't really know if it's really helpful. The dry and brittle nail, and the sore tongue, and inflammation at the sides of the mouth, and the dizziness, and the disturbed vision, and the palpitation, and the pallor of the skin, and in severe cases swollen ankles, and chest pain in elderly people, and then also the insomnia, and the tiredness, and the shortness of breath. I think I have most of them. I'm missing one or two. Loss of appetite and indigestion. Now, it was the medical part. If you were here for medicine, you could go directly to the medicine part, where we will try to make a presentation, basically say most of the information which we have in the book, normal one. If you stay here and participate in the stretching, that is at your own risk. The legs are standing around a bit more in front of the body, and we're breathing in the outside. And breathe out on the other side. Breathing in, out of the other side. In and out. Out and down. Now breathe again in. And out, one hand slides down the leg, and the other shoulder stays down. Breathe again in. And out, one arm over. Breathe in and down the rib cage. And out, back into the middle. Breathe again in. And out, one hand slides down the leg. Breathe again in. Out, one arm over. Breathe again in and out the rib cage. Out into the middle. Now the feet staying together. And breathe in, lift the arms up. And breathe out, one hand down. Breathe in and reach. Breathe out. Again in. Out, one hand down. Breathe in and reach. And out the arm up and both down. Now have your legs standing shoulders wide apart and do shoulder circles. And we go back, up, front, down, back and back, up, front and down, and not backwards. Front, up, back, down, and front, up, back and down. And now breathe in and lift the shoulders up. Breathe out and out, out. Again in. And out. Again in. And out. Now breathe in and lift the arms up. And reach all this with one hand high up and pretend to take an apple hanging high on an apple branch. So turn it a bit around and vent it a bit out. And now onto the shifter. Legs wide apart, arms to the sides, breathe in. And now shift over to one side, just with the upper part of the body. Again in. And out over to the other side. Again in. And out, we're leaning onto the knees. Breathe again in. And out one shoulder in front. In back. And out the other one in front. In the back. Out in front. In back. Out in front. Again in. And out into the hanging down. Breathe in. And out. Again in. And out over the leg. Breathe in. Out over the other leg. Again in. Out into the middle. Close the front. But keep on hanging down. Breathe in. And out. Again in. And out comes slowly enough and out back. Back up to the backward shoulder. Have a leg standing out, shoulder wide apart, a bit more. And breathe in and go down. And breathe again out. Again in. Out. And breathe in, close the legs. And breathe again out. That was Wristtraining. Thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, iron deficiency anemia, and after we've done it, we're gonna do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And this is no medical advice. We're just reading about it and talking about the blood system, internal anatomy, diseases, and this is part 3. And no medical advice, we're just reading. Iron deficiency anemia, and we want to prepare our presentation now about iron deficiency anemia. Okay, we want to say first, iron deficiency anemia is anemia caused through too little iron in the body. Iron is necessary to form the hemoglobin, to form or to produce the hemoglobin. By anemia, there are too little hemoglobin in the blood and they are carrying the oxygen. And the symptoms of anemia are then tiredness, shortness of breath, palpitation, indigestion, loss of appetite, chest pain in older patients, and swelling of the ankles in severe cases. Furthermore, headache and insomnia, pain of skin. Okay, if one or two we see. Okay, and then we're going to talk on and if it is the iron deficiency anemia, and if the anemia is caused through iron deficiency, then another symptoms is a sore tongue and inflammation at the sides of the mouth, on the side of the mouth, and also dry and brittle nail. Okay, when you're going on, what it gets worse. If you're going to start to review that, it gets worse through. It gets aggravated. Let's start to use the word aggravated. It gets aggravated. I actually don't really know what it means. Aggravated. I'm pretty sure it means it gets worse, or it means it gets strong. But I don't really want to use the word if it is hard to understand. It gets aggravated. It gets stronger through pregnancy, heavy periods, or heavy blood loss overall. It can be also caused through an underlying condition like cancer, or what was it? Cancers, plies, and gastric ulcers. Gastric ulcers and plies, whatever it is. Plies, cancer, gastric ulcers. Plies, cancer, gastric ulcers. And it can be also caused by or through rheumatoid arthritis and myxoedema, but also along with rheumatoid arthritis, but also along rheumatoid, I have no idea how to pronounce that, rheumatoid arthritis or myxoedema, or other diseases in which the hemoglobin is destroyed. Then can happen the part of it, the causes. Let's stay away with chronic infections which interfere with blood formation. Why not? Imagine someone has a chronic infection which interferes with blood formation. They're just taking iron tablets. And also absorption problem of the bowel. Diet insufficiency. Okay, it gets worse through, let's take it, it gets worse through heavy periods, pregnancy, or heavy blood loss overall. It persists until it is. Then the causes. The causes of it are that there's too little iron in the blood. And that can be caused through not eating enough iron. It can be caused through bowel problems, that the bowel is not absorbing the iron. It can be caused through chronic infections, which are interfering with the blood formation. Chronic infections, which are interfering with blood formation. Or, let's try to name the tooth extraction also. So, pregnancy, tooth extraction, heavy periods, or heavy blood loss overall. And it can be also alongside of, it can be also caused through, what is caused through rheumatoid arthritis or myxoedema. And it can be also a part of an underlying disease like cancer, gastric ulcer, or life. Or other diseases in which the red blood cells are destroyed. Okay, we have that part, and then it persists until it is if it is, in a sense, yes, but if it's just caused because someone eats wrong, then it would go away as soon as a person eats right, away only until it's treated. Let's stay still away from that. It makes sense that this, by describing that it persists until it is treated, but we have here so many other causes which can aggravate it, that is not the iron deficiency the problem or the other cause. We have here almost 10 causes named which have nothing to do with iron deficiency, or basically which cause iron deficiency, but the iron deficiency has not to be treated, but the underlying cause. So to say that the condition persists until it is treated is, I don't know the word for it, is not leading in the right direction, because it seems to be very often that it is an underlying cause which has to be treated, and not the iron deficiency itself. Complications, none. Treatment in the home, none. So what are we going to say? There are iron tablets prepared with. If people had heavy blood loss, don't mention that. If people had heavy blood loss, or had heavy periods, or during pregnancy, they might should consult a doctor to think about taking iron tablets. There are iron, okay, we could shorten it down. There are iron tablets to take it to get the iron amount again up to produce hemoglobin again. Or we could say, the long part, if people have heavy blood loss, heavy periods, or are pregnant, they could consult a doctor to think about taking iron tablets. We could just stop and look how far we come. And let's just try it. I'm going to set the camera. Iron deficiency anemia. Iron deficiency anemia is anemia. So what meaning? Iron deficiency anemia. Iron deficiency anemia is anemia caused through iron deficiency. It can be also caused through other things. By anemia, there are not enough hemoglobin, so there are not enough oxygen-carrying hemoglobin cells in the body. And by iron deficiency, there's not enough iron in the human body to produce the hemoglobin, which is transporting the oxygen through the body. And the symptoms of anemia are tiredness and shortness of breath and palpitation, and also insomnia and indigestion, and loss of appetite, disturbed vision, and also maybe chest pain, and in severe cases, ankle swelling. Now, by iron deficiency anemia, there is not enough iron to form hemoglobin. And that can be caused because the people don't eat enough iron, or because the bowel is not able to absorb the iron, or because the person has a lot of blood loss, which can be caused from an underlying disease like cancer, plies, gastric ulcers, or through heavy periods, pregnancy, tooth extractions, or other things. And the symptoms are by iron deficiency anemia, also a sore tongue, inflammation at the sides of the mouth, and brittle and dry nails. And it can be treated through iron tablets. And it can be a part also of other diseases like rheumatoid arthritis or myxoedema. And if persons have heavy blood loss, heavy periods, or are pregnant, they could consult a doctor to think about taking these iron tablets. And that is according to Keith Hodgkin's Family Medical Advisor, page 72. But this is no medical advice. That's one thing I forgot quite a lot. But I said also quite a lot, so what did I forget? I didn't really want to do the whole thing here in the middle. I said most of the things, pain of the skin knot, headache knot, but I said for most things, 2-3 knots, which I wanted to say. So I'm going to stop the camera. And that was the iron deficiency anemia part. Anemia. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the shoulder and tendon training, please put it on risk. Have a good and stable standing stance, and we're doing shoulder circuits. Back, up, and front, and down. And front, up, back, and down. And now, long arms, strong fists, and go as far back as you can with the shoulders. High up, front, and down. Back and back. Up, front, and down. Again, up, back, down, and front, up, back, down. Now, what are we doing now? Legs wide apart, go down into the knees, hinge forward with a straight back, let the arms hang, and pinch the scapula together. Make fists, lift the arms up and still pinch the scapula together. The arms down, shoulders, and another round, pinch the scapula together. Make fists, lift the arms up and still pinch the scapula together. And lift the arms up, the shoulders. And now a sheet jump up into the knees, hinge forward with a round back, with the arms hang, make fists, and the arms to the inside. Lift the arms up and bring them together, straighten up, and shoulders down and together. And now lift the arms up, bring them together, shoulders down and together. And release. And another round into the knees, hinge forward with a round back, lift the arms hang, make fists, turn the arms to the inside, lift the arms high up, bring them together, straighten up, bring the shoulders down and together. So the arms high up and together, the shoulders down and together. And release. And now the next exercise, just lift the arms up. If this or any other exercise causes pain, then don't do it. Now the arms to the side and in front. Just observe what the scapulars are doing. And the next exercise, a wide lifter. Go to stable stance, a bit over and shoulder wide apart. Long arms, strong fist, shoulders down and together, and turn the arms to the inside. So shoulders down, together, arms to the inside. Arms to the outside, shoulders down and together. Arms to the inside, shoulders down and together. And to the outside, the last time, shoulders down and together. And release. The arms to the side again, a bit in front, turn the arms in front. Shoulders down and together. And push arms back, shoulders up, back and front. And arms in front, shoulders down and together. back, shoulders up, and around. And release. And now, a shrug. Lift the arms up. And shrug the shoulders up. And release all down. And now turn the arms up. Shoulders up. And all down. And now, the pretzel curl. Arms together, down and to the outside. And now a sunlight. You can use the sock or something, have it with a long arm to the outside, let it fall down, and try to catch it again. If you flex the wrist down, then it might be easier to keep it straight down. And on the other side. And now stretching the elephant trunk, arm front, shoulders back and down, pull the arm in, have flat fingers, try to relax your arm, go with back of the shoulder, and turn the palm of it up to the sky. Relax the arm, go with back of the shoulder, to the arm. And the other arm in front. Okay, shoulders back and down, pull the arm in, have flat fingers, try to relax the arm, go with back of the shoulder, turn the palm up to the sky. And release. And that was the shoulder tension training. I thank you very much and till next time. Hi and welcome. I'm trying to learn medicine. Today, pernicious anemia, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's better at your own risk. And this is part 2 of a pernicious anemia. And we're talking about internal anatomy, the blood system, diseases, and this is now medical advice, which is treating about. Now, pernicious anemia. It is a form of anemia which develops when the bone marrow lacks vitamin B12 or other substances needed for the proper formation of blood, or other substances. Maybe we're going to name it like that, or maybe we're going to say just vitamin B12. Okay, but we're starting with anemia. Anemia is when there are not enough hemoglobin cells in the blood. Hemoglobin is transported by oxygen in the body, and if someone has not enough of them, that is anemia. And the symptoms of anemia are shortness of breath, dizziness, disturbed vision, insomnia and headache and palpitation and chest pain and ankle swelling and pale of skin. I don't know what it means, so that's why I don't remember it. Pale of skin. Okay, pale of skin. And was anything else here? Okay. And when the symptoms of pernicious anemia, that is called, when there are different types of anemia, different reasons, and by pernicious anemia, that is vitamin B12 that is missing. Vitamin B12, we're going to say vitamin B12 because if we say other substances and don't explain an iron deficiency, and I don't really understand the part, maybe that's also the reason. We're going to say vitamin B12, but maybe we're going to say other substances, but not iron deficiency because that would be iron. The condition is common in people with blood group A, even in those with blood group 0. So the symptoms: tongue is sore, smooth and inflamed. Persistent diarrhea, tingling in fingers and toes. In severe cases, the facial skin may assume a lemon yellow tint. Okay, pernicious anemia, vitamin 12 is missing, and tongue is sore, smooth and inflamed. In places inflamed, sore, smooth, inflamed, and persistent diarrhea, tingling in fingers and toes. Fingers and toes. And the face can have a lemon yellow tint. Okay, duration persists untreated. Maybe we can mention it somewhere if it fits. Causes: failure of the stomach to produce an enzyme, the intrinsic factor, which is needed for the absorption of vitamin B12. And the cause is that the human body does not produce or has. The stomach is not producing an enzyme. The stomach is not producing an enzyme to make itself able to absorb vitamin B12 out of the food. Failure of the stomach to produce an enzyme which is needed for the absorption of vitamin B12 from food. The failure results from autoimmunity, certain drugs, or follows the removal of the stomach. I don't get it. Because it seems to be all external factors. Autoimmunity, okay, but that's not external. Maybe we're going to mention it. When it would be, we're going to say it in the exact list without explanation because I don't really understand it. Autoimmunity, certain drugs, or stomach removal. Gastrectomy. Autoimmunity, certain drugs, removal of the stomach, gastrectomy. Gastrectomy. Complications. With early treatment, these are few. They may include heart failure, degeneration of the spinal cord, and cancer of stomach. If early treated, the conditions consists forever basically, if until treated, consists forever except it is treated. If the treatment is early, then complications like cancer of the stomach, spinal cord degeneration, and heart failure may be avoided. With early treatment, the complications are few, and the complications include. They don't say that these listed ones, heart failure, degeneration of the spinal cord, and cancer of the stomach, are less likely if the treatment comes. But I think they haven't expressed this 100% directly. I think what they mean is that these three complications, for example, are less few happening. We don't say that literally, but I think that's what we mean. Treatment in the home, none. Take lots of refurbishment. Okay, there is a course of vitamin B12 injections. We're going to remember injections. Maybe this book's from the 80s, there are already tablets, but let's try to remember injections. Vitamin B12 injections. The only types of pernicious anemia which can be prevented are those which have an underlying cause, such as removal of the stomach, a gastrectomy, or prolonged treatment with an anti-epileptic drug. That would be. Now here, what I'm wondering about it. What do they mean now with certain drugs can cause it? Do they mean medicamentation? For example, anti-epileptic drugs. Prevention. The only types of pernicious anemia which can be prevented are those which have an underlying cause, such as gastrectomy or prolonged treatment with an anti-epileptic drug. You can stay away from that. I don't really know how it fits with the rest. Outlook, good. After the initial course of treatment, injections must be given indefinitely to stop recurrence. Okay, what was the first sentence? After the initial course of treatment, injections. What do you mean with initial course of treatment? After the initial course of treatment, we're just going to say, we're making a separation. We have to give it for a time to treat it, and then we have to give it out by separating it. Okay. I think we have it all together. Are we able to do this? Pernicious anemia. No, the first thing is I don't know how to pronounce it. Pernicious, I'm going to say pernicious anemia. First, going to explain anemia. Nice hemoglobin, oxygen carrying. And when I try to list as many symptoms as possible, then we're going to do the other thing. When the stomach is not producing the. I think we're going to start directly with the explanation. The stomach is not producing the enzyme necessary to absorb vitamin B12. And the reasons for that can be removal of the stomach, certain drugs, or what's the other thing? Autoimmunity. So I mean an autoimmune disease. Autoimmunity, certain drugs, gastrectomy. Gastrectomy. Directly gastrectomy. Gastrectomy. Autoimmunity, gastrectomy. And certain drugs. And when the symptoms are furthermore by that thing are then sore tongue, inflamed, and there was something else, but smooth. And then there was also persistent diarrhea. And then there was also, in severe cases, the lemon yellow tint of the face, and one in the lip. Tingling at fingers and toes. When you're going to say the causes, did we already, what then? it has to be, if treatment is early, then complications like degeneration of the spinal cord. I think that's interesting. Degeneration of the spinal cord. Do we mean with the spinal cord? No, it is not the bones, but are the nerves inside. The spine are the bones, the vertebrae, but the spine and the spinal cord are the nerves inside of the spine. Why degeneration of the spinal cord? If it would be the bones, it would maybe make sense. But the blood is not good. No, it wasn't here. It was histology. But so I want to mention that. Degeneration of the spinal cord, cancer of the stomach, and heart failure. And I think it was, and there are vitamin B12 injections earlier when these don't happen. It has to be taken indefinitely, but the outlook is all good. I'm going to start the camera and let's start. Pernicious anemia. Anemia overall, that is when there is not enough of the hemoglobin cells in the blood. Hemoglobin is normally transporting the oxygen in the body around, and by anemia, there are not enough of them. And the symptoms of anemia, they are palpitation, shortness of breath, disturbed vision, and swelling of the ankles, and chest pain, and indigestion, and loss of appetite, lack of appetite. Now, in pernicious anemia, where it is a specific type of anemia, where is the stomach not able to produce an enzyme necessary to absorb the vitamin B12 from the food. And the reasons for that are certain drugs or autoimmunity or also stomach removal. And the people then have also who have pernicious anemia have an inflamed and sore and smooth tongue. It cannot be. Yes, sore and smooth. What do I mean with that? What happened then? Isn't there changing of fingers and everything? And then directly basically treatment and the complications. Pernicious anemia. Pernicious anemia is a type of anemia. By anemia, there are not enough of the hemoglobin cells in the blood, and hemoglobin is transporting the oxygen in the body. And the symptoms of anemia are shortness of breath, or dizziness, or disturbed vision, palpitation, loss of appetite, lack of appetite, and also indigestion, and chest pain, and swelling of the ankles. And now by pernicious anemia, there the stomach is not able to produce an enzyme necessary to absorb the vitamin B12 from the food. And the reasons for that can be autoimmunity or stomach removal or also certain drugs. Now, and there is treatment against it. There are vitamin B12 injections, and if they're taken early, then complications like heart failure or degeneration of the spinal cord can be avoided. And symptoms of a pernicious anemia are then furthermore inflamed, sore and smooth tongue and persistent diarrhea and tingling of fingers and toes, and also in severe cases a lemon yellow shading of or coloring of a face. And that is according to Keith Hodgkin's Family Medical Advisor book, page 72 and 73, but this is no medical advice. I think I forgot the thing, but I don't think that here. Maybe I said it all. I don't know. I'm going to stop the camera over time. And that was the medical part. If you were here for medicine, you can go directly to the next part of medicine, where we're going to do maybe sickle cell anemia. Maybe we're going to do something else. We're going to do now the shortened impingement training. If you stay and participate in the shortened impingement training, that's better the hours. We are doing short circuits. Good. If you participate in this better the hours. Good, then stay with sense, we're doing short circuits. And backwards. Front. Down and north. And now, long arms, strong fists, and go as far back as you can with the shoulders. High up, front, down, again, back, front, down, and now they are down, back. And to the next exercise, we are doing a root lifter. Long arms, strong fists, shoulders down and together, and turn the arms to the inside. Arms to the outside, shoulders down, together. Arms to the inside, shoulders down, together. Arms to the outside, shoulders down, together. And the next exercise, the arms up and a bit in front. Then the arms in front and the shoulders down, together. Arms back, shoulders up and front. And the arms in front, shoulders down, together. Arms back, shoulders up and front. And release. And now lift the arms up and shoulders up and release it down. Again, the arms up. Shoulders up and down. Arms together and down to the outside, down to the inside, and again. Another stretching. One arm in front, shoulder stays back and down. Pull the arm in, flat fingers. Try to relax the arm, go a bit back with the shoulder, and turn the palm up to the sky. And the other arm in front, shoulders back and down, pull the arm in half flat fingers. Try to relax the arm, go it back, shoulder, turn the palm up to the sky. And also shoulder pressure training. I thank you very much and until next time. Hi and welcome. I am trying to learn medicine. Today, congenital dislocation of the hip. And after we've done it, we're gonna do wrist training. And if you participate in a wrist training on SVT Onless, can be talking probably about internal anatomy, maybe even congenital problems. I don't know, I haven't read it. So, and this is no medical advice, we're just going to read about it. I don't even know what it is. Congenital dislocation of a hip. The dislocation occurs either before or after birth. Okay. It happens before or after birth, that somehow makes sense. It is discovered at the routine examination after birth. Okay, a child after it has been born is routinely examined. And where it is discovered. In the rare cases when it is not detected early, the child will become disabled. What treatment may remedy this? Okay. So we're saying here the reason why the child should be by a doctor examined after it has been born, because it sounds as if it would be detected, it doesn't become disabled. Okay, but there's also treatment. Let's read on. Girls are affected by the disorder 6 times as often as boys. In 2/3 of all cases, only one hip is affected. Okay, women or girls have it 6 times more likely than boys or men when they are born. In 2/3 of all cases, only one hip is affected. In 2/3, only one. I think it's strange. It should be earlier, you know. In 2/3, one. No, it's exactly how it should be. In 2/3 is one. 1/3 both hips, both legs and hips. Okay, let's see on. Symptoms. Symptoms occur only if the abnormality has not been detected and treated at birth. Okay, if it is detected after birth and treated, there should be no abnormality. There are no symptoms until the child reaches walking age. There are no symptoms, the size it means. But the child doesn't show symptoms until it starts to walk for a few months. There are no symptoms. When walking is often delayed, so that could be one reason why walking is delayed, because there is a congenital dislocation of the hip, which was not discovered. When walking is often delayed, and when it starts, the child has a limp or waddling gait. So a limp is a limp, and the waddling gait, I don't know what it means. Some problems with walking. But it seems that the child can actually walk, so it might be even not there discovered. Does everyone know it to check for it? Because as far as we read, no, but it seems like something very severe which can be easily avoided. And Since when do people know about that and check for that? I've never seen a movie scene in which such an examination of dislocation of the hip is happening. Now, what is even dislocated? The leg of the hip? I didn't say that. Oh, okay, whatever. Okay, causes. This dislocation of the hip can be inherited. Okay, it can be inherited. How can it be inherited? Or do we just mean it comes from birth? No. Whatever, it can be inherited. It can also be the result of a difficult birth. Okay, a difficult birth can also cause. When to consult a doctor? Immediately if the condition is suspected. So consult the doctor immediately, because then it should be the disability avoided. What the doctor might do: manipulate the baby's hip joints and listen for a click, which will almost certainly denote dislocation. It does work. To find that out, it seems to work. It would be interesting to know how often it had not worked. Okay, listen for a click in the hip joints is done by a doctor to find out if it happens. Then refer the child to hospital for an X-ray or a second opinion. Yes, a second opinion is an interesting idea, and also for an X-ray to get a mechanical opinion. So to scan it if there's actually something wrong. If the diagnosis is confirmed and the baby is less than 6 months old, the legs are kept widely separated by a splint for 3 to 6 months. This is often the only treatment needed to make the hip develop normally. This book is from the 80s, maybe there's another treatment for it. But the treatment would be to keep the legs widely separated by a splint for a few months. And how does it work? No, I'm asking physiologically or anatomically. Because if you could understand that, why it works just to keep the legs with a splint for a few months separated to cure dislocation of the hip, maybe that would be something which everyone should know who works with anything considering with the hips. If the baby is older than 6 months, the dislocation may require a different form of treatment, perhaps an operation. Okay? Outlook: excellent if a diagnosis is made at birth or before the baby is 6 months old. Okay, if it's diagnosed at birth or very soon after birth, then however actually the treatment looks, at least with the treatment, it's called, with the treatment healable, whatever it's called, treatable, healable. No, it seems to be healable. Okay, I think that we could try to make the presentation right now. Congenital dislocation of the hip. That the hip is dislocated. We didn't say what it is. I think in this case we should also mention that girls have it 6 times more often than boys. Symptoms. The first symptoms of it happen as the child starts to walk, which can be delayed because of it. The child limps or has a waddling gait. So it should be tested. The child should be examined directly after birth by listening for a click. Where is it not? Manipulate the baby's hip joint and listen by listening to a click joint in the hips, this is all a bit complicated. How do you say it? And making exercise and checking, and then actually. This starts to come. I think we have all the information together. These are just basically this information that started and tried. Congenital dislocation of the hip. If it is not found directly after birth, then the first symptoms occur only when the child starts to walk, which can be delayed for it. And the child is then limping a bit or has a waddling gait. Now, directly after birth, it could be by a doctor examined and then found that there is, by manipulating the hip joints, a clicking noise. And if it's then for an X-ray and a second opinion confirmed, then the legs of a child can be through a splint be separated for 3 to 6 months, and that should in most cases treated. If it is treated directly after birth, it should not lead to disability later on. And the first symptoms occur. Now, that's because it's in a way pretty easy to say. It's a problem. Congenital dislocation of the hip. If it is detected directly after birth, then the outlook is excellent and no disability develops. If it is not detected, then the first symptoms occur when the child starts to walk, which can be delayed through the congenital dislocation of the hip. The child is then also limping and has a meddling gait. Girls have it 6 times more often than boys. It can be found directly through examining the child after birth by a doctor, and then by manipulating the hip joints, a clicking can be heard, and if it is confirmed through an X-ray and a second opinion, then through a splint the legs can be kept separated for 3 to 6 months, which should be enough to treat it so that no disability develops. And that is according to Keith Hodgkin's Family Medical Advisor, page 177, but this is no medical advice. I don't know. Let's keep it a bit. I'm going to listen to it. If it's a catastrophe, I'm going to do it again. I'm going to stop a minute. Now, and that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We will do now the wrist training. If you stay and participate in the wrist training, then it's that you're on risk. We're starting the first spotlight. Fist next. If you participate, then it's that you're on it. Fist next to us and bringing them down and up. Now we're having 3 rules. The first rule is that we're stopping immediately as soon as there's pain. Next exercise, the flashlight brings the fists to the inside, to the outside. So first rule, if there's pain, stop immediately. Second rule, go only as far as you can go with a little bit of effort. Next exercise, and flat hands, and bring the flat hands to the inside and to the outside, the magician. Now in the third rule, we just want to strengthen, not to exhaust, so don't overdo it. We have a lot of exercises. And next exercise, the painkiller. Bring the flat hands up and down. And on to the next exercise. I forgot what it's called. Flat hands out and up and down. And that is the T-Rex in the wall. And the next exercise, to the T-Rex in the gym. So I'm going to use a tennis ball. Press onto the tennis ball, or if you don't have a tennis ball, just make a strong fist. Release again and press again. Release and press. And switch and press again. And release and press. Release and press. Now to the next exercise, the quadrangular castle-like leg fists out and bring the fists together. Up to the outside. Down to the inside. Again down to the outside. Up to the inside. And now the crab anxious to a fever. If you'd like to take a break, you can do it now. That exercise is perfectly for it. Bring the fist down and press it against it. Press on the outside. Up top. And from the bottom. And now the other side. Fist. Bring your fist down, deflection, and press a bit against it. Have all this all the time in code in 6 sets. And press on top. And from the bottom. And we're going on to the next exercise. The course speak playing fingertips of one hand on top of the fingernails of the other hand. Press a bit and open. Close again against this with resistance. And open. And close. Now switch the other hand on top. And open. And close. And the next exercise is the 4 days nurse in fierce director. Fist. And open. And close. And that was it. Next exercise, I think it's time for the buckle bridge. So, flat hands next to each other, and just bend the fingers down at the knuckles. Hold it, and up again, and another time. Bend down at the knuckles of fingers, and up again. The next exercise, if you'd like to take a break, do it again now. The frog testing the water temperature. Hands next to us, and bring the hands down with flat fingers. Up with strong fists. Down with flat fingers. Up with strong fists. Down with flat fingers. And again. And our next exercise. Arms up, the fists, bit strong fists, and bring the fists down in deflection. And bring the arms down. And again. Now turn the arms up. Down. Up. Change again. Down. No. Again. Up. Switch again. And one more time, turn it down, and up. Let's flex out. And the next exercise, the claw. Flat hands and make claws. Open again and close. Open, close. Next exercise, you can take again a break. Arms in, strong fists, and bring the fists into flexion. Arms out and into extension with the fingers. Wrists. In flexion with the fist, strong fist, and out flat fingers, extension. And the last time in, and out, and in. And the next exercise, the ice X. Flat hand, bend it at the knuckles and press on all 4 fingers. And out again. Other hand, bend it at the knuckles, press on all 4 fingers. And the last exercise, the launching rocket, the unfolding rocket boosters, I think was it. Long arms, strong fists, and bring these fists into flexion. And now the hands again, wrist into extension and the flat fingers. To the inside again, strong fist and outside extension. And inside. And inside. And now the last exercise, the claw. Go with moderate effort over the middle part of the lower arm. So here's the brachioradialis, set a bit against the arm and cut down. Over the middle part of the lower arm, over the extensor digitorum muscle. You want to relax it. And on the other side as well. And that was wrist training. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine. Today, sickle cell anemia, and after that, megaloblastic anemia. And after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And we're talking about blood system, blood disease, and internal anatomy. And this is no medical advice, we're just reading about it. And that is part 2 for sickle cell anemia and megaloblastic anemia. Now, we want to do now a presentation about it, sickle cell anemia. So first we want to say what anemia in general is. It is insufficient amount of hemoglobin cells in the blood, they are carrying the oxygen. And the symptoms are tiredness, shortness of breath, palpitation, insomnia, headache, and chest pain, and ankle swelling, and loss of appetite, disturbed vision, and pallor of skin. Indigestion also. Okay, we try to mention as many as possible. So basically that, and now sickle cell anemia. And that is an inherited condition. I think we should mention that overall, because iron deficiency, there was nothing written about inherited, and also not by pernicious anemia. I don't think any of the other one was inherited. Now, sickle cell anemia is inherited, and mostly people with black skin have it, almost exclusively. The symptoms start in childhood. Okay, and the symptoms start in childhood. Okay, symptoms. Slight yellow discoloration of her skin and eyeballs. Okay, slight yellow discoloration of skin and eyeballs. Feverishness, weakness, and anemia, especially after strenuous physical exercise. Okay, we're gonna say feverishness and weakness, in particular after physical exercise. That seems to be something important. That's something important, I'm gonna say that. Anything causing deep or rapid breathing may result in a crisis when the symptoms are particularly severe. Anything which causes heavier breathing can result in a crisis. We're going to short it down to that. I didn't understand it in the first part. Now I understand it. It's not heavy breathing or something. I mean anything heavy breathing. So also shock or something. Blood clots may occur anywhere in the body. Blood clots. And I don't really understand that part. Why does now the anemia lead to blood clots? But let's try to mention. So we're having a slight discoloration of skin and eyeballs, feverishness, weakness after physical activities, and anything causing heavy breathing can cause a crisis. And also blood clots can form everywhere in the body. Duration. The condition is chronic, persisting throughout the patient's life. Okay, it is forever basically. It is lifelong. Causes: An abnormal hemoglobin present in the blood. Hemoglobin is the red pigment in the blood which carries oxygen from the lungs to the tissues. If, because of exertion or respiratory infection, the amount of oxygen in the blood is reduced, the abnormal hemoglobin causes the blood cells to deform into sickle shape. What is the hemoglobin of the blood cells? An abnormal hemoglobin present in the blood. Hemoglobin is the red pigment in the blood. But that pigment is the oxygen. The abnormal hemoglobin causes the blood cells to deform. Let's shorten it down. I don't really understand that part. The problem is that the abnormal hemoglobin causes the blood cells to deform into a sickle shape. And these cells are then attacked by the immune system of the body and destroyed, and that causes anemia because now there's too little hemoglobin. Let's see it again. No, it's hemoglobin, it's the same word. I don't get no difference. Is this hemoglobin cell? Is this the blood cell? Is this the pigment? Is it maybe both? The hemoglobin is abnormal and that causes the blood cells to deform into sickle shape. Let's try to say it exactly that. The hemoglobin is abnormal and the hemoglobins, let's make a plural out of it. If we're saying it wrong, it sounds not the right way. Someone knows it. The hemoglobins, now we're taking it out. It could be that or that because we can't find it out. Causing the blood cells to deform into sickle shape. Then they are then attacked by the blood system. Complications. Ulcers and local infections. Ulcers and local infections may occur in bones, kidneys, and other organs. The disease, maybe saying the symptoms of the disease can lead to ulcers and also local infection. Why? I don't get it. What has it to do with anemia? It can lead to ulcers and local infection in bones, kidneys, and other organs. Bones, kidneys, and other organs. And arrange for the patient to have regular blood transfusions if sickle cell anemia is diagnosed. This is the only form of treatment available. There is no way of preventing the disease, but avoiding strenuous physical activity may reduce the risk of severe crisis occurring. Complications arising from the anemia may result in death at any age, but many sufferers survive beyond middle age. Okay, we're going to say to the last part, physical activity, avoiding physical activities avoiding can help to avoid crisis. Regularly, blood transfusions can help and is the only form of treatment. It is lifelong, it is not preventable. Avoiding strenuous activities is the only way to reduce the risk, and crisis can lead to death. But treatment. Okay, I think we have it all together. The symptoms of sickle cell anemia itself were also, but it was this slight yellow discoloration of skin and eyeballs, feverishness, weakness after physical activities. Any form of rapid breathing can cause a crisis, and anything causing rapid breathing cannot cause a crisis. Anything causing deep or rapid breathing, and blood clots may occur anywhere in the body. Let's try it. It's pretty complicated. It's not written coherent or true. Sickle cell anemia. By anemia in general, there is a too little amount of the hemoglobin which is carrying the oxygen through the body. And the symptoms of that are weakness and shortness of breath and disturbed vision and palpitation and pallor of skin and ankle swelling and chest pain and lack of appetite and indigestion and headache and insomnia. Now, by sickle cell anemia, that is an inherited form of anemia. So sickle cell anemia is inherited, and it is almost exclusively in people who have black skin color. And it appears oftentimes starting from childhood on, and it is lifelong. And now the problem there is that the hemoglobin is abnormal, and that causes when the blood cells, if they are under stress, if someone is breathing heavily, to deform. So the hemoglobin is abnormal, and that causes the blood cells to form two sickle shapes. And they are then attacked by the immune system and destroyed. Now, it can happen through any type of thing which causes heavy breathing. Physical activity can cause a crisis. Another symptom is also slightly discoloring in yellow of eyeballs and of the skin. And blood clots can form over the body. And if a crisis comes, which can happen for anything which causes heavy breathing, then ulcers and local infection can happen anywhere and death. It is lifelong. There is a treatment, and this is the only form of treatment, that are blood transfusions. And that is according to Keith Watkins' Family Medical Advisor book, page 72 and 73, but this is now medical advice. I think I skipped one or two things, but I don't think it matters. I don't think it matters. I said anything before, and I haven't even found anything which I missed, so I'm going to stop the camera, and we needed a little longer time than I thought. That means we're not going to do this time the folic acid anemia, the megaloblastic anemia, or whatever it was. We're going to do this the next time. If you're here for medicine, you can go directly to the next part where we're going to do this folic acid thing. If you are here for short impingement training, we are going to do it now. But if you participate in the short impingement training, it is at your own risk. Good and stable stance, and we do shoulder circles. We're going back over the shoulders, up and front and down. And again backwards and front, up, back, and down. And now, long arms, strong fists. Go as far back as you can with the shoulders. High up with the shoulders, then front and down. Again back, up, front and down. And high up, back, down, front, up, back, and down. And now, the bird lifter. Long arms, strong fists, shoulders down and together, and turn the arms to the inside. So, shoulders down, together, arms to the inside. Arms to the outside, shoulders down and together. Arms to the inside, shoulders down and together. Arms to the outside, shoulders down and together. And the next exercise. Arms to the side, a bit in front, arms in front, shoulders down and together. Arms back, shoulders up and in front. And arms in front, shoulders down and together. Arms back, shoulders up and in front. And release. And the next exercise, just with the arms up, and shoulders up, and release out down. Again, the arms up, shoulders up, and all down. Another time, arms up. If this or any other exercise causes pain, we'll now do it. Arms up, and down. And now the pretzel curl, arms together, and bring them down and to the outside. And press Sunday. You can use a sock or something else, have the longer to the outside, let it fall down, and try to catch it again. and on the other side. And now stretching the elephant trunk. Bring the arm in front, the shoulder is back and down. Pull the arm in, have flat fingers, try to relax the arm. Go with back with the shoulder and have the palm up to the sky. And the other arm in front, shoulders back and down. Pull the arm in, have flat fingers, try to relax the arm. Go with back with the shoulder, turn the palm up to the sky. And that was the shoulder impingement training. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, megaloblastic anemia and then after that anesthesia. And if you participate in, and after that, we're going to do wrist training. And if you participate in wrist training, then it's the hours. So first to the medical part. The first part to the megaloblastic anemia. And this is the third time, the second time actually, just that we're doing the megaloblastic anemia, but overall the 10th part of anemia, or whatever the other types. And we're talking about internal anatomy and diseases and the blood system. And this is no medical advice, we're just using one. Megaloblastic anemia. That is a form of anemia similar to pernicious anemia. Pernicious anemia, there was the stomach not able to produce an enzyme necessary to get the vitamin B12 out of the food. And vitamin B12 is necessary to form hemoglobin. And if there's not hemoglobin formed, then there's not enough hemoglobin. And if someone has not enough hemoglobin, then it's called anemia. Now, megaloblastic anemia is a form of anemia similar to pernicious anemia. We should mention it one time, but it's also called folate deficient anemia. But now I don't understand the name. Is it now megaloblastic folate deficient anemia or just folate deficient anemia? We're going to say it's megaloblastic anemia. So, megaloblastic anemia is a form of anemia similar to pernicious anemia. It develops if a diet is deficient in folic acid. Okay, folic acid are not enough in the diet. They state here by pernicious anemia, failure of the stomach to produce an enzyme which is needed for the absorption of vitamin B12 from food. So it does not sound like the people don't eat enough vitamin B12, but they're having an enzyme missing. For some reason causes. What was just the causes of it? Now I don't know what the cause of it is. Now here by megaloblastic, it seems it's actually a problem of a diet. Or a bit earlier, it develops if a diet is deficient in folic acid, which is present in liver and vegetables. I think they mean with liver to eat liver of other animals, and not that it is present inside of the liver. So it is present in vegetables. Pregnant women and the elderly are particularly vulnerable. The symptoms are similar to those of pernicious anemia. The tongue is sore, smooth and inflamed in places, persistent diarrhea, tingling of the fingers and toes. In severe cases, the facial skin may assume a lemon yellow tint. The symptoms are similar to pernicious anemia. They have vitamin missing and enzymes missing, and when we're going to say tingling of the fingers and toes, and maybe in severe cases, yellow tint of facial skin, persistent diarrhea, and tongue sore, smooth and inflamed of facial skin. Okay, and the treatment is to give folic acid tablets. This is why such tablets are given often as a preventive to those who may be at risk. Okay, I think I have it together. We should just start and look back if something is missing. I'm going to start the camera now. Megaloblastic anemia. The anemia overall, there is a too little amount of hemoglobin which is carrying the oxygen in the blood through the body. And the symptoms of anemia overall are shortness of breath and dizziness and palpitation and pallor of the skin, insomnia, headache and loss of appetite, swelling of the ankles and chest pain. And now by megaloblastic anemia, there is not enough folic acid in the food, that is in liver or in vegetables. And the most vulnerable people are pregnant women and people who are older. And there is a treatment against it, and these are folic acid tablets. And the symptoms of now the megaloblastic anemia, which is a form of anemia, are similar to the pernicious anemia. That is a form of anemia where the stomach is not producing an enzyme necessary to get the vitamin B12 out of the food. And the symptoms of pernicious anemia are tinging of the fingers and toes, persistent diarrhea, and also maybe yellowish tint of the facial skin. And also a sore, smooth and inflamed tongue. Now, and the symptoms of pernicious anemia, the thing that the enzyme missing to get the vitamin B12 out of the food, are similar to the one of megaloblastic anemia. There's not enough folic acid in the food. And that is according to Keith Hodgkin's Family Medical Advisor, page 72 and 73, but this is no medical advice. I'm going to stop the camera. And now we're having something else here, the anesthesia part. I think that is a bit... Oh, I don't know about that. I can't say. Anesthesia. I think it's a bit irritating, but anesthesia here has basically two different things. So anesthesia, loss of sensation in part or all of the body. That is anesthesia. This may occur as the result of injury to or disease of a nerve, as happens in leprosy. But the term is generally used to describe the deliberate medical removal of sensitivity to pain by means of an anesthetic drug administered by injection or inhalation to avoid surgery, so that surgery can be performed. And not just pain it away, also the other side is also. Now, I think this is a bit irritating. And the book is from the 80s, so is it still technically numbness basically in the body? And the other thing, or is it just exclusively 100% that thing? I would just say, as it is written here, we're going to say, and we're going to say first the first thing. Now let's start with the thing which is maybe wrong, which is better. To say first the thing but it is maybe wrong, and then what is probably meant with it, but it's easier, but it's better. As we have it. Now we're going to say anesthesia means the loss of sensation in part or all the body, which can be a result of an injury to a nerve or a disease of a nerve. For example, by leprosy. In generally, meant with anesthesia is the deliberate, intentionally causing of painless feeling, of no pain feeling, of removal of sensitivity to feelings, to pain, is the intentional removal of feeling of pain or other things through an anesthetist during surgery, so that the person does not feel pain and also that the person lies still. This is another big reason. And that can be given for injection and inhalation. How about we just start it, and if you mess up again, just do this again. Anesthesia can mean numbness in the body and in part of the whole body, and that can be through an injury to a nerve or disease of a nerve, for example by leprosy. Generally, it means the deliberate intentional removal of feelings for pain during surgery. The person inhales or gets injected and drugs so that this person does not feel pain during the surgery. And that is according to Keith Hodgkin's Family Medical Advisor, page 73, but this is no medical advice. It is really short, so anesthesia. Anesthetic drug, they said it's anesthetic drug, but it's still a bit short. They haven't even separated between local and total and consciousness and so on. But how about we take it and we come back when we have more? Oh, going to the camera. No, that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. Then we continue with medicine. If you stay here and participate in the wrist training, then it's at your own risk. We're standing good and stable the whole time, and we're having the hands with front fist next to us, and we're doing the spotlight, fists up and down. Now again, if you participate in this, at your own risk, and we're having 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as fast as we can go with a little bit of effort. Next exercise, the flashlight, so inside the fist and the outside. So the second rule, go only as fast as you can go with a little bit of effort. And the third rule, we're not overdoing it. We just want to strengthen, not to exhaust. And we have a lot of exercises. So you're invited to take a break before you... No, you should. Rule 3. Before you're exhausted, you should take a break. Next exercise. We're having flat hands and we're now doing the magician. We're bringing the fists to the outside, the hands to the outside, inside, and inside. Next exercise. The pancake flipper. Flat hands, open and close. One more time. And to the next exercise, the T-Rex in the morning. Flat hands out and bring them down. And next one, the quadrangular castle arc. Take fists to the inside, up, outside, down, inside, all the way around, down, outside, up, inside. Next exercise, hands next to us, into flexion, down with fists, down with the arms. You can do the exercise also slower, up, turn around, back and down. So the whole time the fists at flexion, make a more or less strong fist, and move the arms down and up. You can do this exercise, all these exercises, way slower technically. But we choose to have a lot. Now, to the next exercise, the curb anxious to fever. You can take already a break and skip this exercise. Fist down into flexion and press on the outside. And both on the outside. Press on the top. And open it. Other hand. Fist front, hand, down with the fist, and press from the outside, seen from fist view. And now both on the outside, seen from elbow view. And press on top. And open it. And next exercise, the T-Rex in the gym. You can use the tennis ball, or you do it without one. You press with moderate force onto the tennis ball, or you just make a strong fist. You release, and you do it again. Release, and do it again. Switch, and do it again. Up, and again. And aside. And the next exercise. A cautious big bang. Fingertips with one hand on top of the fingernails of the other hand. Open against the resistance. So press a little bit onto the fingernails. And we're doing it another time. Open and expand all 5. And on the other side. And the second round. And now on to the field daisies near Cynthia's shape. Fists. Open, close, open, close. One more time. And ending flat. And the next exercise is the bascule bridge. Flat hands next to each other and bring them down and build the knuckles. Hold it and up again. Another time. Hold it and up. Now I even advise you to take a break now. For the next exercise, the frog testing water temperature. Hands next to us, bring the hands down with flat fingers. Up with strong fists. Again down. And last time down. And up. And now the claw. Flat hands and make claws. Open. And again claws. And open. One more time. And the next exercise. Arms in, strong fists into flexion. And the arms out into extension with flat fingers. Again, in, strong fists, flexion. Out, extension, flat fingers. In, strong fists, flexion. And out. And again. Now, the next exercise is the Ice X. Flat hand and bend it again at the knuckles and press on all 4 fingers. And with the other one. Bring it at the knuckles and press on all 4 fingers. And the last exercise, the unfortunate boosters. Long arm, strong fists, and bring your fists into flexion. And then the extension. Again, strong fist flexion. Extension, flat fingers. Strong fist flexion. And last round. And we're ending with a floor, so go with moderate effort over the middle part of the lower. And on the other side. And weight force versus Wristtraining. I thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine, today aneurysm, and after we've done it, we're going to do a bit stretching. And if you participate in the stretching, this is at the arm risk. And we're talking about the blood system and disease and internal anatomy, and this is now medical advice, we're just reading about it. Aneurysm. Local swelling of an artery, like a blowout of an inner tube, which can develop if the artery is diseased or weakened, especially when the blood pressure is high. Okay, if I understand it so far, all overly, without that, it just makes what is it called? I don't know what it's called, so I don't know if it's what we're even describing. There's the wall, and the wall gets basically like a hole, but no hole. I'm looking trying to do a count. That's it one. And especially if the blood pressure is high, I didn't know about the thing. So high blood pressure, it makes sense. High blood pressure makes the pressure higher, and now with whatever it's called gets stronger. The aneurysm. The artery most commonly affected is the aorta, the main artery of the chest and abdomen, but small congenital aneurysms, those that are there at birth, can occur in otherwise healthy arteries supplying the brain. Okay, most is the aorta. I'm wondering about it because in all these models, this is one of the biggest ones. So maybe it makes sense because it is the biggest one, which has the most pressure on it, but it looks like the most firm one. So the aorta comes from the heart and then goes down. Okay, let's see. And the other thing was small congenital aneurysms, those that are there at birth, congenital means they're at birth, can occur in otherwise healthy arteries supplying the brain. Okay, people can have also, in the moment where they are born, aneurysms at the arteries supplying the brain. See subarachnoid hemorrhage. Later on. Rupture is the most serious risk of an aneurysm. Okay, some type of rupture, I don't know what rupture is. Sometimes a rupture, it must be breaking. Sometimes a rupture is incomplete in between the inner and outer layer of the arterial wall. Okay, a rupture is a problem, so I think that means it breaks. So it blows up like a balloon, that is how it's called. I think I understand like that. There's just peacefully the wall, and then one day it gets at one point a week, and now it opens up and they're like a balloon plus a blood. And it can rupture, it can break, and then the blood is not where it should be. And it could be just ripped between the two walls of the arteries, we were just saying. Okay, symptoms. Many aneurysms have no symptoms, especially those in the abdomen, and are found only by chance on routine examination or X-ray. I'm wondering how long are they? Are they there for a few days, a few weeks, or are they there actually over years? Okay. Oftentimes no symptoms, and then they are found then maybe by chance by an X-ray or other type of examination. Those which develop in the chest are more likely to press on surrounding tissues and to interfere with the proper function of the heart, causing chest pain and shortness of breath. That is very interesting. An aneurysm can cause chest pain. A reason of chest pain, the other way around is more interesting. A reason of chest pain can be an aneurysm. And shortness of breath. Okay, it can be somewhere in the body, then it's maybe never found. Or it can be in the chest, the aorta or something, and then it can cause chest pain or shortness of breath. Causes. The most common cause is erosion, that is degenerative change of the wall of the artery. Okay, erosion, did we do it? We are A-N. Did we add A-T? I think we did it. Erosion, sitting here. Degeneration of the walls of the arteries condition is also known as atherosclerosis or arteriosclerosis. It could be that we did it, but we didn't do a video about it. Otherwise I would know more about it. Okay, ephedroma, degeneration of the arterial walls. So that is one cause. That makes sense. Another cause is untreated syphilis. But that is now rare. The books from the 80s. So I'm saying in the 80s it was already rare that syphilis is the cause of aneurysms. Occasional causes and aneurysms of the aorta. Syphilis causes occasionally an aneurysm of the aorta many years after the original infection. Syphilis can cause an aneurysm at the aorta years after infection. And another cause, the cause of congenital aneurysm is not known. Very no cause. No cause. We don't know it. The cause of congenital is not known. In the 80s. Maybe something was wrong. When you consult a doctor, as soon as the condition is suspected, what the doctor might do? If an aneurysm is causing symptoms, the doctor will investigate to see whether it can safely be removed by surgery. A symptomless aneurysm is often not treated. Again, my question, how long does it then stay there? Why is it then at that place? Why not 1 centimeter down the pipe? What is there so different? Would it not be logical if now there's no more room for the blood? That now the people have a shortness of blood? Now the question is basically, imagine someone has a lot of aneurysms. And we are all quite big and there's a lot of blood now to the side, bulged out, or what it's called. Does the person then have a shortness of blood? And how much does the body react and produces more blood? Let's read over here. If the aneurysm ruptures, emergency surgery is required immediately. That makes sense. Prevention C at ephedroma. So we have to look how ephedroma can be prevented. Let's take it one look. Symptoms, causes. The cause is not definitely known, but diet is believed to be largely responsible. That's more so? Here's nothing else written. Diet is refresh it. It was the thing with the hare eating, with the rabbit eating thing. No, here's nothing written. We're talking about diet. Prevention, stop smoking, exercise regularly, avoid overeating, keep good diet. And there we say the thing with here, do whatever possible, eat meats from animals that have fat-free range, for example, wild rabbits and hares and pigeons and fish. That was the thing. No, okay, back here to the other thing. So to prevent ephedroma, prevent degeneration of the arterial walls, and that we said smoking and exercising, stop smoking and start exercising or do it, and don't overeat and try not to get obese. Outlook. Aneurysms in the chest which cause symptoms are serious, and without surgery they may be failed. Makes sense. Okay, if it's somewhere at the overfire at the chest, they can be very serious and can lead to death. Those elsewhere may remain for many years without causing serious trouble. But when pain or pressure symptoms develop, the risk of rupture has to be balanced. How does the pain now look if the aneurysm is in the leg or something? But when pain or pressure symptoms develop, the risk of rupture has to be balanced carefully against the risks of removal by surgery. Okay, we're thinking then about removing it is a bit also risky, but keeping it there is also risky and we have to balance it. Okay, that was aneurysm. Basically, the walls are strong enough because, for many reasons, maybe some reasons to make it not that likely to stop smoking, to not to eat too much and not to be overweight and do some sport. And it is bulging in the wall. And if it breaks, there's a lot of blood going somewhere where it should not be, and that can be deadly. That was the medicine part. If you were here for medicine, you can go directly to the next part of medicine. We will do now the stretching. If you stand, participate in stretching when it's risk. Legs are standing around, shoulders point apart, breathing in and lift the arms up. And breathe out to the side. Again in. And out to the other side. Again in. And out to the other side. Again in. And out to the other side. Out the arms down. And now. And now, breathe in. And out one hand slides down the leg and the other shoulder stays down. Breathing in. And now take one arm off. Breathing it up in the chest. And out back into the middle. Again in. Out one hand slides down the leg, the other shoulder stays down. Breathing in. And out take one arm off. Breathing in up the feet. And out back into the middle. Now the feet standing together. Breathe in and lift the arms up. And breathe out one arm down. Breathe in and reach. And out one arm up. Breathe in and reach. Out one arm down. Breathe in and reach. And out arm up. And now we have a leg standing again, shoulder body part, and we do shoulder circles. Go back, up, yeah, front, and down, and again back, front, and down, and another time, front, back, and down, and again, front, back, and down. And now, breathe in, lift the shoulders up, breathe out, lift the fall down, in and up, out and down. Breathe in, lift the arms up, and on the upper plug up, pretend to take an apple hanging high on an apple branch to turn it a bit around, and then to jab it out. And now do a shifter, legs up to, arms up to a G, breathe in, and breathe out over to one side. In into the middle, out over to the other side, in into the middle, and out and over. Okay. And out. Again in. And out, lean onto the knees. We're doing the buffalo fighting its hangover. Breathe in. And out one shoulder front. In and back. Out the other front. In and back. Out one front. In and back. Out the front. And out we're hanging down the Niagara Falls. Breathe in. And out. Again in. And out over one leg. Breathe in. And out over the other leg. Again in. And out into the middle. Now cross the feet, and we're doing the Salto Angelo. Breathe in. And out. Again in. And out. Again in. And out comes some more, and the shoulder back up and back into the backwards, shoulder roll. The toes are pointing to the outside. We're having an ulnar length space between the heels. We're breathing in and lifting the arms up. And breathe out and sink down into the garden pose. Place your elbows against the inside of the knees, and breathe in and straighten the back up, as if it would be against a straight board. And breathe out and come the back up. Breathe in. And out again down. Again in. And out again out. Again in. Out and down. You can straight up. And out comes slowly in one straight line upwards. And the head's down. And we're ending with a triangle. Legs wide apart, breathe in. Legs wide apart. Breathe in and I don't know what it is. Breathe in. And breathe out. Again in. Out. Breathe in and lift the arms up. And breathe out. Then in. Fold the arms down, and the last time breathe in, close the feet. Bring the hands together and lower them down. That was Researching. Thank you very much, and until next time. Hi and welcome. I'm trying to learn medicine, today aneurysm, and after we're done with it, we're gonna do stretching. And if you participate in the stretching medicine at your own risk, we're talking about the blood system and internal anatomy and diseases. And this is no medical advice, we're just reading about it, and that is part 4, I think, of aneurysm. Now, aneurysm, a local swelling of an artery, like a blowout of an inner tube, which can develop if the artery is diseased or weakened. Okay, diseased or weakened, these are the points which we want to name. Diseased and weakened, especially when the blood pressure is high, and high blood pressure also. The artery most commonly affected is the aorta, but small congenital aneurysms can occur in otherwise healthy arteries supplying the brain. Maybe you won't mention it. But aneurysms are a big medical phenomenon, so I'm not sure if it's very important that we name it, but maybe. Rupture is the most serious risk of an aneurysm. Okay, sometimes a rupture is incomplete and between the inner and outer layer of the arterial wall. Okay, we're going to go to the overview later, which should fit with what we tell then. Symptoms. Many aneurysms have no symptoms, especially those in the abdomen, and are found only by chance on routine examination or an X-ray. Okay, we're going to say many are symptomless, and then we're going to say maybe those which develop in the chest are more likely to press on surrounding tissue and to interfere with the proper function of the heart, causing chest pain and shortness of breath. I was stopping for a moment in the last part when I read that an aneurysm in the aorta or in the chest can cause chest pain, but it is what you're writing because it can interfere with the function of the heart. An aneurysm at the aorta can interfere with the function of the heart, and that can cause the chest pain. It's not the aneurysm itself, but the interference with the heart function. And shortness of breath. Okay, there we have the symptoms. Many are symptomless and are just found by chance for an X-ray examination. Others can cause because they can interfere with the function of the heart, chest pain, or shortness of breath. Causes. The most common cause is apheroma, that is degenerative change of the walls of the artery. We're going to mention there for a little moment what apheroma is and the 3-4 things how to prevent it. Apheroma, degeneration of the walls of the arteries. The condition is known as atherosclerosis or arteriosclerosis. Fatty deposits develop on the artery walls, which when hardened, producing a condition known as sclerosis. The deposits enlarge into plaques, which together with the sclerosis lead to narrowing of the artery. Apheroma begins in early adult life and increases with age. It affects almost everybody in the West to some degree, and the thrombosis, its chief complication, it is the main cause of heart disease and strokes. Apheroma causes no symptoms until it reaches the stage when the narrowing of an artery interferes with the circulation of the blood. When any of the following symptoms may occur, depending on the part of the body that is affected. Okay, apheroma is degeneration of the walls of the arteries. Fatty deposits are developing at the artery walls, and they harden then. The fatty deposits or the walls? I guess the walls. And we're going to stop just with fatty deposits develop or settling, whatever we are, what is, maybe we'll come to know in a couple of minutes. They're developing the fatty deposits. And to get it away, I'm saying stop to smoke, or don't even start it, to exercise regularly, avoid overeating, and keep it a good diet. Okay, stopping to smoke, exercise, do fitness, and don't overeat. It can be also through syphilis. Maybe you're going to say it can come through syphilis, but the main reason is apheroma, and that is degeneration of the arterial walls, because fatty deposits are developing at the arterial walls and then causing them to harden. And to get this way, to prevent it or to make it not that strong, not smoking, exercising, and not overeating. As soon as the condition is suspected, consult a doctor. The cause of congenital aneurysm is not known. If an aneurysm ruptures, emergency surgery is required immediately. Aneurysm in the chest which cause symptoms are serious, and without surgery they may be fatal. Okay, where is it? In the chest with symptoms are serious. So we try to mention it in some place. Those elsewhere remain for many years without causing serious trouble, but when pain or pressure symptoms develop, the risk of rupture has to be balanced carefully against the risk of removal with surgery. If the aneurysm, maybe we're going to mention it, if the aneurysm is somewhere else in the body, then it has to be evaluated. Is that a good word? Balanced. The risk, or it has to be elevated, the risk of surgery or of keeping it stronger. Okay, we have it all together. Aneurysm. Aneurysm is a bulging. Is bulging a correct word? I believe that bulging is a proper word for it. I don't really know what it means, but I think it's bulging. The arterial wall is bulging to the side. A bit like a balloon does it, I think, look. It's most commonly at the author. There's also congenital aneurysm. And they can be at other places of the body. When you stay a bit away from it, at other places of the body. And aneurysms can be in different places of the body. Most commonly it's at the author, at the heart. And what do we then say? Many are symptomless and are only found randomly. Others cause chest pain because of interfering with your heart or causing shortness of breath. And then the next thing is, let's go on. If an aneurysm at the aorta, at the heart, ruptures, that can be dangerous, and any aneurysm at the aorta which causes symptoms like the chest pain or shortness of breath is dangerous. If it is somewhere else, then it has to be evaluated. If not, the reasons are Neuroma, exercising, not smoking, and avoiding overeat. And what we're going to say also, it is fatty deposits at the walls, which causes them to harm. Let's start. I'm going to start the camera and let's start. What lots of it use? Swelling of an artery, local swelling of an artery, like a blowout or an inner tube. I think bulging is a proper word for it. I don't really know what bulging means, but I think it is a proper word. Aneurysm. Aneurysms are bulgings of the arterial wall. So the artery just goes peacefully and then it bulges out to one side, like a balloon basically. And they can be congenital at different places in the body, and they can be at different places in the body, but most of the times they are at the aorta from the heart down, and if they are there, they are dangerous. Many of them are symptomless and are only randomly by an X-ray discovered. Others causes chest pain because they're interfering with the function of the heart or shortness of breath. If an aneurysm causes symptoms at the aorta, it is dangerous, and if such an aneurysm ruptures, then it can be fatal. And the main reason for is atheroma. And atheroma, that is when fatty deposits are developing at the arterial walls, causing them to harden. And the 3 reasons named in this book to have not atheroma are to not to smoke, to do exercises, to do fitness, and not to overeat. And such an aneurysm can be removed. If it's somewhere in the body, then it has to be evaluated at the risk of surgery or keeping it bigger. But if it is at the aorta, it is very dangerous. And that is according to Keith Hodgkin's Family Medical Advisor book, page 74, but this is no medical advice. That's something, but I'm not sure if it was important. Whatever, I think I said at least most of it. So I'm going to stop the camera. And that was the medical part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the stretching, then it's already out. So, for the stretching, we're having the legs standing around, shoulder width wide apart. We're breathing in and lifting the arms up. And breathe out, go to the side. Breathe again in into the middle. Hold over to the other side. Again in. And out, the hands down. Next exercise. Now one stays your acro up. Breathe again in. And out, one hand slides down the leg and the other shoulder stays down. Breathe again in. And out and take one arm over. Breathe in and over the rib cage. And breathe out back into the middle. Breathe again in. And out, one hand slides down the leg, and the other shoulder stays down. Breathe in. And out, take one arm over. Breathe in over the rib cage. And out, back into the middle. Now with the legs standing together, we're doing the aeronatic aerobatic aeroplane exercise. We're breathing in and listening the outside. And breathe out, one hand down. Breathe in and reach. And breathe again out. Again in. And out, one hand down. Breathe in and reach. And out, one hand up and both down. Again, the legs shoulder wide apart, and we're doing shoulder circles. Go back, and front, and down, and another round back, and front, and down, and no backwards, front, back, down, again, front, up, back, and down. And now breathe in and the shoulders up. And breathe out, let them fall down. Again in. And out. Now breathe in, lift the arms off the apple plucker. And reach high and pretend to take an apple hanging high on an apple branch, to turn it a bit around and then touch it out. And to the next exercise, we shift our legs wide apart, arms up to a T, breathe in. And now go over to one side. Again in. And out to the other side. Again in. And out of the other one. Again in. Out to from last time to one. Again in. And out we're leaning onto the knees, the buffalo fighting its hangover exercise. Breathe in. And out one shoulder in front. In and back. Out the other one in front. In and back. Out one in front. In and back. Out the other one in front. In back. And out we're hanging down, we're doing the Niagara Falls. Just breathe again in from the nose and out from the chest. Again in. And out. Again in. And out, go over the leg. Breathe again in. And out over the other leg. Again in. Out into the middle. And now close the feet and we're doing the salto artigiano. Breathe again in. And out. Again in. And out comes slowly with the round back up and make it the top and backwards, shoulder roll. And now the garden pose. The toes are pointing to the outside, leaving an underlying space between the heels. Breathe in, lift the arms up. And breathe out and sink down. Elbows against the inside of the knees. And breathe in and straighten up. And breathe out and come with the back up. Breathe again in. And out and down. Again in, straighten up. And out another time with the back up. Again in. And out and down. Breathe in, straighten up. And out comes slowly in one straight line upwards. So, let's try the seahorse pose. Have a good standing leg, the heel of a mobile leg on top of a knee of a standing leg. Do this only if you can do it without injuring yourself. Breathe in. And out, and we're sinking down. And we're coming up again, and we're trying it with the other leg. Heel on top of the knee of a standing leg. Breathe again in. And out and sink down. And up again. And we're ending legs wide apart, the trunk igniter, breathe in, go down. And breathe out. Again in. And out. Breathe across the legs. And breathe again out. That was the stretching. I thank you very much, and until next time. I'm Rebecca. I'm trying to learn medicine. Today, alopecia, and after that, another thing, amblyopia. And after we've done that, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, that's very honest. And we're talking about diseases, probably a bit in internal anatomy. Yes. Okay. Alopecia, the medical term for baldness or loss of hair. Mostly it occurs on the head, but other parts of the body may occasionally be affected. The condition is usually inherited, but it may be caused by disease. See baldness. I think we should actually go at this point one time over. Let me see something. Balanitis. Baldness. Loss of hair, known medically as alopecia. The most common form of baldness is male pattern baldness. This is hereditary and not caused by wearing hats or washing and brushing the hair too much. Hairs begin to thin at the temples and the crown, and thinning may show itself before the teens are over. There's really, okay, that means this is completely just alopecia, loss of hair, mostly of head, not male pattern baldness or something. Okay, we need that, and we're going to do alopecia. The medical term for baldness or loss of hair. Mostly it occurs on the head, but other parts of the body may occasionally be affected. The condition is usually inherited, but it may be caused by disease. Okay. Alopecia is the medical term, we quote him pretty much, I think, is the medical term for baldness or hair loss. It occurs mostly at the head, but occasionally other parts of the body can be met with that condition as well. Other parts may be affected as well. Be affected. Usually is it inherited. Should we say one word, but we're not talking about male pattern baldness? I don't really think so, because the video is titled alopecia, which we're going to do. Now you're going to stay with, or we just do it, and if you have something new, we're going to add it with the next week. I'm going to say just what's in there. See baldness. Let's just do what is here and then get to know more after we've done that. I'm going to start the camera. Okay, alopecia. Medical term for baldness, loss of hair. Usually head. Other parts can be occasionally affected. Usually inherited. I think we should mention it because I think that's strange. So we should mention it. Usually inherited, but it can be also caused through disease. Alopecia. Alopecia is the medical term for baldness or loss of hair. It is usually at the head, but it can also affect other parts of the body occasionally. It can be inherited, it is usually inherited, but it can be also caused through a disease. And that is according to Keith Hodgkin's Family Medical Advisor book, page 71, but this is no medical advice. Close off the camera, and we're going to go to the second part. Amblyopia. Amblyopia. One type of reduction in the sharpness of vision. In most cases, it is not caused by any disease of the eye, but is either hereditary or the result of an uncorrected squint in childhood. Let's take one look if we find squint. Squint or cast in the eye is more than an unsightly blemish or embarrassment. It needs to be taken seriously because it can cause permanent loss of vision in one eye. What are you talking about? A squint or cast in the eye is more than an unsightly blemish. I don't know what a blemish is, or embarrassment. And I don't know what the word embarrassment has to do with that. Girls. It needs to be taken seriously because it can cause permanent loss of vision in one eye. Symptoms: double vision, seeing two images in place of one when looking in certain directions. In babies or toddlers who cannot explain what they see, a squint can be recognized by the fact that in certain positions the baby's eyes appear to face in different... That is meant with it. The baby's eyes appear to face in different directions. The image from one eye is when suppressed by the brain, which in the absence of medical treatment leads to the loss of vision in this... Oh, that is interesting. Okay, let's read it in one flow so that people actually can understand what I read here. Double vision. Seeing two images in one place at one, when looking in certain directions. The image from one eye is when suppressed by the brain, which, in the absence of medical treatment, leads to loss of vision in this eye, lazy eye. Causes. In babies and young children, the cause is usually due to some failure in the development of proper vision with both eyes together. In older children and adults, a squint can be caused by injury, severe infection, circulation problems, or pressure on the nerve supplying the muscles which move the eye. Treatment of what the doctor might do. Outlook. Provided squints are tackled early enough, that is before 4 years of age and certainly before 6, the outlook is good in terms of correcting vision and avoiding permanent damage. The sight in the lazy eye cannot be restored if it is left too late, although operations can be done for cosmetic reasons to improve the appearance. The outlook for squints arising from causes other than incorrect binocular vision will depend largely on the underlying causes. I don't really know what it is, but we've read about it, page 70. Amblyopia, one type of reduction in the sharpness of vision. Okay, the eye doesn't see the sharp anymore. It is one type of it. In most cases, it is not caused by any disease of the eye, but is either hereditary or the result of an uncorrected squint in childhood. Okay, it's not a disease causing it, but it can be hereditary. Or the result. How can it be hereditary? What could cause amblyopia, reduction in sharpness of vision? Okay, but it can be also because a squint is not corrected. I understand it that way, that the two eyes are watching in different directions and the brain ignores one of them and just uses one image, so it does not have two at a time the whole time. And one eye is never used and therefore it goes blind. That's what I understand from it. In some cases, however, it is due to damage to the optic nerve that has been caused by excessive use of alcohol or tobacco, poor diet or certain drugs. Treating the cause sometimes improve the vision. Would be interesting if now a better diet would improve the vision. Okay, in some cases, however, it is due to damage to the optic nerve that has been caused by excessive use of alcohol or tobacco, poor diet or certain drugs. Treating the cause sometimes improves the vision. Now we're over time. I don't really know what I should say to that now, because I don't really understand what it is. I could just say what it is, reduction of sharpness of vision, but I don't really understand what is meant here. Whatever, we're going to do, if we do a presentation in the next video or something else, I don't know. But it was a medical part. If you were here for medicine, you can go to the next part of medicine. We will do now the shoulder and pinch training. If you're staying participate in the shoulder and pinch training, then is that at your own risk, having a good and stable stance, and we're doing shoulder circles. Front back, foot, and down, back, and the other way down. Now, long arms and strong fists. Go as far back as you can with shoulders. Back up. And down. Back. Up. Front. And down. And now the other way around. Up. Back. Down. Front. Up. Back. And down. And now, the accelerating motorcycles. Legs wide apart. Go down into the knees a bit. Hinge forward with a straight neck, make the arms hang, pinch the scapulas together. Make fists, and lift the arms up and still pinch the scapulas together. Lift the arms down, and the shoulders, and another round, pinch the scapulas together. Make fists, lift the arms up and still pinch the scapulas. Arms down, shoulders down, and now the sheet jump up. Something similar. Down into the knees a bit, hinge forward, this time version around the back, let the arms hang, back fists, tip the arms to the inside. Lift the arms high up and bring them together. Straighten up, shoulders down and together. No, the arms high up. And together, shoulders down, together. And release. And another time. Bend into the knees, hinge forward, the round back, lift the arms sing, make fists, turn the arms to the inside. Lift the arms high up and bring them together. Straighten up, bring your shoulders down, together. The arms high up, hands together, shoulders down. And now just lift the arms up and bring them down again. If this any other exercise causes pain, then don't do it. Again, the other side. And down. And now the arms to the side. And up in front. Then again back. And now we will lift up. Long arms, strong fists, shoulders down and together. Turn the arms to the inside. So shoulders down and together with the other. And arms to the inside. Arms to the outside, shoulders down, together. Arms to the inside, shoulders down and together. Arms to the outside, shoulders down and together. And release. Now the arms to the sides, again the fists, bring them a bit in front, turn the arms in front, shoulders down and together. Change the arms back, shoulders up. And arms in front, shoulders down and together. Arms back, shoulders up and in front. And release. And now a shrug. Lift the arms up, shrug, shoulders up. And then go down. Now turn the arms up, shoulders up, and all down. One more time. Arms up, shoulders up, and all down. Now press the core. Arms together, a bit down to the outside, and again down and in. And the last exercise is somebody. Have something like a sock with a long arm at the outside, and let it fall down, and try to catch it. And on the inside. And that was for... No, it was not. You look stretching. The elephant trunk. One arm in front, shoulders back, shoulder back, hands down. Pull the arm in and have flat fingers. Shoulder next to the arm. Go it back with the shoulder. Turn the palm to the sky. And the other arm. Bring it in front, shoulder back and down, pull the arm and have flat fingers, try to relax the arm, go with back with shoulder, then palm to the sky. This was for shoulder training. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine, today ankylosing spondylitis, and after we've done it, we're gonna do something like this. I think I'm wrong. Neckstretching. And if you participate in the neckstretching, this is the honest. And here I want to say the neckstretching has nothing to do with the medical part where we're going to talk about ankylosing spondylitis. We would do the neckstretching even if we would be talking about dinosaurs or the Trojan War or something else. So it has nothing to do with neckstretching with what we're talking about. And this is no medical advice, we're just reading about it. And we're talking about internal anatomy, and this is no medical advice. So, ankylosing spondylitis. And the neckstretching has nothing to do with it. Ankylosing spondylitis. A disease of the joints, and if you participate in the neckstretching, then certainly honest. Ankylosing spondylitis. A disease of the joints affecting mainly young men in their 20s and 30s. I want to add already at the place that the book is from the 80s. A disease of the joints affecting mainly young men in their 20s and 30s. It usually affects the spine, causing joints to fuse by an unusual process of bone formation. Okay, the bones in the spine, these vertebrae, start to fuse. Symptoms. Onset of symptoms is gradual over a period of months or years. It's actually faster than I thought. But maybe they mean with years, many years. Repeated attacks of backache is in a healthy, fit person aged 20 to 45. That is a symptom. Okay, if a fit person, do they say, aged 20 to 35, has repeated attacks of backache or back pain. That is a symptom of ankylosing spondylitis. Early morning back pain and stiffness. This can radiate down one or both legs. That's interesting. I should talk a bit clearer. So differentiate more. Early morning back pains and stiffness can it have. So the people can have in the morning pain in the back and also a stiffness feeling in the back. And this can radiate down one or both legs. And also increasing stiffness of the whole spine, which may be revealed if the sufferer tries to bend down and touch his toes. Okay, the whole spine gets more stiff, and if a person tries to bend down and bend the spine, it can be noticed then that the spine is more stiff than usual. Tenderness over the hip joints. That is again interesting. Chest expansion may be limited. It would be also interesting. Spinal joints are the main one involved, but in some cases the shoulder, hips and knees may be affected. Okay, it can be also somewhere else, but it's mainly the spine. It can be also in shoulder, hip or knees. Duration, slowly progressive over many years, so it gets worse over the years. Causes, no definite cause has been isolated, but the condition sometimes runs in families. So no cause found. In the 80s, maybe something was found. Complications. In the long term, regional ileitis, ulcerative colitis, and certain heart defects may develop. Okay, the people can have regional ileitis, I don't know what it is. They can have ulcerative colitis, that is not good, and certain heart defects may develop also. That's also fair. Iritis, that is inflammation of the eye, can occur in 25% of cases. That is interesting. I like to know the cause of reason. It can cause iritis, and that is inflammation of the eye. A quarter is it. Long-term disease can cause the spine to become rigid. I don't know what rigid means. And this in turn leads to kyphosis. That is curvature of the spine, which with neck distortion can result in a crippling handicap. Okay, the spine can get rigid, whatever it means, and that can lead the spine to become curved. And that can lead to a problem with the neck and where the head is. And that whole can then affect the person who has it. Treatment in the home, none possible except under medical direction. So, this is the doctor always say. When to consult the doctor, immediately the disease is suspected. Okay, what the doctor might do, he or she may X-ray the lower part of the back and carry out a blood test to confirm the diagnosis. It can be diagnosed with a blood test. Now, what is in the blood to be found that something which gradually over the years makes the vertebrae and the spine grow together? Is it maybe the entrance to find a cure? I'm sure they have many people before me thought about it. So what are we doing? They are getting an X-ray of the lower back, and they carry out blood tests to confirm the diagnosis of ankylosing spondylitis. If the diagnosis is confirmed, refer to hospital as usual. So the people are sent on. Where are we going? They are going to a doctor, and when we refer to a hospital, where are we? If the pain persists despite treatment with drugs and the condition is getting worse, then radiotherapy might be tried. I skipped one, but let's continue. Okay, there can be treatment with drugs, but the condition can nevertheless go worse. Do the drugs work? And radiotherapy can be made. In early cases, the results are excellent, with the disease process being apparently arrested. I didn't know ankylosing spondylitis would be stoppable from progressing. More advanced cases with fixed deformity can also benefit from radiotherapy. Okay, and the one here was also, physiotherapy will also be arranged to strengthen the spinal muscles and mobilize the joints. Physiotherapy will also be arranged, I don't know if that makes sense. Physiotherapy will also be arranged to strengthen the spinal muscles and mobilize the joints. Okay, the people are doing exercises to strengthen the muscles at the spine and to mobilize the joint. This is why I want to mention so strongly that the next thing we want to do in 2 minutes has nothing to do with what we're reading. Not all specialists favor radiotherapy because it involves a risk of leukemia in about 3 cases in 1,000. 3 cases in 1,000. Now, this is actually pretty low, 3 in 1,000. That means the radiotherapy is either without much benefit. So, otherwise, the benefits would clearly outweigh the risk of 3 to 1,000. Yes, I think that's the conclusion. Prevention. Where there is a family history of a disease, tests can assist in early diagnosis, allowing early active treatment. That is, again, interesting. So, again, a disease which, if it is early detected, and I didn't know that ankylosing at all would be in any way, that something could be helped. The earlier the better. And if people have a training in the family, we might consult even earlier, make blood tests and check with an X-ray if people have it, so that they can get drugs to stop it from progressing. Outlook. For cases which are treated by anti-inflammatory drugs and radiotherapy in the early stages, the outlook is good. For cases in the more advanced stage, the combination of these measures can often restore the patient to a reasonable level of activity. I didn't know it was in any way at all treatable. But it seems to be. Now, that was the ankylosing spondylitis medical part. If you were here for medicine, you can go directly to the next part of medicine. And again, this was no medical advice. You can go directly to the next part of medicine. If you stay and participate in the next session, this has nothing to do with what we did just, which we're doing it anyway, then you can participate. But if you do so, then it's very on risk. We're having, what are we doing? We're having the next thing short of point one, and we're doing what we do tower. We're breathing in, lifting the arms up, and we're reaching the fingertips as far as we can to the sides. Breathe in and reach as high up as you can with the fingertips. Again down and reach as far to the sides as you can with the fingertips. And another time, breathe in, reach as far as you can with the fingertips. And again down, reach as far as you can with the fingertips. And now, we circle a little bit. Reach as far in front as you can with the fingertips. High up. Reach as far back as you can with the fingertips. Not just to the side, but also back and down as far as you can. And another one. Reach as far in front as you can with the fingertip. High up. Not just to the side, but also back. Reach as far as you can. And now the pose. Have the feet standing together. The arms up to the T. And pretend to fly around. And do the navigation. And that was the pose. Now to the next exercise. Have your legs standing good and stable, the shoulders wide apart, be torn up, shoulders back, breathe in. And breathe out, bring the head over to one side, only as far as it goes, just comfortable. Then breathe again in. And out and bring the chin down onto the clavicle. Breathe again in, lift the gaze, and turn the head over to the other side. Don't force anything, just as far as it goes, breathe again in. And out the head, down onto the clavicle. Breathe again in, lift the gaze, and turn it again over to the other side. Breathe again in, and now breathe halfway out, and then circle the head over to the other side. Breathe again in, and out and halfway out and circle it over to the other side. And back into the middle. Now we have hands together and the elbows together. Now breathe in and reach up. And out again down. Again in and up. And out and down. And next exercise, hands back, breathe in. And out, reach in front and bring the head down. In and back. And out and in front. And in and back. And the last time in front. In back, and down. And now the cashew. Have your feet same together, intertwine the fingers behind the back, tall up, shoulders back, breathe in. And breathe out to bring the head over to one side, on as far as it goes, and the chin down to the cloak. Breathe again in. And out, pull the hands down to the ground. Again, in, lift the gaze, and now turn it over to the other side. Only as far as it goes, shoulders back, tall up, breathe in. Bring the chin down onto the clavicle, breathe out, and pull the hands down to the ground. Breathe in, lift the gaze, and turn it back into the middle. And now stretch your Venus. Have the next centimeter on shoulder wide apart. Intertwine the fingers again behind the back, but now bring it over to one side. Tall up, shoulders back, breathe in. And out, turn the head over to the side with the hands up. And bring the chin down onto the clavicle. And pull the arm and the shoulder down. While you breathe. Breathe and lift the gaze and turn the head over to the other side. Hands over to the other side. Breathe again in, shoulders back. And out, chin down onto the clavicle. Breathe out, pull the arm and the shoulder down. Breathe and lift the gaze and turn the head back into the middle. Have the feet same together. One arm behind the back. Breathe and lift the arm up. Tall up. And breathe out, bring the head over. Don't pull at the head, just bring it over. Breathe again in. And out, look up to the hand on top of the head. And the hand down. Other hand behind the back. Breathe and lift the hand up. And bring the head over. Don't pull, just bring it over. Breathe again in. And out, look up to the hand on top. And down. Now have the feet standing still together. Breathe and lift the arms up. And we're doing the Markhor. Breathe out, go back, draw the shoulder pads together. Breathe and lift the arms up over across the intertwine the fingers, breathe and reach high. And breathe out, reach in front, hold the back. In and up. Out, lean back. Draw the shoulder pads together. In and up, intertwine the fingers again, the other way around if you're not able to. Breathe and reach high. And breathe out, reaching from all the way back. In and up. And out and back. Draw the shoulder pads together. Again up. Over across the arms and reach high, screw. And out and down. Over across the other way around. Breathe in, reach high. Out and down. Lean back with long arms for Skyhacker. In and the middle. And out and lean back. In and up. And out the arms down. And now the eagle's wings. Breathe and lift the arms up. Breathe out the arms down. In and up again. Out and down. In and up. Bring the hands to touch and lower the hands down to heart center. That was the next stretching. I thank you very much and until next time. Hi and welcome. I'm trying to learn medicine. Today, amblyopia, and after that, amnesia, and after that, medium plane training. And if you participate in medium plane training, that is at your own risk. We're talking about internal anatomy, internal eye anatomy, and diseases. And this is no medical advice, we're just reading about it. So amblyopia, we did it in the previous part. Amblyopia, that is one type of reduction in the sharpness of vision. In most cases, it is not caused by any disease of the eye, but is either hereditary or the result of an uncorrected squint in childhood. Amblyopia, I don't know how it's pronounced, but I think I stay with amblyopia. Amblyopia. Okay, we want to say something like amblyopia is reduction of sharpness in one eye. It is most of the times not caused by disease, but it is hereditary. In most cases, it is not caused by any disease of the eye, but is either hereditary or the result of an uncorrected squint in childhood. It is in most cases hereditary or the result of a squint during childhood, which was not corrected. of an uncorrected squint in childhood. In some cases, however, it is due to damage to the optic nerve that has been caused by excessive use of alcohol or tobacco, poor diet, or certain drugs. Treating the cause sometimes improves vision. Okay, amblyopia, that is reduction in sharpness in the vision of one eye. Reduction in the sharpness of vision. Reduction in the sharpness of vision. It is most of the times not caused through disease but hereditary, or the cause through result of an uncorrected, something it's just result of an uncorrected squint, or through an uncorrected squint during childhood. It can also be through due to damage excessive. We're using excessive. Let's try to use the word excessive as well. Through excessive intake of alcohol, tobacco, or also through poor diet or certain drugs. If the cause is treated, it helps in some cases to improve the situation. Amblyopia. Amblyopia. I'm going to start the camera and try to say that. Amblyopia is the reduction of sharpness in the eye. It is most of the times not through a disease, but hereditary or the result of an uncorrected squint during childhood. It can be also through an excessive intake of alcohol, tobacco, or poor diet. I personally just want to know what the fourth thing is. It's not really important, but what was the fourth thing? Certain drugs. Amblyopia. Amblyopia is the reduction of sharpness in the eye. It is most of the times not through disease, but hereditary or caused through an uncorrected squint during childhood. It can be also through excessive tobacco or alcohol intake, or through poor diet, or caused through certain drugs. If the underlying cause is treated, that can help to improve the situation. And that is according to Keith Hodgkin's Family Medical Advisor book, page 71, but this is no medical advice. I'm going to stop the camera, and when I remember, we're going to do amnesia. Amnesia. Loss of memory, either partial or total, that is so pronounced as to cause worry or problems for the sufferer. Es ist sie not right, amnesia. Now I'm thinking about it. There's some. Maybe I should just read on it, but maybe I should say it because we're also a bit speculating. There are some people who are losing over time, slowly, their memory. Would that then be in a clinical case called amnesia? Let's read on and maybe find it out. So amnesia is loss of memory that is either partial or total, that is so pronounced as to cause worry or problems for the sufferer. So I mean not just forget one fact, but forget a lot of things basically. It can be caused by a head injury and indicates the presence of concussion. See first aid. Okay, concussion, that is some problem after head injuries. I don't know exactly. I don't really know what the word concussion means. It's some problem which people can get at their head through a head injury. By the patient's emotional states such as hysteria. Maybe you shouldn't read first what's hysteria. Let's take one look what hysteria is. Hypertension, hypnosis, hypothermia, hysteria, hysterectomy. Hysteria, a condition in which the sufferer displays unusual behavior in order to attract attention or to avoid an unpleasant situation. It is brought on by stress in an immature person who is extremely vulnerable to suggestion. It is more common in women than men and may recur. Again, this book's from the 80s, maybe something more known. The term is also used to describe a situation in which members of a group exhibit a similar symptom for which no cause can be found. The symptoms are produced unconsciously, and the motives, although obvious to others, are not faced by the patient. I don't understand it. Almost any symptom can be caused by hysteria. ranging from pain to loss of sensation and loss of use of any part of the body. The response of a sufferer can range from great concern to sublime indifference to the symptom. Acute reactions can result in total loss of control over the emotions and loss of memory. Causes not known. The sufferer, unlike the deliberate melangeria, is unaware that his or her symptoms are not due to physical illness. Resolve the conflict or cause of the anxiety. Use firm reassurance with minimal fuss. Symptoms may be aggravated by both too much or too little sympathy. When you consult the doctor, on the appearance of any symptom that cannot be explained, as the doctor may discover a physical basis for the trouble. I don't really understand it, but I think that's not that out of the ordinary. It's some time of emotional unstableness. Okay, now what did we have here? Amnesia, loss of memory, that can be caused through a head injury and indicates the presence of concussion. See first aid. Or by the patient's emotional states, such as hysteria. Or by a number of illnesses, including alcoholism, meningitis, syphilis, brain tumor, and epilepsy. In retrograde amnesia, the victim loses his or her memory for events that happened before some injury or emotional shock. In anterograde amnesia, the loss of memory is for events that happened afterwards. So we're having a retrograde, that is events that happened before injury or emotional shock, and anterograde, events after this. In many cases of amnesia, the patient's memory returns with the passing of time or with the clearing up of the underlying condition. But if the cause is emotional disturbance, this could mean that the mind subconsciously wishes to erase some occurrence that is too distressing to contemplate, and psychiatric help is needed. I think I know what we're indicating, but I want to know a bit more about it actually. But that is not part of medicine, I think. That would be part of criminology. Now, that was the medicine part. We don't have time left to talk about it again. Amnesia, we're going to return to amnesia in the next part, when you remember. Now, that was medicine. If you were here for medicine, you can go directly to the next part of medicine. And then we will do probably amnesia. If you stay here and participate in the leg injury prevention training, then is that at your own risk. We're doing medium leg training. We're bringing one leg up. If you participate in the leg, one leg up, pull the leg up, point with the toes down, and relax the leg. And the other leg. Pull the leg up, point the foot down, and try to relax the leg. And the next exercise. Now we're having the leg standing around, hip width apart. We're going down a bit down. And now flex the muscles of the upper legs. And now straighten one leg. Completely straighten it completely. Keep a flexing, keep a contraction. And bend it again. Bring it down again. And keep a flexing. And straighten the other one. Flex both legs. And back, flex them. Bring the rhythm. And come up. And now something similar. A bit wider apart. A bit down again. Flex again, relax. Pull, press them here together. And go over to one side a bit. Straighten one leg. Keep pulling them together. Flex or contract the muscles. And over to the other side. Straighten the other leg. Pull them together the whole time. And contract the muscles. And in the middle. And up again. For complete distance also. Push a bit to the outside. Okay, next exercise. One leg up. And press from the top against the knee. Right angle of the leg, flexed foot, even line hips, taller with the back, little bend in the elbow. Then you can do it with a lot of pressure or a bit easier. Now, with the other leg. And again, the first leg up, and now press from the inside. Right angle of the leg, flex foot, even line hips, taller with the back, little bend in the elbow. And again on the other side. And to the next exercise. Leg again up, and now press with the knee up and to the side. You can do it also again with a bit more force. And with the other leg up, it's up and to the side. And the last exercise, the heavy swing though, one leg again up, press from the outside and up slowly. And closing. And another time. Keep pressing one more time. And close again. And the other leg up. Press on the outside and up slowly. And close again. Open again. And close again. Bring the leg again up and pull the leg up on the foot down. Relax the leg. Other side, pull the leg up on the foot down. Take the leg at the ankle. Make a straight back, point the knee down to the ground. The other leg. Make a straight back, point the knee down to the ground. Next one, out, breathe in, cut out. And breathe out. Again. And out. Breathe in, close the legs. And breathe again out. That was a medium plan training. I thank you very much. Next time. Hi and welcome. I'm trying to learn medicine. Today, amnesia, and after that, amnion, and after that, leg injury prevention training. And if you participate in the leg injury prevention training, that is at your own risk. I'm talking about internal anatomy. Yes, mostly that. And this is no medical advice, we're just reading about it. Amnesia, this is part 2 of amnesia. Loss of memory, either partial or total, that is so pronounced as to cause worry or problems for the sufferer. Maybe just going to use the word severe, and people understand that they don't just mean forgetting the word for something. Okay, partial or total severe memory loss. It can be caused by a head injury and indicates the presence of concussion. It can be caused through a head injury and implicates concussion. Indicates concussions. By the patient's emotional states such as hysteria, or by a number of illnesses, including, it can be also during someone having the emotional state of hysteria, maybe express it like that, and other illnesses like alcoholism, meningitis, syphilis, brain tumor, and epilepsy. Alcoholism, meningitis, syphilis, brain tumor, and epilepsy. Alcoholism, epilepsy. Let's try to have them order. Alcoholism, meningitis, syphilis, brain tumor, epilepsy. Okay. Let's go on. In retrograde amnesia, the victim loses his or her memory for events that happened before some injury or emotional shock. In anterograde amnesia, the loss of memory is for events that happened afterwards. Okay. Retrograde, before. Anterograde, for memories happening after an event of injury or emotional shock. Let's try to mention that clearly there, but we have it somewhere mentioned as well. In many cases of amnesia, the patient's memory returns with the passing of time or with the clearing up of the underlying condition. Okay, we try to say both things. In many cases, let's use many cases, the words here also. In many cases, let's try to use many. In many cases, the situation clears up. In many cases, the memory returns with passing of time or with upclearing of the underlying condition, or when the underlying condition goes away. Okay. But if the cause is emotional disturbance, this could mean that the mind subconsciously wishes to erase some occurrence that is too distressing to contemplate, and psychiatric help is needed. Let's mention that somewhere at the end. If the cause is emotional disturbance, if the cause is emotional, and if the cause is an emotional disturbance, it could be that the mind tries to erase or forget a memory, subconsciously. Tries to erase or forget. Maybe we should mention actually the name subconsciously. If I understand correctly, it means not consciously, so not try to do it. Subconsciously to erase an occurrence. Maybe psychiatric help is needed. Okay, I think I have it all together. Amnesia is total or partial severe loss of memory. It is oftentimes, it can be caused through a head injury and can implicates or indicates a contact. There's the difference. It implicates a concussion, and it can be also it can be also if someone has a state of hysteria, or as part of other illnesses like meningitis, brain tumor, epilepsy, alcoholism, and syphilis. And yes, the thing it returns. Retrograde injury. And there's the retrograde anemia, that is when the events before the head injury or whatever happens, or the emotional shock happens, I forgot, or anterogate when the events after it. And if the cause is emotional disturbance, then it can be that the mind tries subconsciously to erase an incident, and maybe psychiatric help is needed. Let's try to make it. I have a second camera of it. Amnesia. Amnesia is partial or total severe memory loss. It can be caused through a head injury and can implicate a concussion. It can be also if someone has the emotional state of hysteria or along of other diseases like alcoholism or meningitis, syphilis, brain tumor, or epilepsy. There is a retrograde amnesia, where the events before the head injury or whatever, or emotional shock happening, I forgot, retrograde before, and anterograde afterwards, the events I forgot. If the cause is emotional disturbance, then it can be that the mind tries to subconsciously erase an incident, and then maybe psychiatric help is necessary. And this is according to Keith Hodgkin's Family Medical Advisor book, page 71, but this is no medical advice. I'm going to stop the camera. And we are running. Amnion. Yeah, we're talking a bit about internal anatomy. Amnion, the membranous sac which encloses the fetus in the womb. Okay, that is the membranous sac. Is it on? Maybe we get it a bit better. Inside the sac, the fetus floats in and is concussioned. Is cushion. Concussion. But here it's written with SH here. CUSS. It is very softened so that it does not get a concussion. And is cushioned by a liquid called amniotic fluid. Okay, nothing else written where it is now exactly. So the amnion is the name for the membranous sac inside of which the uterus is during pregnancy. Inside which the fetus is during pregnancy. I think it's the other way around, but I don't really want to talk about it because I don't know that I don't want to say it wrong. I think the uterus is to the outside and the amnion is in the inside. And in that is the amniotic fluid with the fetus. Now, the bursting of the amnion and release of the fluid usually signals the beginning of childbirth. Okay, the amnion is bursting and now this amniotic fluid is coming out, and that usually, if it happens at the right time, means that the child is shortly before parturition. When there is a risk that a fetus may be suffering from spina bifida, Down syndrome, or a rhesus vector problem, or one of certain other abnormalities, a sample of amniotic fluid is withdrawn from the womb through a hollow needle, amniocentesis. The cells of the fetus in the fluid are then examined for evidence of the abnormality. Now, the book is from the 80s. Maybe some things are already better known, but they're saying here that there is the possibility, the medical possibility of an amniocentesis, and there through a hollow needle, a bit of the amniotic fluid is extracted to analyze it. Okay, we could actually do it. The informations are not that many, but we want to do leg injury. That means we're going to do a second part to amnion, and where we try to make a presentation just as we did it to the amnesia. That was the medical part. If you were here for medicine, you can go directly to the next part of medicine. We're going to do now the leg injury prevention training. If you stay and participate in the leg injury prevention training, please let it your risk. We are standing good on one leg and we're swinging the other leg with a flexed foot in the front and to the side. And the other leg swing at the front and to the side. And again, something similar, one leg comes in front and back. And one for the front and back. And now to the next exercise. Bring one leg up and the hands out, the direction way, breathe in, and out and go with the hands over to one side. Into the middle and over to the other side. The middle and now over with the hands to one side and with the leg over to the other side. The middle and down and down. Now, other leg up, hands out, and go with the hands over to one side. And to the other one. So middle and both over. So, both over. And down. And now, breathe in, lift the leg up, pine pilcrow, breathe out to the side, breathe again in, out into the middle, and down, and the other leg up, breathe in, out to the side, breathe again in, out into the middle, and down. And now the next exercise. Which one? The wildcatter. Stand good on one leg, turn over to the leg, this exercise can go to the knee, go down, turn over to the other side, and come up again. Maybe a bit slower. Stand good, turn over to that leg, go down, turn over to the other side, and come up again. And with the other leg, stand good, turn over to that leg, go down, turn over to the other side, and come up. And another time, stand good, turn over, go down, turn to the other side, and come up. And now, leg up and press with the knee up and to the side. Other leg up and press with the knee up to the side. And now the clock. Stand good. This can go again on the knee. Stand good on one leg and go in to all the 90-minute intervals on the clock style. Go every time a bit down with him. And now with the other leg. Go to 12 o'clock and 1:30 and over to 3 and to 10:30, 9 and also to 10:30. 7, 6 and a half plus 4 and 3. And now the next exercise, the pad. Don't do it if you're pregnant. Have a good standing leg, the other leg with the heel onto the ground, and put that heel off the ground and place it on the ground. And on the other side, heel onto the ground, lift that heel off the ground and place it again on the ground. And now, a step, leg up and again down. Other leg up and down. And next exercise, one hand on tummy, one on lower leg, and lift the leg in a straight line up. If the quad muscles cramp, then pull the leg up and point with the toes down. So bring the leg up. Control with the hands, but you don't fall back. Flex foot, try to bring the leg higher. And pull the leg up, point with the toes down, and relax the leg. Other leg. One hand on tummy, one on lower back, and lift the leg up. Control with the hands, but you don't fall back, and try to bring the leg with a flexed foot higher. And pull the leg up, point with the toes down, relax the leg. And let's do the horse. Leg in and out, in and out. And with the other leg in and out. And ending. Last exercise, legs wide apart, breathing around. And breathe out. Out. Breathing across the legs. And breathe again out. That was the leg injury prevention training. I thank you very much, Intermixer. Hi and welcome. I'm trying to learn medicine today, Anoxia, and after we've done it, we're going to do extensor carpi ulnaris strength training. And if you're participating in the extensor carpi ulnaris strength training, then it's better your own risk. Now, but first, Anoxia. Anoxia is, and this is no medical advice, we're talking about the blood system and internal anatomy, and this is no medical advice. Anoxia is an insufficient supply of oxygen to the tissues of the body. In anemic anoxia, the reduction in the supply of oxygen to the tissue is caused by deficiencies in the constituents of blood. There may be a shortage of red oxygen-carrying blood cells or a fall in the chemical makeup of hemoglobin. We had anemia in quite some parts already, but that was not mentioned. We had iron deficiency anemia, there was not enough iron. We had paniceous anemia, there was not the enzyme to get vitamin B12 out of food to make the hemoglobin, and we had sickle cell anemia where the hemoglobin was deformed, and if a person was making sport or something, when the cells was deformed, it would be when attacked by the autoimmune system or by the immune system or by the body, and therefore destroyed, and now we are not enough hemoglobin to transport oxygen. And we had megaloblastic anemia where the fatty acids missing, folic acids were missing. Now, and we have now anemic anoxia. That is just any type of anoxia which is caused because there's some problem with production of the hemoglobin. I think we can say that. Okay. Sometimes anoxia is said to be stagnant, in which case it is the result of general or localized slowing, stagnation of circulating blood. Stagnant, in which case it is the result of general or localized slowing of circulating blood. Okay, there can be anemic, is it anemic? Anemic anoxia, that is when anoxia caused. caused through a deficiency in the hemoglobin cells, which are normally transporting the oxygen to the body. There can be stagnant anoxia, where for some reason in the circulation of the blood is slower. It is more stagnant. Was it? It is the result of general or localized slowing of circulating blood. I think, as I said, it would be okay. Stagnant anoxia may be caused by problems such as heart failure, shock, the blockage of the blood, shock, blockage of a blood vessel in thrombosis, or a spasm of the muscular wall of a blood vessel. The muscular wall of a blood vessel can have a spasm. Is there a type of disease or disorder by which people have it permanently? Okay, stagnant anoxia can be caused through heart failure, shock, blockage of a blood vessel through a thrombosis, or a spasm in the muscular wall of a blood vessel. Okay, deficiencies in the respiratory system may also cause anoxia, and in this case, anoxia is just again the thing is with anemia. There is iron deficiency anemia, but not every anemia is iron deficiency anemia. And there is iron deficiency, but not every iron deficiency is iron deficiency anemia. And now we have anoxia. Anoxia can be because there are not enough hemoglobin transporting the oxygen, but it can be also a problem of the lungs not having enough oxygen. Now, deficiencies in the respiratory system may also cause anoxia, and in this case, your condition is known as anoxic anoxia. Anoxic anoxia. Okay, we're having anemic anoxia. If we have hemoglobin missing, we're having anoxic anoxia, where the oxygen is for some reason missing in the respiratory system. And the other thing was stagnant, where circulation is closed. There can be heart failure, or the muscles of the blood vessels are crimping. And we have, I'm going to get back on it, and we're having shock. And one other one, thrombosis, blockage of the blood vessel through thrombosis. And the other thing was spasm of the muscular wall. What's the difference? Spasm. Maybe we're going to come to it. Spasm. Okay, deficiencies can be called anoxia. Sufferers from chronic bronchitis, for example, often have a degree of anoxia because the amount of lung tissue available for the exchange of oxygen and carbon dioxide during breathing is reduced. Okay, let's look if you're able to say the explanation. The amount of lung tissue available for the exchange of oxygen and carbon dioxide is reduced. Okay, people who have chronic bronchitis may also have anoxia because the amount of lung tissue available to make the oxygen carbon dioxide exchange. To make the oxygen and carbon dioxide exchange. Possibly is reduced. Anoxia may also be caused by an asthmatic attack. Would that be shock? For an asthmatic attack, where the airways are constricted, or by weakness or disease from muscles that are used in breathing. Okay, two more things. It can be also part of an asthmatic attack, because the airways are constricted. It can be caused by an asthmatic attack because the airways are restricted, and it can be because the muscles necessary for doing the breathing are constricted or weak. Okay, because they're weak. What disease of the muscles or weak? More rarely, the condition may be a result of reduced oxygen content of the air that is breathed as at high altitudes. I think I heard, because I just thought of it, that there are some type of toxins which can cause the breathing muscle to not work. Some snake poison still. Okay, we have it all together. This is part 2. Let's try to do the presentation. We having anoxia, that is insufficient blood, insufficient oxygen supply to parts of the body. There's anemic anoxia, there's not enough hemoglobin. There is a stagnant anoxia, where for some reason the circulation is not properly running. It can be partly over the whole body. It can be general or localized. It can be through heart failure, shock, spasm of muscular walls of a blood vessel, thrombosis, blockage through thrombosis, blockage of a blood vessel through thrombosis, through thrombosis. Other reasons are the anoxia, that the respiratory system is not getting enough oxygen. That can be because a person has a disease or weakness of the breathing muscles. It can be because a person is in high altitude, on high mountains, there is not enough air. It can be because a person has an asthmatic attack and then the airways are restricted, and people with bronchitis can have it. If it's one or two things too much to remember all to list them. But how about we just try it? I'm going to start the second camera. Anoxia. Anoxia is insufficient oxygen supply to a part of the body. It can be anemic anoxia. The reason is that there's not enough hemoglobin or functioning hemoglobin which would transport the oxygen to the body. There can be stagnant anoxia, where for some reason, generally or localized, the circulation is slowed down, not running properly. And that can be because of heart failure or thrombosis in the blood vessel, or shock or spasm in the muscular walls of blood vessels. It can be also part of an asthmatic attack where the airways are constricted, that is when anoxia. So anoxia, there's not enough oxygen through the respiratory system for some reason, which could be an asthmatic attack where the airways are restricted. It can be also because a person is at high altitude on a mountain, there's not enough oxygen in the air. It can be also a part of bronchitis, people with chronic bronchitis, because when the amount of lung tissue available to make the oxygen carbon dioxide exchange is not enough available of it. And that is according to Keith Hodgkin's Family Medical Advisor book, page 76. Now, what did I forget? Disease of weakness of the muscles. I have just time for one more take. I'm not going to do it. I'm going to stop the camera. And that was the medical part. That means we have to keep that one thing in our brain, that it can be disease or weakness of muscles during the breathing, of the diaphragm or something. Where I said there's snake poisonings, I think snake toxins, which can affect that. These muscles don't work. Anyway, and then the person suffocates. Now, that was the hepatology part. That was the medicine part. If you were here for medicine, you can go directly to the next part of medicine. If you stay here and participate in the extensocarpal ulnar strength training, then it's with the arms. We're having a good stand, always with these exercises. We're having the arms next to us, hands from the fists, and we're bringing the fists down. If you participate in the arms, and we're bringing the fists down, and again down. A flat gait. Hold it a bit, and again down. We have 3 rules. The first rule is that we're stopping immediately as soon as there's pain. The second rule is that we're going only as far as we can go with a little bit of effort. We're not pushing anything. And the third rule is, for the next exercise, we're having now again fists, counterfeit money check, and bring them up, and again down. And the third rule is, we do not overdoing it. We just want to strengthen, not to exhaust. And now to the next exercise. I'm using a sock, you can also use a sock. Now, press with moderate good force onto the sock or whatever, or t-shirt or whatever, and bring the fist down. And again up. And try to bring it higher the whole time. So just bring it there, so not bring it higher. And press with the whole hand evenly, with the 4th and 5th finger as well. And the last time up. And on the other side. Press with moderate good force and bring the fist. Again down. And again down. And our next exercise. Press again with good force and turn the hand to the outside. With all 5 fingers evenly pressing and to the inside. Only as far as it goes, but bring it so far. Now with the other hand, press again with good force and bring it to the inside. To the outside. Again to the inside. Let's do it one more time. And when I'm just thinking about it, the hand getting white and pressing. What would be that? Now, and when the last exercise, just press with one more in that position and bring the hand down. And again up. Blockage of the blood, but not forward. And again up. And on the other side, press again and bring it down. And again down. And one more time. And now press just in neutral position. And on the other side. And last exercise, the floor. Just go with moderate force over the middle part of the floor. And on the other side. That was the extensor carpi ulnaris strength training. I thank you very much, and in the next time.